Order, order. Question to the Secretary of State for Health and Social Care, Andrew Back.
Number one, sir.
Mr Speaker, the UK Government works closely with the Scottish Government to provide a coordinated approach to the response to COVID-19 for the benefit of people across Scotland and across the United Kingdom. For instance, the UK Government has provided the Scottish Government £1.2 billion in Barnet funding in the 2021 budget, in addition to the UK Government procuring over 500 million vaccines for the whole of the UK and making sure that our testing programme reaches all parts of the UK. This is a partnership in which the people of Scotland benefit hugely from the reach and the strength of the UK Government.
I thank my right honourable friend for that answer. It's becoming clear across the entire of the United Kingdom that our NHS is facing a huge challenge as we reopen society to deal with the thousands of delays, procedures, treatments and operations that have been delayed due to lockdown. What steps is my right honourable friend taking to ensure that the National Health Service in England, Scotland, Wales and Northern Ireland are able to work together as easily as possible, share resources and services, so as to ensure that this truly national health service for our whole country will support delivery to support our constituents wherever in the United Kingdom they might live?
Well, quite right. The NHS is one of Britain's proudest achievements, and it operates across the whole of Great Britain, and cooperation is ingrained in the DNA of the NHS, and I am absolutely determined, as the UK Secretary of State for Health and Social Care, to make sure that wherever you live in this United Kingdom, you can access the very best of care. So if a constituent of my honourable friends in Aberdeenshire needs a treatment that is only available in England because it's so specialised, then they should have absolutely every right to that treatment, in the same way that a constituent of mine in Suffolk, or indeed of my honourable friends in North Wales. We have one NHS across these islands, and it's one of the things this country is most proud of.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thank you, Mr. Speaker. I'm sure the Secretary of State is well aware that the Scottish NHS has been separate since 1948 and has been under direct Scottish Government control for the last 20 years. So there's actually 4 NHSs. Perhaps I can ask the Secretary of State about some of his decisions that have made it harder for the Scottish and other devolved governments to fight COVID. Last September, he refused to follow sage advice for an urgent lockdown, and the 6-week delay allowed the more infectious B117 Kent variant to emerge and spread across the UK, driving a second wave more deadly than the first. He has repeatedly claimed to follow the science. So can he explain why he didn't follow scientific advice last September?
Secretary of State.
Thank you very much, Mr. Speaker. Just on this point, this attempt at division within the NHS is deeply regrettable. Deeply regrettable. It's not what people want. It's not what people want in Scotland. It's not what people want anywhere across this country. The NHS is an institution we should all be very proud of. Of course, it is managed locally. It's managed locally across parts of England. It's managed under the devolution settlement in Wales and Scotland, and health services in Northern Ireland, rightly so. But it ill behoves politicians to try to divide the NHS. It is a wonderful institution that should make us all proud to be British. On the specific second question she asked, of course, we are guided by the science and take all factors into consideration. These are difficult judgments based on uncertain data, and we make the best judgments that we can, and that is still the process that we're going through, in the same way that the SNP government in Scotland has recently opened up parts of the rules in terms of social distancing in Scotland. Despite the rising cases, we face a challenging decision ahead of the 21st of June, but that decision is made easier, and indeed the decision to open up is only possible because of the UK vaccination effort. And today marks 6 months to the day since Margaret Keenan was the first person in the world to receive a clinically validated vaccine in Coventry, the same day as Scotland, same day as Wales, and since then we've delivered 60...
Order. It's not a statement. It's an answer we require. Second question, Dr. Philippa Whitford. Philippa.
I think the Secretary of State would find that most people in Scotland were rather glad that their NHS did not come under the Health and Social Care Act fragmentation of 2012. But having ignored the Scottish Government's call in February for all arrivals to undergo hotel quarantine, he then delayed adding India to the red list. This allowed the more infectious Delta variant, which one dose of the vaccine is less effective against, to enter and become dominant in the UK. Is he not concerned that if he removes all social distancing completely in the near future, this variant will cause a COVID surge among those who are not fully vaccinated?
Secretary of State.
As I was saying, Mr. Speaker...
Maybe not.
Touché, sir. Touché. In response to the question put by the Honourable Lady, what I'd say is this. The opening up and the return of our freedoms is only possible because of the UK vaccination effort. And in the 6 months to the day since we first vaccinated across these islands, yes, in Coventry, but also in Scotland, in Wales, in Northern Ireland, starting 6 months ago today. Since then, we've delivered 68 million vaccines across the whole UK. We've saved thousands of lives, and the whole of the United Kingdom has been set fair on the road to recovery thanks to the UK government's vaccination effort. I'm very grateful to everybody in Scotland, in Wales, in Northern Ireland and in England who's played their part in delivering it, and that shows the benefit of the United Kingdom Union saving lives, working together for everybody on these islands.
Substantive question to the Minister.
With your permission, Mr. Speaker, I will take questions 4, 5, 6, 7, 8, 9 and 10 together. I am hugely ambitious about social care reform. I want a sustainable care system that meets people's needs and aspirations and gives them the care and support they need to live life to the full. We are working on proposals for reform and will bring these forwards later this year.
Go to Carl Turner. Carl.
Thank you, Mr. Speaker. This government is responsible for over 40,000 needless deaths from COVID-19 in care homes, and a plan to fix social care in this country is long overdue. But this crisis isn't new. People are routinely forced to sell the family home to pay for care. The workers are paid peanuts, while over 13 million unpaid carers are left to pick up the pieces. So does the Minister agree that we have had far too many vague promises and that unpaid carers cannot wait a minute longer?
Minister.
Thank you, Mr. Speaker. Well, I agree with the Honourable Member that there are many challenges indeed for social care, and that is one reason why, in fact, many governments have talked about social care reform. As he will understand, over the last year we have rightly focused on supporting social care through the pandemic, but we are working on our proposals for reform and will be bringing these forward later this year.
Let's go to Christine Jardine. Christine.
Thank you very much, Mr. Speaker. Almost 2 years ago, the government promised to fix social care once and for all. But we've seen in this pandemic that it is still seriously broken. Care doesn't stop at the hospital exit or the GP's door. Carers have sacrificed physical and mental health caring for loved ones during the pandemic. 72% with no break and 44% say they're at breaking point. So in this National Carers Week, can the Minister commit to cross-party talks in the immediate term to fix the social care crisis throughout the UK?
Well, this week, as she says, is Carers Week, and it's a really good opportunity to raise awareness about carers, the important role that carers play supporting loved ones, and also to remember something that I personally am committed to is not only that we must support carers in the care that they do, but also to live their own lives, for which, for instance, respite care is really, really important. As part of our reform for social care, we are, of course, listening to carers and want to make sure their needs are met as part of these reforms.
Thank you, Mr. Speaker. In July 2019, the Prime Minister stood on the steps of Downing Street and pledged to fix the broken social care system. 2 years on and we're still waiting. Wise words were only mentioned in the Queen's speech a couple of weeks ago to say proposals on social care reform will be brought forward. So can the Minister explain when you will move from the rhetoric to more words and bring reality to fix this broken system for the people that you've just mentioned that need it desperately?
Well, I welcome her support and interest and that of others across this House for social care reform. As she said, we know that social care reform is needed. We have rightly, over the last year, focused on supporting social care through the pandemic, getting £1.8 billion of extra funding to for social care to the front line, providing billions of items of PPE, over 100 million tests to social care, and the vaccination programme, of course, to care home residents, those who receive social care, and the workforce. And we are working on our social care reforms, and we will bring those forward later this year.
Dougan.
Thank you, Mr. Speaker. Many in this place and across England will be asking where is England's long-awaited social care bill, because they'll see in Scotland that the SNP government are delivering a new deal for the social care sector, building a new national care service that will improve worker conditions and standards of care, and increasing investment in care by 25%. So will the UK government follow Scotland's lead in transforming social care, and will the Minister contact Scottish Government ministers to learn from our experience of over a decade of integrating health and social care?
Well, one of the great strengths of our United Kingdom is to be able to work together and to learn from different parts of the UK, and also, in fact, to look at the best within. We look at the best within England, we look at Wales and Scotland, Northern Ireland, of course. He also mentions the care workforce, and that's something I want to touch on, because as part of our social care reform plans, we absolutely want to make sure that the workforce is front and centre of those and receives the training, the opportunities, the recognition and the reward that that important workforce deserves.
8 withdrawn. We go to Mike Ainsbury.
Thank you, Mr. Speaker. The government have had 11 years to reform social care, cut £8 billion out over that period of time. It's fragmented, it's costly, it doesn't value workers and employees. Isn't it time that the Minister and the government grab the bull by the horns and introduce a national health and social care service? When a reform is going to come into play? What day? What month? What year?
Well, actually, it's not just the period that he mentions that social care reforms have been talked about. It goes back at least 25 years when Tony Blair was leader and Prime Minister, and he talked about reforms to social care. But he's also said it's not simple. These are complex problems to address. When people talk about social care needs fixing, different people mean different things. That's why, as part of our reforms, we're going to bring forward a long-term plan for reforming social care.
Dame Diana Johnson.
Can I just say to the Minister that I think most members of the House of Commons will find her attitude incredibly complacent on one of the key issues that face most families in this country. Now, as my honourable friend has just said, there's been an £8 billion cut to social care since 2010. One of the steps she could take straight away is to reinstate that £8 billion cut to local authorities so they can at least provide services now for the social care system that we have.
I'm actually quite disappointed by the language that the honourable member uses, and I have huge respect for her in many areas that she works in, and she will appreciate that together with the department and actually with the local authorities and the care sector, we're working hard on how to bring forward the right package of reforms for the system. We have actually already taken some of the first steps on that road. For instance, in the Health and Social Care Bill, there are plans to introduce strengthened oversight for the social care system, which is an important step, but that is the beginning, not the end, of the social care reform road.
Mr. Campbell.
Thank you, Mr. Speaker. 685 days ago, the Prime Minister promised to fix the crisis in social care, to give every older person the dignity and security they deserve. Since then, more than 32,000 elderly people have died from COVID-19 in care homes. Millions of care workers and families have felt abandoned and pushed to breaking point. And 300 elderly people have been forced to sell their homes to pay for their care every single week. Does the Minister think that's giving people security, let alone dignity? And will she tell the country, after more than a decade in power, specifically, when will her government deliver?
Thank you, Mr. Speaker. What I will say after the enormously difficult year that social care has had through the pandemic is that indeed it has strengthened the already strong case for reform of social care. And I will say to her that I want us to have a better social care system, whether it's for our grands and granddads, our mums and dads, our brothers and sisters, our children and grandchildren, or indeed, as and when we need it, for ourselves. We have a once-in-a-generation opportunity to reform social care. Now is the time, now is the moment, and we will seize this opportunity, and we will be bringing forward proposals for the reform of social care later this year.
Mr. Speaker.
Thank you very much indeed, Mr. Speaker. My ministerial colleagues and I are in regular contact with the Food Standards Agency on matters of common concern.
Thank you, Mr. Speaker. Next week, the Food Standards Agency will be producing its annual report and holding its annual general meeting. That report will likely recommend some significant changes regarding live bivalve molluscs, which has a huge impact on my own constituency and indeed the health of the nation for those who eat seafood. Can she commit that any changes recommended in the report next week will be brought forward in record time so that the changes may be implemented quickly and that we could secure the future of the seafood industry in the United Kingdom?
Thank you, Mr. Speaker. And a change to be talking about a different sort of muscle in this place during health questions. The Minister for DEFRA and I are well aware of the challenges currently facing the shellfish industry, and I thank the Honourable Member for Totnes for his dogged determination, but especially those businesses who rely on exports. We will continue to work closely with the FSA. I know they've been working hard to resolve these issues and make progress, and I have been advised there is potential for change. To ensure that classifications are awarded in a proportionate and pragmatic way while continuing to ensure high levels of public health protection, I can assure him I will continue to work closely with them and my colleagues in DEFRA.
My substantive question, Mr. Speaker. Thank you.
Thank you, Mr. Speaker. Well, I'm grateful to my honourable friend, not least for providing me with the only opportunity to answer a question on the order paper today. I am delighted to confirm St Anne's Hospital in Dorset is already part of our plan to build 48 hospitals by 2030, the biggest hospital building programme in a generation. The new build at St Anne's will provide child and adult mental health services to the people of Dorset, resulting in outdated infrastructure being replaced by facilities for both staff and patients that are at the cutting edge of modern technology, innovation and sustainability, driving excellence in this hugely important area of patient care.
Crystal.
Thank you, Mr. Speaker. Can I thank the Minister very much indeed, and particularly thank him for all his hard work in reopening the Yetman Hospital in Sherborne, which will happen in a couple of weeks' time for the A&E. Can I just say to the Minister, or ask him, on top of what he's offered already, and I very much appreciate it, would the Minister commit specifically to increase the inpatient provision for children and young people who have severe mental health difficulties in West Dorset, as we have a number of those difficult cases?
Thank you, Mr. Speaker. Well, I know my honourable friend takes close interest in these matters. As he will know, the number of places commissioned is a matter for NHS commissioners locally, but I can reassure my honourable friend that we can commit, and indeed my honourable friend, the Minister for Mental Health Services, is committed to expanding and transforming community mental health services across England, boosted by an additional £79 million this year, so that children and young people get timely access to the support and treatment they need without having to be admitted to hospital, alongside, of course, the investment I've referred to in inpatient mental health facilities at St Anne's.
Ian Levy.
Thank you, Mr Speaker. Number 14.
Minister Doris.
Thank you, Mr Speaker. With permission, I'll take question 14, 15, 16 and 17 grouped together. We're transforming mental health services through the NHS long-term plan, investing an additional £2.3 billion a year by 23-24. Where national waiting time targets exist, the majority are being met. Targets for eating disorder services, sadly, are not being met, but additional resources have been allocated to increase capacity and to address waiting times. We're working on the consultation responses for the Mental Health Act White Paper and will bring legislation forward when parliamentary time allows.
Ian Levy.
Thank you, Mr Speaker. After a career working in mental health for almost 30 years prior to entering this House, I was delighted to be asked to become a board member for a local charity, Anxious Minds. They're based in Blyth in the town centre, and their aim is to improve mental health well-being for local people. Would my right honourable friend assure me and those who worry about the toll that this pandemic has had on the vulnerable that she will do everything she can to ensure that mental health is given the highest possible priority as restrictions begin to ease?
Minister.
Thank you. First, I would like to thank my honourable friend for his years of service of working in mental health. Mental health is one of this government's top priorities, and I can assure you that we are doing our utmost to ensure that mental health services are there for everyone who needs them. Through the NHS long-term plan, we're expanding and transforming mental health services in England and investing an additional £2.3 billion a year in mental health services by 2024. In addition, we have published our Mental Health Recovery Action Plan, backed by a one-off targeted investment of an additional £500 million to the £2.3 billion to ensure we have the right support in place this year. The plan aims to respond to the impact of the pandemic on the mental health of the public, specifically targeting groups which have been most impacted. We have set up a cross-government ministerial group to monitor progress against the actions listed in this plan, and the group will also identify areas for further action and collaboration.
Thank you, Mr Speaker. And can I welcome the priority put on young people's mental health, more important now perhaps than ever. And can the Minister give an update on progress on implementing the proposals in the Children and Young People's Mental Health Green Paper, and particularly on mental health support teams in Hampshire and nationwide?
Minister.
We are making good progress on implementing the Green Paper proposals, and I'm pleased to say that we've established 11 mental health support teams in Hampshire. Nationwide, there are currently 180 mental health support teams covering around 15% of pupils in England. Over 200 more are in training or being commissioned, and we expect to have around 400 in place by 23-24, covering 35% of pupils. We recently announced £9.5 million to train thousands of senior mental health leads from school and college staff.
Thank you, Mr Speaker. Last year, in my NHS Trust, 37% of children referred to mental health services were turned away. That's up from 28% the year before. That's 2,649 children not getting the treatment despite referrals from professionals. This will be exacerbated, of course, by the acute children mental health unit at Ticehurst being shut and no new hospital provision commissioned. It's not just Sussex Partnership which is failing, it is across the country. In 2019, 140,000 children were turned away from CAMS, and some experience exceptionally long waits. Is the Minister comfortable with these huge numbers of children being turned away from treatment? Does she think these waiting times are acceptable? And what message does she have to those children and families that don't receive the treatment that they desperately need?
Minister.
Mr Speaker, the short answer to that question is no, and that is the reason why we have committed an additional £500 million to address the issues that he has, some of the issues that he has highlighted. But I must reiterate, The majority of our targets, where they've been set, are being met. Sadly, in eating disorders, I hold my hands up, we are not meeting the targets that we want to. But we are trialling, as I think you may be aware, the four-week waiting targets for children and young people. And the results of that review and that pilot will be available soon. And we can look at, and we continue to look at ways when you can increase access to services for children and young people, including, and children and young people have told me this themselves via organisations such as Barnardo's, that they want their mental health services delivered in a different way to them now. They don't want to go and sit in a village hall or a hospital or wherever they may be receiving their services from by community practitioners. They want their services, some of them delivered via their phones, their laptops or their computers. Obviously, one-to-one services have to be available where they're needed, but children and young people are demanding a change, and we're going through that change now.
Shadow Minister Dr Olling.
Thank you very much, Mr Speaker. The member for Brighton Kemp Town raises a very important point, and quite frankly I'm shocked that the Minister seems so relaxed about it. Across the country there are numerous children who have waited over 400 days for help with autism, 280 days for PTSD, 217 days for suicidal ideation, 195 days for treatments after an overdose. I could go on and on. Children shouldn't have to wait so long for treatment. It will have a scarring impact on their development. These simply are not acceptable. So I ask the Minister, will she apologise to these children? And can she explain where it went so wrong?
Minister.
Mr Speaker, I do not believe that meeting almost all of our targets in NHS waiting times for mental health services. I do not believe that £2.3 billion a year of investment into our NHS. I do not believe that no NHS mental health service closing during the entire pandemic has been a failure. And of course, I am sorry for those children and young people who cannot get access to services as quickly as they want. That is exactly why we committed an additional £500 million and established a mental health recovery plan so that we can put community services in place to reach those who've been impacted most by the pandemic over the past 15 months. Mr Speaker, we have a long-term plan which is in place with the investment that the NHS tell us that long-term plan needs to provide the very services that we want to provide. Mental health of children and young people is this government's priority, and we will continue to invest, and we are proving to continue to invest to make sure those children and young people access the services they need.
Number 17, Mr Speaker.
18. Minister Churchill.
Thank you, Mr Speaker. If it's number 17, it's going to be an interesting answer. General practice has remained open throughout the pandemic, offering face-to-face appointments as well as telephone and online consultations, whilst playing a leading role in our vaccination programme. We are enormously grateful to general practices, the GPs, their broader teams for everything they have done. But to ensure general practice can continue to provide all necessary and appropriate care during this very busy time, we have made an additional £270 million available until September.
I think the group well, are the Minister.
I do apologise, they're grouped with 19 and 20.
Thank you. Robert.
Thank you, Mr Speaker. If done right, we can use technology and data to improve healthcare services, improve patient outcomes and help save lives. So I welcome the government's proposals for a new GP data system. But it is vital that we do get this right with the appropriate protections in place. With that in mind, will the Minister update the House on these vital reforms?
Minister.
So I thank the honourable member for his question, and I couldn't agree with him more. Data saves lives. It's as simple as that. We've seen that in the pandemic, it's one of the lessons of the vaccine rollout. The GP data programme will strengthen this system and save lives. And patient data is, of course, owned by the patient. And we are absolutely determined to take people with us on this journey. We have therefore decided we will proceed with the important programme, but we will take some extra time as we have conversed with stakeholders over the past couple of days. The implementation date will now be on the 1st of September, and we will use this time to talk to patients, doctors, health charities and others to strengthen the plan, build a trusted research environment and ensure that data is accessed securely. This agenda is so important because we all know in here data saves lives.
David Johnson.
Thank you, Mr. Speaker. I've had quite a number of constituents contact me in recent weeks who are struggling to get a GP appointment. But we had a pre-COVID problem as well, which is that thousands and thousands of new houses have gone into the constituency without an increase in GP services. So will my honourable friend meet with me so we can discuss how to get my constituents the GP services they need and deserve?
Minister.
Thank you, Mr. Speaker, and I thank the Honourable Member for Wantage for his question. It's right that local health commissioners pay careful regard to the impact of new housing and growing areas, which is to be welcomed. I understand that both practices in his area are still accepting patients, and the Oxfordshire CCG has been working closely with the practices in Wantage to make sure the impact of the housing growth going forward is being accommodated, and something I would expect all CCGs to be doing and councils to be doing. But of course, I'd be happy to meet him to discuss this further.
Paul Hubbard.
Thank you, Mr. Speaker. I've recently met with two cancer groups in my part in Sedgefield, the Solon and Connor Fawcett Family Cancer Trust and the Great Aycliffe Cancer Support Group. And while hearing about the wonderful work they've been doing over the last year, we also discussed how delayed GP appointments have affected early diagnosis of important medical issues like cancer. Early diagnosis is necessary to provide patients with the best chance of stopping the cancer spreading and of patient recovery. Furthermore, the later it's caught, the more complicated the cases become, and they take more time, more resources, and of course are horribly distressing. Could the Minister please tell me what's been done to ensure backlogs in these appointments are being addressed as urgently as possible?
Minister.
I thank the honourable gentleman for his question, and I would like to pay tribute to all cancer charities out there who've done sterling work during the pandemic. As I said, GP services are open. They are offering different forms of communication with patients. We are running a Help Us to Help You campaign so that people do come forward when they have symptoms. As he said, identifying cancers early save lives is part of the long-term plan. But I would like to assure him that general practitioners in March, my last data showed that in March 2021, we had the highest ever recorded number of GP referrals that we have ever had in cancer. They are working really, really hard, and patients need, if they are worried about any symptoms, to come forward.
Shadow Minister Alex.
Thank you, Mr. Speaker. For GPs and the NHS more broadly, using data effectively is an important way to restore our health services. However, the current plans to take this data from GPs, assemble it in one place and sell it to unknown commercial interests for purposes unknown has no legitimacy whatsoever. No public engagement, no explanation, simply snuck out under the cover of darkness. I'll get there, Minister, don't worry. An NHS data grab. Now, the news of the delay is welcome from the Honourable Lady. I'm glad that she's made that commitment. But will she commit to within that the 23rd of June opt-out date is also now moved to the 1st of September, and that there will be a full public consultation about whether the people want their data used for these purposes?
Minister.
So I thank the honourable gentleman for his question. I refer him to the answer I gave earlier to my honourable friend, and we will be considering everything in the round. As I have said, I have spoken to many of the stakeholders involved, and as we move forward, we will be making sure that we take all trusted individuals with us to build confidence in the system.
Right, let us now go to the substantive question to Minister Webb.
Thank you, Mr. Speaker. The organ donation opt-out system has increased the number of organs available for transplant and is saving hundreds of lives. Since the law changed last year, 296 people in England have donated their organs under the opt-out system. These donations account for 29% of the 1,021 donations that took place last year.
Yeah. Right, let's go to Dan Jarvis. Dan.
Thank you, Mr. Speaker, and I'm grateful to the Minister for that response. She will know that May the 20th marked 1 year since Max and Kira's law came into effect, a change that will give hope and save lives. But despite the tireless efforts of NHS staff, COVID has had a devastating impact on patients in need of life-saving operations. So can the Minister outline how she's going to get organ transplant services back to pre-pandemic levels, and what additional resources will be committed to support an increase in organ availability?
Minister.
Thank you, Mr. Speaker. Well, I would firstly like to thank the honourable member for the part he played in campaigning for this life-saving change to organ donations and bringing about the increase I mentioned earlier. Transplant services are now running at pre-COVID levels, and NHS Blood and Transplant is working with the wider healthcare system to enable as many transplants as possible. The new Organ Donation and Transplantation 2030 Meeting the Need strategy, launched last Tuesday, sets out the steps we're taking to further increase organ availability.
Substantive question to Minister Churchill.
Thank you very much indeed, Mr. Speaker. I've discussed these concerns with my honourable friend and both the co-chairs of the APPG on medical cannabis under prescription. He knows that I sympathise deeply with the parents of these children, the patients and their families, many of whom I've met. Dealing so courageously with conditions that are difficult to treat, my immediate priority was to resolve the supply of Bedrocan oil from the Netherlands. I have further meetings planned to make progress on other issues in this incredibly complex situation.
Let's go to Ronnie Curran. Ronnie.
Thank you, Mr. Speaker. And I welcome today's letter from the Minister detailing the extension of the arrangement for the provision of Bedrocan. And I'm pleased that we're working towards the manufacturing of Bedrocan oils in the UK. I have two issues today. The patients still need to pay for their medicines. If the numbers are so small that it's a niche product, surely they can be provided free on the NHS. And secondly, I've been told that research is ongoing regarding the wider possibilities for medical cannabis, but despite being promised one a month ago, I'm still waiting on an update from the MHRA on clinical trials and licence application. Could that please be forthcoming?
Minister.
I thank the honourable gentleman. As he knows, I've met with Dr June Rain from the MRHA, and I've met subsequently with further specialist clinicians in this area to discuss progress with the research and evidence supporting prescribing on the NHS. Establishing of clinical trials is vital with the support of the National Institute for Health Research to make sure that we are making the right decisions on routine funding. From the 1st of April, we've introduced a national patient registry to record data and monitor patient outcomes in England, with a view to it being rolled out across Scotland and the other devolved administrations later this year, covering both licensed and unlicensed cannabis-based medicines on the NHS, with a view to include the private patients in due course. As he knows, I am very focused on making sure that we get the right solutions for families, but at the heart of this matter always has to lie the safety of what we prescribe.
24 withdrawn, so we go to Justin Mathers.
Number 25, please, Mr. Speaker.
Minister Churchill.
Sorry. Gosh, we haven't got 24. I apologise. I'm up and down like goodness. Right. OK. So, the government has produced a 4-step roadmap to ease restrictions across England. Before each step, an assessment is made against the 4 tests, including assessing the current risk posed by variants of concern. The move to Step 3 on the 17th of May was based on the assessment that the risks were not fundamentally changed by those variants of concern, and Step 4 is due no earlier than the 21st of June, and the variants of concern will again be considered in advance.
The Minister Justin Mathers.
Thank you, Mr. Speaker. On Sky News on Sunday, the Secretary of State was asked about figures that contradict his claim that India was not put on the red list at the same time as Bangladesh and Pakistan because positivity rates were 3 times higher in those countries. In response, he said he didn't recognise those figures. Well, he should have done, because they're his own figures from Test and Trace. Indeed, there are no published figures for the time the decision was made that support his claim, and given the allegation that the only reason there was a delay in putting India on the red list was to help secure a trade deal, and it is a delay that is now having serious consequences, will the Minister agree to publish all the data and advice this decision was based upon in the interests of transparency and accountability?
Minister.
The positivity rates were 3 times higher from Pakistan than they were from India when we made that decision. As the honourable gentleman knows, we keep these things under constant review, and we would be equally lambasted if decisions were made before we had the correct information. So acting when we have the right information on variants of concern is an important thing. We will keep following the data.
Peter Bowell.
Question 26, Mr. Speaker.
Sarah Stave.
Thank you very much, Mr. Speaker. In October, the Prime Minister confirmed a £3.7 billion funding allocation over the next 4 years to support the delivery of 40 new hospitals by 2030. And I am delighted that this includes Kettering General Hospital. We have since confirmed that there will be 48 new hospitals built by 2030, and 6 of these projects are underway.
Thank you, Mr. Speaker. And I'm absolutely delighted that one of the new Boris hospitals will be built on the site of Kettering General, starting with an A&E department and finishing the whole hospital by 2027. But, Mr. Speaker, unfortunately, there may well be a very substantial delay to this because of red tape and bureaucracy. Would a Secretary of State use his great skills, bang some heads together, get the pen pushers and accountants, might I say, to sort out the delay so we can get on with it? And would he be kind enough to meet with the 3 honourable members who represent North Hampshire to discuss the issue?
Mr. Speaker, nothing gives me greater pleasure than making stuff happen, and so I'd be very, very happy to meet with my honourable friend and with the nearby colleagues who represent the people who are served by Kettering General Hospital, to make sure we can get this project moving as soon as we can.
You can rebuild Chorley Hospital at the same time. Excellent. Right, 27 withdrawn. We have a substantive question to Minister.
Thank you, Mr. Speaker. Work on the scope and organisation design of the OHP is ongoing. We will present more detail on our plans for the Office of Health Promotion in due course. Public Health England's Better Health, Every Mind Matters social marketing campaign aims to inform and equip the public to look after their mental health. Its NHS-endorsed website offers guidance on the actions people can take to improve their mental well-being, including practising mindfulness and reflection.
Let's go to Margaret Farray. Margaret.
Thank you, Mr. Speaker. Research shows that mindfulness training can contribute to improvements in obesity, eating behaviours, addiction and mental health and wellbeing. Will the Minister ensure that the Office for Health Promotion looks at the evidence of how mindfulness can help and how we all manage our health?
Minister.
There is emerging evidence which is based around mental health benefits of mindfulness, which can take the form of mediation or wider approaches that incorporate a mindful approach. And as the Honourable Lady may be aware, it's been a particular issue of mine that we separate out mental illness and well-being and mindfulness, so that we focus on mental illness, which needs the intense clinical intervention within our NHS services, but that we look at mindfulness and well-being, and that's why I mention Every Mind Matters, because the facilities are there.
Robertson.
Question number 29, Mr. Speaker.
Minister.
The pandemic has proven to the public how vital our highly skilled pharmacy teams are in supporting their communities. And pharmacies have massive potential to build on new services that they are already delivering. We will continue to look at how we can use them further.
Thank the Minister for that answer. Can we also make sure the public are aware of everything pharmacists can do, so that they can use those to take the pressure off GPs?
Minister.
Indeed we can. I would be honoured to work with him to do that, so people think pharmacy first. They are delivering flow tests, lateral flow devices into our communities. 500 of them have stood up to be vaccination sites. We now can refer from NHS 111 and GPs into community pharmacies for prescribed medicine supply and for minor illnesses. We need our pharmacies to show their skill base. They are a highly skilled group that we should be all asking to do more and celebrating.
Dr. Jamie Wallace.
Call question 1, Mr. Speaker.
Secretary of State.
Mr. Speaker, I can tell the House that today, working with local authorities, we are providing a strengthened package of support based on what's working in Bolton to help Greater Manchester and Lancashire tackle the rise in the Delta variant that we're seeing there. This includes rapid response teams, putting in extra testing, military support and supervised in-school testing. I want to encourage everyone in Manchester and Lancashire to get the tests on offer. We know that this approach can work. We've seen it work in South London and in Bolton in stopping a rise in the number of cases. This is the next stage of tackling the pandemic in Manchester and in Lancashire. And of course, it's vital that people in these areas, as everywhere else, come forward and get the jab as soon as they're eligible, because that is our way out of this pandemic together.
Dr. Jim.
Thank you, Mr. Speaker. At present, all primary care providers in Wales remain on amber alert, and this means that many of my constituents in Bridgend are unable to access necessary services unless it's an emergency. Could my right honourable friend explain how this compares to his department's strategy to provide catch-up services as we come out of lockdown?
Well, it is very important across the country that the UK is open, and that the NHS is open, that people can come forward and get treatment if they need it. As he knows, I work closely with the delivery of the NHS in Wales. The NHS is, of course, the responsibility of the devolved administration. But I'm very happy to take up his concern with the new Welsh Minister for Health to see what we can do.
The Secretary, Jonathan Ashford.
We've seen reports today of how exhausted NHS staff are. Now, the DEFRA Secretary on the media this morning said he's not sure what more the government can do to support NHS staff. Well, obviously the government can give them a pay rise, but can he also commit today to extending free hospital car parking for NHS staff beyond the pandemic?
Secretary.
Well, of course, we have made hospital car parking free for staff during the pandemic. That's one of the many, many things that we've put in place to support staff. Staff wellbeing support and mental health support has also been incredibly important. Learning, for instance, from the support we give to others in public service who go through traumatic episodes. So he's quite right that there's a wide array of things that we need to do to support NHS staff on the front line.
Shadow Secretary Ashworth.
To extend the relief of hospital car parking charges beyond the pandemic. Now, he knows that waiting lists are at 5 million and that 432,000 are waiting beyond 12 months. The priority has to be, once we're through this pandemic, to bring these waiting lists down. But he's about to embark on a reorganisation of the NHS with his integrated care legislation. And these local boards permit the private sector to have a seat on them. Virgin Care has just been given a seat on the ICS in Bath and North Somerset. He once promised no privatisation on his watch. So will he instruct that ICS to remove Virgin Care from its board?
Well, he's absolutely right that integrating the health service and integration between the health service and services provided by local authorities like social care is absolutely critical, and I know that he supports those proposals that have come from the NHS. And of course, the thing about delivering services in the NHS, Mr. Speaker, is what matters to patients is that they get high-quality services, for instance, to deal with the backlog, and what matters is getting those services as fast as we possibly can. People care much less about who provides the service than they care that the service gets delivered, and that's the approach that I take too.
Chair Select Committee.
Thank you, Mr. Speaker. Today, the Select Committee published its report on NHS and care staff workforce burnout, which chronicles the emotional exhaustion, the chronic fatigue felt by many frontline staff in the last year. Now, much support has been put in place. The 50,000 nurse target is welcome. The extra doctors and nurses hired in the pandemic, extremely welcome. But still, we have shortages in nearly every specialty, leading to a sense of despair. So will my right honourable friend consider the recommendation we make today that Health Education England should be given the statutory power to make independent workforce projections, rather as the OBR does for budget forecasts, so that we can at least look doctors and nurses in the eye and say we are training enough of them for the future?
Well, I'm very happy to work with the Select Committee on the forthcoming Health and Care Bill, which the Select Committee has had a huge amount of input into already, and during its passage I'm sure that we'll be working together on making sure this piece of legislation, which has cross-party support, can come through this House in the best possible state. I'm very happy to look at the specific proposal, but what I would say is that we have been recruiting record numbers of doctors and nurses to try to make sure that the NHS is always there for you and for your family.
Kirsten Oswald.
Thank you, Mr. Speaker. The British Medical Association have warned that the freezing of the lifetime and annual pensions tax allowance until April 2026 could significantly impact the retention and overtime of health and care staff, with 72% of doctors they surveyed saying it would make them more likely to retire early. What consideration has been given to the BMA's proposal of offering a tax unregistered scheme similar to the judiciary for those in the NHS?
Well, we made very significant progress on this in the budget immediately following the general election, as she'll know, and that has removed this problem from the vast majority of doctors who serve in the NHS. I'm very glad that we were able to make that progress. I'm always happy to look at suggestions from the unions and others, but I'm glad to say we've made a good deal of progress on this one.
Marquis.
Thank you, Mr. Speaker. Despite the recent rise in infection rates, COVID-related deaths and hospital admissions remain low across my constituency. Surge vaccinations and testing is being effectively rolled out in high-risk areas, and pop-up vaccination centres like the Derby and Joan Club in Clayton West are doing a fantastic job. Given this, could my right honourable friend assure the people of Dewsbury, Murfield, Kirkburton and Denby Dale that there will be no need to introduce local restrictions in the future?
Who's up?
Thank you, Mr. Speaker, and I join my honourable friend in congratulating the whole team for the incredible work that they did under pretty difficult and urgent circumstances. I would reassure him, as the Prime Minister, as the Secretary of State has said from this dispatch box, that we want the whole country to come out of this lockdown together.
Let's go to Virendra Sharma. Virendra.
Thank you, Mr. Speaker. My constituents continue to be concerned that COVID-19 is being used as an excuse to permanently remove services from Ealing Hospital. Accepting temporary suspensions is fine for COVID-19. But will the Secretary of State confirm that this public health crisis will not be used as an excuse to scrap services without following proper consultations and undertaking rigorous impact assessments?
Secretary of State.
Yes.
Robbie Moore.
Thank you, Mr. Speaker. The Airedale Hospital celebrates its 51st birthday this year, despite having a life expectancy of 30 years when it was originally built. And 83% of the hospital is built from aerated concrete, which is known for its structural deficiencies. My right honourable friend be well aware of my campaign to get a rebuild of the Airedale Hospital so we can mitigate this structural risk and deficiencies. Will he come to the Airedale Hospital to meet with me and Brendan Brown, the Chief Executive, so we can discuss these plans in more detail?
I think the answer is yes.
Well, I can't. Mr. Speaker, not only has my honourable friend made a compelling case for me to visit, but you just told me to visit, so I've got my marching orders. I look forward to my now forthcoming visit to Airedale Hospital. I haven't actually been yet, and so I'm very, very keen to come. The Minister of State responsible for the hospital building programme, I know, has been heavily involved in this. I've been looking at the paperwork. As he knows, on top of the 40 hospitals we've announced, 6 which are currently already being built, we have 8 further slots to come, and Airedale Hospital is very much on my radar when it comes to those slots. We will run an open competition, we'll make sure it's fair, but I'll certainly come and visit.
Let's go to Stella Creasy. Stella.
Thank you, Mr. Speaker. Mr. Speaker, this week the Prime Minister has praised the major benefits
of the PFI companies that are part of the LIFT initiative running GP services. That's why I'm sure the Secretary of State will be disappointed to learn that here in Walthamstow, Community Health Partnerships, a PFI LIFT company that we estimate has made several millions of pounds of profit from this deal on top of its service charges, and which the Secretary of State is ultimately in charge of, has just handed our local toy library a business rates bill for £30,000 for during the pandemic. I hate to add to the Secretary of State's busy diary, but will he meet with me to discuss what we can do to make sure that such companies stop making major profits from our NHS services and ensure that benefits like a toy library are not lost due to their antics?
Secretary of State.
Yes, I'll ensure that the Minister of State takes a meeting with the Honourable Lady.
Nick Higg.
Thank you, Mr. Speaker. I'm sure my right honourable friend saw Fergus Walsh's report on BBC News last week on the groundbreaking treatment for spinal muscular atrophy, SMA, and the importance of the UK's newborn screening programme. Surprisingly, the UK currently is only screens for 9 rare diseases in the heel prick test, compared to other European countries like Iceland and Italy, who test for 47 and 43 diseases respectively. The sooner the diagnosis for a child of a rare disease, the better, which can change their lives and their life chances. With this in mind, does he agree with me that the UK should really now be considering an expansion of the UK newborn screening programme? And will he agree to meet me or ask a Minister of State to meet with me and campaigners on the issue?
Yes, I absolutely. I 100% agree with the Honourable Lady. And we do have the funding that to expand this programme, and she'll have seen in the National Genomics Strategy that we set out that newborn screening is specifically highlighted. It's a personal mission of mine to make this happen, and I'd be very happy to meet with her and with Baroness Blackwood, who's the chair of Genomics England, who has been driving this project forward.
Thank you, Mr. Speaker. An early diagnosis gives the best chance of survival, but a GP in my constituency has raised serious concerns about delays in accessing urgent blood tests which are critical for diagnosing cancer. Will the Secretary of State ensure that local issues such as this do not worsen the already significant cancer backlog and put more people's lives at risk?
Minister?
Yes, she raises a very important issue, and if she will write to me with the full details, then we'll get right on it.
Let's go to Caroline Ansell. Caroline.
Thank you, Mr. Speaker. I am delighted to report back to my right honourable friend that the University of Brighton, which has a campus in Eastbourne, has experienced a significant rise in the number of applications to study for careers in health professions. A shortage of training placements is the only real break on the numbers of would-be students. I understand, talking to the university, that in the UK, students must complete over 2,000 hours in placement, and this is in contrast to Australia and New Zealand's 1,000 hours. Is this seemingly high requirement under review with Health Education England, so we don't miss an opportunity to capture this new interest, build the NHS workforce of the future, open opportunities to all those who have the talent to succeed, and of course further secure my hometown as a destination for such moments?
Minister.
Thank you very much. My honourable friend makes a really important point. I should say to her that nurse education standards are set by the Nursing and Midwifery Council, the NMC. Their current standards are based on EU law, but that no longer applies to the UK. The NMC has launched a survey on whether these standards should change. I would also say to her that acceptances onto pre-registration nursing programmes at English universities for 2020-21 increased by over 5,000 since the previous year.
John Morrow.
Thank you, Mr. Speaker. Many constituents have contacted me deeply concerned by government proposals to grab, store and share GP health data. So can the Secretary of State tell me this? If I opt out of this data grab, will my health data be available to a hospital outside my home area should I have an accident, for example? And if I don't opt out of it, how can I control how my data is shared, whether individually or in aggregate? Because I don't want to have to choose between privacy and my health.
She's quite right, and if she was in earlier, she would have heard that the Minister set out that we're going to delay the deadline on this programme, including the opt-out, which is currently scheduled to end on the 23rd of June, and we will, and that's already been welcomed whilst we've been in here by the Royal College and the BMA, and then we'll work through these issues, because I think everybody agrees that data saves lives. We have to make progress in this area. It's very, very important. We have to do it in a way that brings people with us and resolves exactly the sorts of issues that she raises.
Thank you, Mr. Speaker. Although COVID cases remain above the national average across Kirklees, thankfully, hospitalisations and deaths remain low, and locally, my constituents are getting vaccinated and they're getting tested. So can the Health Secretary please confirm he will not reintroduce local restrictions?
Well, I'm really glad to say that in Bolton and other parts of the country where we've sent in the big package of support, including surge testing, as we have in Kirklees, we've then seen a capping out of the increase in rates without a local lockdown, thanks to the enthusiasm of people locally and, of course, the vaccination programme. That is our goal. Our goal is that the country, that England moves together. Of course, and that's what we're putting these programmes in place to do, and we are seeing them work.
Thomas.
Northwick Park Hospital, Mr. Speaker, which serves my constituents, was the first to be hard hit by COVID last year. And at the height of the second wave in January, its remarkable staff were looking after some 600 patients. It needs investment in intensive care and recovery services. So when ministers receive the business case, can I ask them to look particularly sympathetically at that case?
So state.
Yes.
Reg Smith.
Mr. Speaker, Macmillan estimate that the current backlog of people awaiting a first cancer treatment across England stands at 39,000 people. So what plans can my right honourable friend outline to bolster cancer services so that those people get the treatment they need?
So state.
Recovering the backlog that's been caused by the pandemic is a huge task for the NHS. It was raised by the right honourable gentleman on the front bench opposite, quite rightly. The backlog has been increased, unfortunately, because of the consequences of the pandemic. We've put in extra money, extra £1 billion this year. We are seeing cancer services running at 100% of their pre-pandemic levels, in some cases above 100%, in order to get through the backlog. The most important thing for the public watching this and for his constituents is to make sure that the message gets out loud and clear that the NHS is open, and if you have a problem, please come forward.
Jonathan Edwards.
Diolch, Mr. Speaker. What recent discussions has he had with the Home Office regarding the successful clinical trials of the use of psilocybin in helping deal with depression? It's a natural chemical found in fungi.
It isn't anything that has yet come across my desk, but I'll make sure that the relevant minister writes to him with as much detail as we know.
Let's go to Paul Maynard. Paul.
Thank you, Mr. Speaker. Community defibrillators are vital potential lifesavers. Many community groups fund investment in them. It's concerning to hear members of the public denied access to such defibrillators when they are on private land. What can ministers do to ensure access is presumed rather than subject to permission?
State.
What my right honourable friend says is absolutely right. That, of course, if you put a defibrillator on private land, access to it should naturally be open to anybody who needs it. I will look into the exact legal status, but let's set aside the legal status for a minute. If you are a landowner and there's a defibrillator there that could save somebody's life, of course you should allow access to it for anybody who needs it.
Jessica Morden.
Thank you, Mr. Speaker. As current government investment in motor neuron research is not the targeted funding that's needed, will the Minister meet with charities, researchers and patients to examine this discrepancy and to commit to an additional funding of £10 million a year for 5 years for a virtual motor neuron disease research institute with a specific focus on helping us get a world free of MND?
Minister.
I will look into her specific request, but what I can say to her is that the government is actively supporting research into motor neuron disease. For instance, in April, I jointly hosted a roundtable event on boosting M&D research with the NIHR Sheffield Biomedical Research Centre, which brought together researchers and others, and we're absolutely committed to this area of work.
Final question, Mark Harper.
Mr. Speaker, I'm very grateful that you could fit me in at the end. The Secretary of State yesterday at the statement didn't have available to hand the information as to the efficacy of the COVID vaccines in reducing serious disease and hospitalisation, and he made a commitment, rightly, to set them out today at Health Questions at the dispatch box, and I'm delighted in this question to give him the opportunity to do so.
Thank you very much, Mr. Speaker. Firstly, I can set out that a single dose of the Pfizer or AstraZeneca jab offers protection of 75 to 85% against hospitalisation, while data on 2 doses, currently only available for Pfizer, indicates 90 to 95% effectiveness against hospitalisation and 95 to 99% effectiveness at preventing death. However, the question that my right honourable friend asked was specific also to the Delta variant. And I said that I didn't have the figure in my head for the reduction in hospitalisations, and I don't know whether I should be glad, but I can report to him that the reason for that is that there is not yet a conclusive figure. I spoke to Dr. Mary Ramsey, who runs this research at Public Health England, this morning, and she told me that this figure is currently being worked on and this analysis being done scientifically and should be available in the forthcoming couple of weeks. It's obviously an absolutely critical figure, and I'll report it to the House as soon as we have it.
I now suspend the House for 3 minutes to enable the necessary arrangements to be made for the next business. Order. You ready? Okay. Order. I call John Healy to ask his urgent question.
Thank you, Mr. Speaker. To ask the Secretary of State for Defence if he will make a statement on what progress has been made with the Ajax armoured vehicles programme.
Mr. Cook.
Thank you, Mr. Speaker, and thank the right honourable gentleman for his question. The Ajax family of vehicles will transform the British Army's reconnaissance capability. Our first fully digitalised armoured fighting vehicle, Ajax, will provide crews with access to vastly improved sensors and better lethality and protection. Main Gate 1 approval was granted in March 2010. Negotiations with the prime contractor to recast the contract were held between December 2018 and May 2019. The forecast initial operating capability, the IOC, was delayed by a year to 30th of June 2021, later this month, at 50% confidence, with 90% confidence of September 21. Despite the ongoing impact of COVID, we have stuck by this IOC date, though it remains, of course, subject to review. By the end of next week, we will receive the requisite number of vehicles to meet IOC, the necessary simulators have been delivered, and training courses commenced. These delivered vehicles are all at Capability Drop 1 standard, designed for the experimentation, training and the familiarisation of crews first in line for the vehicles. Capability Drop 3, applying the lessons of the demonstration phase, is designed for operations. We remain in the demonstration phase, and as with all such phases, issues have emerged with the vehicle that we need to resolve. We were very concerned by reports of noise issues in the vehicle. All personnel who may have been exposed to excessive noise have been tested, and training was paused. It now continues with mitigations in place as we pursue resolution. We've also commissioned independent vibration trials from world-class specialists at Millbrook Proving Ground, which should conclude next month. I can assure the House that we will not accept a vehicle that falls short of our requirements and are working with General Dynamics, the prime contractor, to achieve IOC. Similarly, we are currently working with them to ensure that we have a mutually agreed schedule for reaching FOC, which is subject to an independent review which we have commissioned. This is an important project for the British Army, delivering impressive capabilities and employing thousands of skilled workers across the UK. We are looking forward to taking it into service.
Shadow Secretary of State John Healy.
Mr. Speaker, that was a statement of astonishing complacency. £3.5 billion paid out, 4 years late and just 14 vehicles delivered, light tanks that can't fire while moving, and vehicle crews made so sick that testing has been paused. If this was defence procurement the Minister is content is broadly on track, how badly has it got to go wrong before he'll admit the contract is flawed? This is a project that has been flagged red by the government's own Major Projects Authority. The Defence Select Committee calls it another example of chronic mismanagement by the MOD and its shaky procurement apparatus. Yet the Defence Secretary is failing to get to grip with the failures in this system and failing our frontline troops as a result. He's breaking a promise he made to them in this House when he said, when it comes to equipment, the first thing is to ensure that we give our men and women the best to keep them alive and safe on the battlefield. He's been in post for 2 years now. Since then, the black hole in the defence budget has ballooned by £4 billion to up to £17 billion. Ministers are failing British forces and failing British taxpayers. Have the Ajax problems of noise and vibration now all been fully fixed? How many personnel are under medical treatment following the Ajax testing, and what are the conditions they're being treated for? Can the Ajax now, in fact, fire while moving? Where will the gun turret be manufactured? And what is the full updated cost of the Ajax programme? And when will all these vehicles be delivered in full? Mr. Speaker, this is the largest single procurement contract outside nuclear. It requires independent scrutiny. So will the Minister invite the National Audit Office to do an urgent special audit? And finally, he says this is an important project to the British Army. He's right. The Defence Command paper makes clear the rapid further cut in Army numbers is directly linked to more advanced battlefield technology based on the Ajax. So will ministers now halt the plans to cut Army numbers and focus instead on fixing this failing procurement system?
Minister.
Thank you, Mr. Speaker. I sort of imagined that, to whatever my response, the right honourable gentleman would accuse me of being complacent. That is an expectation I had, and I wasn't disappointed. And we are not in any way complacent about our nation's defence and security. That is why we're investing another £24 billion in our defence and in our security over the next 4 years. And we are absolutely on top and in getting to grips with our equipment programme and what will stem from it. The right honourable gentleman raised a number of issues. I can assure him that I am not in any way, I will assure him that I'm absolutely focused on this project and achieving its IOC. And I will not hide from him, as I haven't from the House, that we have two primary concerns, noise and vibration. On noise, we have mitigations currently in place to enable a certain element of training, albeit reduced training. We're looking at two headsets, which hopefully within the next few weeks they will be approved for use, which will further extend what we can do in terms of training. But that does not get us to the root cause, and we need to get to the root cause of the noise issues within this vehicle, be that mechanical or indeed electronic. This is, after all, the first digitalised platform of its kind anyway, and we need to resolve those issues. On vibration, we are concerned. I have to say that over many thousands of miles of testing, GD has not had the same experience of vibration, but I absolutely trust the reports that have come to me by our service personnel. We're determined to get to the bottom of them, and that is why we're using Millbrook, world-class proving ground, to check exactly what noise comes back on vibration. It may come back with a good answer, but we await that answer, and we will not be taking, I can assure the right honourable gentleman, I understand his concerns, we will not take anything into IOC until we are satisfied that we're getting the kit that we require. I can, though, reassure him on a host of other issues that he made. I don't deny that we've got serious issues that we need to resolve, but there are a number of points where there is a difference between what is certified and what the vehicle is capable of. I can reassure him that the vehicle is capable of going well ahead of 30 kilometres per hour, but with newly trained crews, a certification has been placed restricting speed. I would expect that to be lifted during the course of next month. There's been a restriction in terms of going up over a reverse step. This is a vehicle capable of going over a 75-centimetre object, reversing over it. A restriction has been placed. I would expect that to be lifted shortly too. This is a vehicle that is capable of firing on the move. It is not something that we have certified it to do as yet. We're working through what is a demonstration phase, but we will continue to advance that demonstration phase. There will be issues that always are in demonstration phases, so we do have issues to resolve, but the key ones, as I say to the right honourable gentleman, are noise and vibration, on both of which we are very focused. I hope that we will be able to get a resolution on all these issues, but it is what we're working with General Dynamics. It is a firm price contract, so 5.5 billion is the maximum that is payable, including VAT. Currently we're at just under 3.2 billion spent. There is a heavy incentivisation on our suppliers to ensure they get this over the line. We are working very closely with them at the very top level of their organisation. I'm glad a joint programme office that was delayed by COVID, as the right honourable gentleman will be aware, there were significant COVID issues in Merthyr. They did brilliantly through them. We have a joint programme office on the ground, a combination of top-down and bottom-up, I hope will enable us to make ongoing progress. On terms of the reporting, as he may be aware, there's been an IPA report requested by the SRO, which was helpful. These things are helpful. It's helpful that SROs and their teams can speak honestly to the IPO and get proper independent assessments. That certainly was conducted back in March. That certainly helped. I look forward to making further progress and reporting back on that to interested parties as we resolve the issues that are outstanding. But I would reiterate, Mr. Speaker, if I may, this is a first-class vehicle. It is the first of its kind. It's got an important job to do. It's currently employing around 4,100 people across the whole length and breadth of the UK. And I've visited Merthyr. I'm proud of what they're doing there. We will and we must get this right and get it delivered.
The Select Committee, Tobias Sullivan.
Thank you, Mr. Speaker. For some time I've been warning this House about the growing complex threats our nation faces. Over the next decade, the world will become more unstable and more dangerous. And that's why I've argued for an increase in 3% of the defence budget to meet the integrated review obligations. But it does make the job harder of convincing the Treasury, Parliament and indeed the taxpayer when we see so many errors, delays, cost overruns and redesigns. The Ajax's predecessor, the Scimitar, weighed just 8 tonnes, yet Ajax is 43 tonnes, almost too heavy to fit in or to be carried by many of our RAF aircraft. But wider than this, as the Defence Select Committee's report underlines, there seems a little operational logic to the Army's land combat operational capabilities. We're reducing our main battle tank fleet, we're retiring all our armoured fighting vehicles completely and replacing the Boxer, which doesn't, the Warrior with the Boxer, which does not have a turret. Now, I know the Minister is committed to revisiting all this. It is a massive headache, but I hope he understands that with global threats on the increase, does the Minister acknowledge we must do better?
Mr. Speaker, yes, thank you. And there's always room to do better. I totally acknowledge that, and I thank the Chairman for his comments. It may not be 3%, but a £24 billion increase is certainly good news for defence and something which is necessary. And I can assure the Right Honourable Gentleman that that is something which we are focusing on spending well and in the interests of our armed forces. The Ajax is going to be a real game changer on the battlefield. It is larger. It is some 40 tonnes. Scimitar was a different capability. But as the Right Honourable Gentleman will be the first to say, things have moved on. The WASD, the range of sensors, the 4 dimensions that Ajax can produce, allowing it to stand off from the enemy, it is a significant sea change. It has that extra lethality compared to what went before, and the extra protection that our troops deserve. So this is a vehicle that has an incredibly useful role to play on the battlefield, and as part of our ROA, the emphasis on us is to get it, and our suppliers is to get it right.
SNP spokesperson Dave Dugan.
Many thanks, Mr. Speaker. There is in the UK no shortage of MOD procurement debacles to draw on, such as the £4 billion Nimrod MRA-4 scrapped before service, or the Mark III Chinooks, £500 million of aircraft that couldn't fly low or in bad weather. But this multi-billion pound Ajax failure sets a new low. The UK Government has presided over a procurement project which would see soldiers arriving late for operations in vehicles only capable of a pedestrian 20 miles per hour, with a human endurance range of no further than 30 miles, and then unable to fight due to sensory impairment and pain caused by these £3.5 billion bone shakers. So can the Minister confirm that the sight system manufactured by Thales in Scotland is working perfectly and is unconnected with this broader failure? Where was the intelligent client at the heart of this project, and where was the learning from previous procurement fiascos? And is the Minister accepting personal responsibility for this debacle? And if so, how does he plan to atone?
I thank the Honourable for his wide range of questions. I think he ought to be slightly careful in damning all defence procurement. He mentions Nimrod. I'm sure he's very proud to see Poseidon arrive in Lossy, and indeed the E7 in due course. I hope he's proud of the work being done on the Type 26 and Type 31 on Rosyth and the Clyde, and the huge amount of work which is going through Scottish industry at the moment, including Boxer, where again Thales is employed, and I'm sure we'll do a good job. I think I've had no complaints. He'll be pleased to hear about the sighting systems that are made, as he rightly says, by Thales in Glasgow, I believe, certainly in Scotland. But we are going through the demonstration phase, and as an intelligent client, the MOD is required to check everything we are receiving, and I will reiterate that we will not take something into service and accept IOC until we are ready to do so, and we are holding our suppliers to account, all of them.
Felicity Bucket.
Thank you, Mr. Speaker. Can my honourable friend confirm that we are fully committed to the Ajax programme, its assembly in Wales, huge investment in the Union, and also its operational deployment in 2023-24?
I thank the Honourable for the question. Yes, we are absolutely committed to Ajax. We have come a long way with this project. It was originally approved, I think, by ministers of a different colour back in March 2010. And I acknowledge in saying that it's been a long time coming. But we are on the cusp of getting this right and getting it sorted. There are issues that need to be resolved. I recognise that. But we will resolve those issues and we will bring it into service.
Jimmy Stone.
Thank you, Mr. Speaker. As the Minister said, in March 2010, the then government opted for Ajax, in contrast to the proposed, suggested BAE CV-90. This weapon is in operation with 7 armies, 2 of which are members of NATO. It can make 70 kilometres an hour, and it weighs considerably less than Ajax. Is it not possible, in all honesty, that a mistake was made when we opted for Ajax as opposed to the BAE suggestion, which would, after all, have been manufactured in Newcastle?
Mr. Speaker, I do thank the honourable gentleman for his question. I wouldn't dream of answering for the ministers of the last administration back in 2010. But I would say a couple of points of mitigation. Firstly, just on a tiny point of detail, this vehicle is intended to be able to go at 70 kph, and the temporary limitations are temporary for training purposes. On the broader question, again, it's a long time ago, but they are fundamentally different platforms, is my understanding. And the Ajax that we look forward to taking into service is entirely, or is the first of its nature in terms of the digitalisation of the platform, with the enhanced lethality, enhanced protection. So we stand by the decision that the MOD made, and we are very close to getting to IOC, albeit that we have 2 issues, significant issues to resolve.
Jacob.
Thank you, Mr. Speaker. Can the Minister update us on how UK suppliers are involved in the Ajax project? And does he agree with me that it's projects like this that give us the opportunity to support British jobs in steel, in textiles and other types of heavy industry while protecting our troops on operations?
I'm absolutely delighted. Yes, there are some 230 companies, all in all, as part of the supply chain, and a lot of them had a tough time during COVID. I mentioned Merthyr, where General Dynamics are based in particular. I'm very grateful for the work that has continued on this project throughout. I had the opportunity to visit up in North West Durham, one of the track manufacturers, and there are many others around the UK. The Honourable Gentleman's referred to Thales up in Glasgow, as the Honourable Lady rightly refers to a Wales component to the electronics here as well. So there are companies around the UK that benefit from this, and we need to learn lessons from Ajax, but we also need to recognise that there is so many great skills and so many fine companies in and across the UK that we need to ensure are properly embedded into the land industrial strategy that we'll be publishing in due course.
Thank you, Mr. Speaker. Defence equipment's traditionally procured in order to do damage to our adversary, but I understand that the Ajax vehicle has been giving soldiers at risk of tinnitus and swollen joints if they were driven at speeds above 20 miles per hour. In addition, it's unable to fire whilst moving. The Minister has just described it as a first-class piece of equipment. The men and women of our army had better hope he never procures something he considers substandard on that basis. In terms of his answers so far, he's told us he's aware of the problems, but he's not given us any real sense of where the solution is and when that solution will be coming. Can he tell us any more about when we actually expect the Ajax to be fully operational and what progress has actually been made, as well as identifying the problems that we're all aware of?
Thank you, Mr. Speaker. Yes, the Honourable will ask serious questions. But just to reiterate that there is a difference between what a vehicle can do and what it's certified to do. Some things like fire-on manoeuvre and the speed limitation. Don't read into that this vehicle is incapable of either firing on the move or going above 20 miles an hour. That's not the case. It simply is not what it's certified to do at the moment. But he also highlights, perfectly reasonably, the issues that I also touched on in terms of noise and vibration. On noise, there are mitigations in place at the moment. There are further mitigations in terms of the headsets. So at the moment we were using, we introduced Ajax, and where the problems occurred was using the standard British Army headset for use in armoured vehicles. The concern we've come across is that when we tested the inner ear, that was not adequate for the task. There are 2 issues we're therefore looking at. One is the headset, and the other is the noise of the vehicle itself, which can have 2 components. It can be mechanical, It can also be the electronic noise generated by the aircraft and how that's communicating with the headsets. So I wish I could tell him that a week on Tuesday it'll all be resolved. I can't. I can tell him that there are issues that we are seriously working through with the suppliers in order to ensure that we get there. On the vibration, again, I did mention this. It was not General Dynamics has not had the same experience of vibration as we have had, apparently. So they've, over many thousands of miles of driving, they've not seen the same issues, but we have. That is why we're going to Millbrook. So they have sensors, Millbrook will have sensors all over these vehicles to test where the vibration is happening, whether we can isolate it. It may be resolvable swiftly, it may not be. I can commit to telling him that we'll do the work, and I will ensure that people are aware how that progresses.
Julian Lewis.
It's encouraging that General Dynamics have been able to make a vehicle work satisfactorily in the United States. So will my honourable friend confirm that the government will not be rushed into bringing this already much delayed vehicle into service until these problems are solved to the satisfaction of the people in the armed forces who are going to have to fight in them?
I'm so glad my honourable friend asked that question, because it requires a very simple answer, which is absolutely. There is, we are, as he rightly says, unfortunately, there's been a long pattern of delays with this particular project. We are not going to take into service something that does not meet our requirements. So it's a firm price contract. We need to have it right and take it into service when it's right to take it into service. And we're not going to obfuscate in order to do so. So that's the case.
Let's go to Margaret Farrier. Margaret.
Thank you, Mr. Speaker. There are reports in the media citing the leaked government report on the procurement of Ajax tanks, that there are problems with these tanks were known to the Army as early as 2017, but the MOD did not admit to these issues due to embarrassment. Does the Minister not agree that it would be far more embarrassing and a failure of duty of care to our defence personnel if the Ajax programme were to go ahead without finding the root cause or mitigating these serious defects?
Well, I agree with the Honourable Lady that we need to find the root cause of the defects. That's absolutely right. Or at least, first of all, identify that there are defects and then make certain that we have resolved them. I think it would be a fairer way to put it, and that's what a lot of the testing is doing right now. In terms of the when these problems first occurred, look, I don't think actually it was from the IPA report, but I've been aware on social media sources that there's been a suggestion that the Army was aware back in 2017. That's not been my experience, having looked into it, that it was a far more recent occurrence, the concerns over vibration.
Philip Dunn.
Thank you, Mr. Speaker. As the Minister is well aware and has articulated well today, this Ajax programme is a critical capability for the British Army. When originally the contract was let, we did not have in this country at that time an assembly line capable of manufacturing at scale land capability, and in particular armoured capability. So the introduction of this capacity through General Dynamics into South Wales is a very important part of the defence industrial strategy which he's referenced, and I think it's valuable for the whole House to remind themselves that we're not talking in a vacuum here. This is a capability that this government had ensured in the coalition days was built in this country. But we also were looking at a design which relied upon economies of scale to bring a state-of-the-art turret which was going to be jointly deployed on Warrior, with a cannon jointly developed with France. Again, state-of-the-art capability and lethality. Can my honourable friend reassure the House that the cancellation of the Warrior programme will not impact on the ability to deliver turrets and cannons into the Ajax programme, which will not add to further delay or cost increase?
Thank you, Mr. Speaker. My honourable friend speaks with considerable experience. I thank him for what he says about the production line. I don't know if he ever got the chance to visit Merthyr. He probably did. He did, as I have done recently, and it is an impressive factory with impressive personnel doing a good job. We just need to make certain that the whole thing fits together and works, and that's what we're committed to do. In terms of I can just reassure him on the Warrior. I've see no evidence that the cancellation of Warrior CSP should have an adverse effect on the turrets for Ajax. Indeed, I believe I'm right in saying that 58 of those have already been manufactured.
Nick Smith.
Thank you, Mr. Speaker. Can I also confirm that the Merthyr factory is an impressive capability? Mr. Speaker, the Defence and Security Industrial Strategy says Ajax is an example of regional levelling up. So can the Minister confirm where the turrets for Ajax will be built?
Minister.
My understanding is that those turrets have been built by Lockheed Martin and they are being constructed in Ampthill in Bedfordshire, is my understanding. But I will double check on that. If it is any different, I will write to the honourable gentleman and I will leave a copy of my letter in the library of the House of Commons. My understanding was that is Ampthill.
Let's go to Dr. Andrew Morrison. Andrew.
Does the Minister agree that the Ajax situation undermines Global Britain's forward presence objectives as envisaged in the integrated review? For example, the ability of the Royal Dragoon Guards based in Warminster to project reconnaissance combat teams that they were being re-rolled for. And if it turns out that the vibration issue that's already been referred to can't easily
As the programme. Do you want to try and answer that?
I'm very sorry that we've lost my my honourable friend. Gives me the scope to interpret his question. I think he was asking about our capability to provide our to equip our recce troops. It is a step change what we can do. It's a needed step change. The vehicles we're currently using brought into service in the 1970s. We need that digitalised framework. We need those sensors. We need the four-dimensional capability. And it will significantly help our armed forces, and we will be able to deliver these at speed.
Matt Weston.
Thank you, Mr. Speaker. The Minister is a decent person, but this is extremely worrying news. The idea that we have a vehicle that can go almost as fast as a bicycle, but can't actually fire its weapon on the move, but also posing such a risk to our troops is very worrying. The defence analyst, Francis Tousa, has actually described this as the Army's Nimrod, MR4A. Is he right? And what does this say about our defence procurement capability, or should I say incapability?
Well, I thank the honourable gentleman for his nice remarks. He's also a very decent person, but I fear he wasn't listening fully to my earlier responses regarding speed and fire on manoeuvre, which will be capabilities that Ajax will be able to deploy. We're still in demonstration phases. We don't get the full finished article, so it's the capability 3 drop that provides us with the vehicle that will be used on operations. Look, he's worried. I am also concerned that we have issues. I would much rather have come to this place and said, all's well, 30th of June 2020, we're looking good. The fact that we have got tests on vibrations, which will not be fully reported on until the end of July, speaks to all one needs to know about that particular date. We've been pushing and pushing. It's still possible we get a very easy answer. I fear it may take longer, but we will continue to work to resolve these issues. But when you're spending a fixed price contract of 5.5 billion, a lot can go wrong in a contract. A lot needs to be worked on with the suppliers, and in terms of the demonstration phase, that's what we're going to do.
40 withdrawn. David Lind.
Thank you very much, Mr. Speaker. Unfortunately, this is not the first time that the MOD has been found not to have undertaken the proper due diligence with respect to its hardware. There are serious questions about not only this hardware, given the reports of potential injuries to personnel, but the process to which this hardware was selected, developed and commissioned. Now, given that tenders like the Nimrod MRA4 and others like this, well, there are billions of pounds lying in the balance in terms of the British government, will it therefore commit to review how it handles such tenders going forward?
Thank you, Mr. Speaker. We constantly look at how we can best procure. And through through DSIS, we are looking at trying to improve significantly the processes that we undergo, including by having far more active contact with companies, particularly onshore UK companies, in order that we're able to work with them, and having more agility in the nature of the contracts that we undertake. So there is a process in place to ensure that we procure as best as we possibly can do. Although I would, when you are, as I say, it's a 5.5 billion contract doing something which has not been done previously globally, it's important that we recognise that there are issues that can emerge. The critical point is to spot those issues and then make certain that they are resolved.
Robert Logan.
Thank you, Mr. Speaker. I welcome the government's commitment to investing in our armoured fighting vehicles. It's vital that we never have a repeat of a situation where our armed forces personnel are put in harm's way without appropriate protections. But it's clear that there have been issues with the Ajax programme. So can the Minister assure the House that all steps are taken to learn the lessons of this and improve our defence procurement going forward?
I thank the Honourable. Yes, we can learn from all procurements. So everything that is done, we learn something from. I wish this was a totally smooth process. It has not been, from the recast in 2014, the recast in 2019, the delay to IOC, and the fact that here we are at this point with two significant issues that I still need to get to grips with and resolve. So we will have points to learn from. But I would also gently say to the House that a demonstration phase is a demonstration phase. We do need to learn through a demonstration phase and then apply what we've learned.
John Speller.
Thank you, Mr. Speaker. And the Minister seemed slightly hurt that the Shadow Secretary of State described him as complacent and then went on to confirm the description in his reply. He talked about vibration. He took the manufacturer's word for it, even though the users found something different. Talk about shade of Dieselgate. He said the noise can be mechanical, but he doesn't somehow seem to have got to the bottom of where it's actually coming from. He said Ajax is capable of firing on the move, but somehow doesn't seem to be able to do so at the moment. On behalf of the troops on the front line, don't they deserve something better, and doesn't he need to get a grip?
Yeah. Thank you, Mr. Speaker. My honourable friend produced a number of points there. In terms of, honourable gentlemen, in terms of the vibration, if I took the word of the supplier, we would have met IOC and we wouldn't have issues. I'd take the word of our crews that have been training on this vehicle. That is why we take it so seriously. That is why we've commissioned the reports that we have, and that's why the vehicles are currently at Millbrook going through and being put through their paces. So I can absolutely reassure the House that we will not be taking this into IOC until we're confident that we have achieved what we need to achieve at this stage of the vehicle's development. And I absolutely stand by it. There are a number of points he's made in terms of firing on the move, in terms of the speed restrictions, where there is a difference between certification, a rolling process of certification during a demonstration and future phases, and what the vehicle is capable of.
Thank you, Mr. Speaker. On the back of army modernisation and the £24 billion investment in the integrated review, there is also a significant opportunity to grow land exports. So could my honourable friend confirm to me and the House what opportunities he expects to arise from the Ajax programme for exports?
Well, I would very much like to see this vehicle as an export opportunity, and I believe it can be. I think the noise that we are, quite rightly and quite understandably and quite legitimately, raising around these areas of issues in the demonstration phase is understandable, but probably won't help the export potential immediately of this vehicle. But I hope we can resolve through this demonstration phase what we need to resolve. And I would love to see a situation where I can confirm to this House that all is well. We've hit IOC and we're going to proceed to FOC, which incidentally, someone asked earlier about FOC. I didn't come back to them. You know, we're doing work with Tony Meggs from the IPA to make certain we get an agreed FOC. I should have said that earlier, Mr. Speaker. Please put that on the record now. I hope to be able to get that sorted and then proceed to export what will be a transformational vehicle in service with the British Army to our allies and friends around the world, with more jobs for this country.
Patricia Gibson.
Thank you, Mr. Speaker. In addition to issues with the Ajax programme, the Government is still struggling to get on top of the massive black hole in its equipment plan, with the last report from the National Audit Office finding that it remains unaffordable for the fourth successive year. This is another warning from the National Audit Office that has not been properly heeded by this Government. and the plan is up to £13 billion overdrawn. What plans does the Secretary of State have for plugging this huge financial black hole?
With the greatest respect to the Honourable Lady, I think the report to which she's referring was prior to the injection of the additional £24 billion earlier this year. And as a result, we'll be publishing an equipment plan that will add up for the first time, I recognise, in many years and under successive governments, but we'll have a plan that we can all be proud of.
Malcolm Long.
Thank you, Mr. Speaker. As a proud member of the Armed Forces Parliamentary Services, I am delighted with the £24 billion investment into our armed forces as set out in the integrated review. As the member for Filton and Bradley Stoke has just mentioned, it also presents a great opportunity to grow exports. So can the Minister confirm what progress he might have made with colleagues in the Department for International Trade and what opportunities he might expect will arise from armoured fighting vehicles?
I thank you for the question, and it's absolutely right that you should look. This is a very positive point to end this session, if that indeed is the end of it, Mr. Speaker. We need to look to the land industrial strategy to look what we can secure for this country. Not only Ajax, but Boxer in terms of armoured fighting vehicles, and the additional work on our Challenger 3 main battle tank. We have a lot of capabilities in the land domain, as we have exporting ships of various descriptions, and the fantastic work we continue to do on Typhoon, and we're developing with FCAS. There's huge potential for us to not only defend our country and keep us secure, but to offer huge prosperity benefits to all the people of the UK. I thank him for the question.
I now suspend the House for 3 minutes to enable necessary arrangements to be made for the next business. Order. We have a question, an urgent question to Minister Adams to answer. Minister.
Thank you very much indeed, Mr. Speaker. The British Council is a crucial part of the UK's presence overseas and a key soft power asset. It works in over 100 countries to promote UK education, arts and culture and the English language. The Government remains committed to the British Council. As the integrated review made clear, we value the influence of the Council. We agreed a 2021-2022 spending review settlement totalling £189 million, a 26% increase on funding from 2020-2021. The Council has not been cut. Whilst we have had to make difficult decisions to cut in other areas, we have increased the money we are providing to the British Council. Not only have we increased funding, we provided a rescue package during the COVID-19 pandemic. This includes a loan facility of up to £145 million, with a further £100 million loan being finalised to support restructuring. We also provided a letter of comfort to ensure the Council could meet its financial obligations. We found this funding for the Council in the context of an extremely challenging financial environment. As a result of the pandemic, the UK is facing the worst economic contraction in over 300 years and a budget deficit of close to £400 billion. This package is necessarily accompanied by changes to the Council's governance, essential to modernise the Council. These include measures to update the British Council's charitable objects to focus the Council on its core pillars, streamlining its governance structures and agreeing new key performance indicators and targets to monitor Council performance in key areas. The Foreign Commonwealth and Development Office and the British Council officials have worked together to ensure that the Council will align even more closely with the Government's strategic priorities and can focus on doing what it does best. Having worked closely with the British Council, we are reviewing physical Council presence in country as part of this modernisation process. These changes will be minimal, but it is a strategic mistake to judge the impact of the Council in a digital age solely on the physical office in country. Rather, it should be judged by its operational presence. The digital services we are investing in and which have expanded rapidly as a result of COVID and its ability to operate through regional hubs and third parties. The COVID crisis, Mr. Speaker, has changed the way we all have to operate. We've also implemented a new evaluation mechanism so that when ministers travel, they can assess the value for money and the impact provided by the British Council on soft power. Mr. Speaker, this is a strong rescue and reform package. The Council will also shortly have a new CEO, so with strong leadership and a governance structure to make it viable and to reinforce its role as a force for good.
We now go to John Barron, who's got 2 minutes. John Barron.
Thank you, Mr. Speaker, for granting this urgent question. I thank also colleagues from all parties who are supporting our campaign and indeed signed the letter to the Prime Minister. And I thank the Minister for responding to this urgent question. As chair of the British Party All-Party Group, in our own dealings with the government and in the letter published between the FCDO and the Foreign Affairs Committee, it confirms that there are office closures about to take place overseas, about to be announced by the government. Even 5 would represent, and the number varies between 5 and 20, even 5 would represent the largest set of closures in the British Council's history, and all for the sake of a £10 million shortfall in funding. Mr. Speaker, the government is right. The Minister is right when he says that there has been funding supplied to the British Council. We all know that the British Council does an excellent job. I won't waste colleagues' time in extolling its virtues. It is a key reason why the UK is considered a soft power superpower. Its high quality and dedicated staff do an excellent job in promoting British culture, education and the English language overseas and facilitating cultural exchanges and building trust between other countries and the UK. But in any normal year, it only derives 15% of its funding from the government because of its commercial activities. Now, these commercial activities have been savaged
by the pandemic. The government has stepped forward, but it is still 10 million short of what the British Council needs to maintain both its international network, its footprint of offices overseas, and its programming. The government's gone so far, but it's falling at the final fence. Now, the Minister may say that the British Council needs to move into the technological age, and he talks of a digital age. But there can be no substitute for a presence on the ground. The litmus test when it comes to site closures is not any talk by government of hub and spoke arrangements in certain regions, but it's whether the country directors themselves are in situ, and country directors are going to be made redundant. Let's remember, these closures are only happening because of the £10 million in cuts. They are not of the British Council's choosing. So talk by ministers that such decisions are for the British Council ring hollow somewhat. There has been strong ministerial involvement in these decisions, as confirmed by the letter to me from the Prime Minister, and it is ministers who have instigated these cuts. Now, the closures are wrong, very briefly, Mr. Speaker, because they are not in keeping with the concept of global Britain. The Defence Secretary has said there is not enough British Council in the world, but they're also wrong strategically. It is a bad decision.
Order. We've now got to get to the Minister. I did warn the member that it was 2 minutes. He's now taken 3 minutes plus. Minister.
Thank you, Mr. Speaker. I have a great deal of time for the honourable member for Billericay. He does a great job chairing the all-party group. But what I would say to the honourable gentleman, and I'm sure he is fully aware, there will be many arm's-length bodies who would be thrilled, given the challenging financial position that we find ourselves in, be absolutely thrilled to see a 26% increase in their funding for next year. What I will say to my honourable friend is that obviously plans for their global presence are still being finalised. It is a matter for the British Council to comment on these plans, and if it does involve changes in country, I think he would appreciate it's only right that the British Council is given the opportunity to consult with their employees and trade unions, etc. And of course, any final decisions that are made will be communicated in due course. We will continue to support the Council and ensuring that it's playing a leading role in enhancing UK soft power. He did briefly mention before he was chopped off at the knees just then that the global, our commitment to global Britain is clear. It's clear in our fact that we're hosting the G7 this week, Mr. Speaker, as well as securing a deal on global tax reform. We also rank exceedingly well in the leading soft power indices and rankings. I'm getting the stare as well from the Speaker, so I shall sit down.
Yeah. Shadow Minister Stephen Kinnock.
Thank you, Mr. Speaker. I'd first like to pay tribute to the honourable gentleman, the member for Billericay, for his tireless work as chair of the APPG. Secondly, I'd like to declare an interest, having worked for the British Council myself from 1996 until 2008, during which time I was posted to Brussels, St. Petersburg and Sierra Leone. The Council's core purpose is to build long-term, trust-based relationships between the UK and other countries, and my goodness, it delivers. From its global network of world-leading English language teaching centres, to its outstanding arts and culture programmes, to its work on democracy and good governance, from its education reform and media freedom projects, to its scientific exchange and promotion of the UK's higher education sector, the British Council provides us with an object lesson in how to win friends and influence people. The Council also provides excellent value for money for the British taxpayer, with the success of its commercial operations gradually reducing reliance on government financing. But those operations have, of course, been hit hard by the pandemic, meaning that the Council requires UK government support to weather the storm. It is therefore deeply disappointing that the government is refusing to make good the shortfall, which in turn is forcing the Council to look at closing down offices in up to 20 countries. Madam Deputy Speaker, the government's position represents the very definition of a false economy. It is short-sighted and it would inflict profound damage to Britain's status as a soft power superpower. So, on the eve of the G7 summit, I am urging the Minister to think again. Could he please tell me, how does he intend to support the British Council to fulfil its integral role in making Britain a force for good in the world, an ambition set by the government in its integrated review? Does he understand fears that the government's abandonment of its 0.7% manifesto commitment on foreign aid, combined with its ambivalence towards the Council, sends a signal that Britain is withdrawing from the world stage rather than offering leadership? And will he therefore return to this House before summer recess with a plan that secures the British Council's entire global network? Thank you.
Thank you, Madam Deputy Speaker. And can I praise the honourable gentleman for the work he has done with the British Council. 12 years is a very long stint working for a fantastic organisation. But can I just prod him gently, using the word our ambivalence towards the British Council? Can I politely remind him we'll be providing £149 million grant in aid this year, £189 million grant in aid next year. That's an increase of 26%. We provided the British Council £145 million COVID loan. We're providing a £100 million loan to help them restructure. In March 2020, we provided £26 million. Madam Deputy Speaker, £609 million of British taxpayers' money since the pandemic hit. Doesn't sound like ambivalence to me. And he's right. The integrated review made clear we do value the influence of the Council. Of course we do, and we will continue to support the British Council in playing its leading role in enhancing UK soft power throughout its work overseas.
We now go by video link to Tom Tugendhat.
Thank you, Madam Deputy Speaker. It was very welcome to hear the Minister's defence of the spending towards the British Council and the way that the Department and the government has supported this essential service of Britain's presence overseas. Perhaps my honourable friend, the Minister, would also like to set out not just how we defend such a fantastic institution, but how we improve it and increase its reach. These 5 sites that are closing, one must only hope, will be reversed soon. Perhaps not in exactly the same place, but in other buildings. What plans does he and does the Department and the Foreign Secretary have for making sure that the British Council fulfills the opportunity that is before it and doesn't simply become a backwater?
Can I thank the Chair of the Committee for his remarks? We will be supporting the British Council going forward, and undoubtedly it has gone through a torrid time. The COVID pandemic has hit the British Council's commercial activities incredibly hard. And can I also use this opportunity, Madam Deputy Speaker, to pay tribute to the staff of the British Council, as well as the leadership as well. They've had a torrid time, as has all the FCDO network, working in such difficult circumstances while this pandemic has been on. We are revising, to answer the Chairman's questions, we're revising the charitable objects of the British Council to focus on arts and culture, English language and education. There will be some key performance indicators coming forward. We're working very closely. I work with the Chairman and the Acting Chief Executive of the British Council very closely and have met with them on many occasions since taking up this position. We will continue to work with them closely. I think the future is very bright for the British Council going forward, and we do intend to continue to ensure that global Britain is a world leader for soft power.
We now go by video link to Chris Law.
Thank you, Madam Deputy Speaker. The decision by the UK Government to refuse to support the British Council in its hour of need is further evidence of the Little Britain attitude at the heart of this government. Indeed, this new Little Britain approach is so small that the Scottish Tory Party wrote to the UK Tory Party questioning why the Scottish Government has the temerity to pursue links abroad. Yet we learn that only a fortnight later, this government is happy to slash the British Council's international outposts. So is Prime Minister Global Britain pledge as hollow as these moves suggest? Furthermore, this government previously described the British Council as a key driver of UK soft power overseas. If it's integral to the UK's global outlook, why has this government decided to withdraw their support? And lastly, Madam Deputy Speaker, once again we see the government renege on the award. Their last manifesto stated, and I quote, "We will work with our cultural institutions like the BBC and British Council to expand our influence and project our values." Just like cuts to life-saving support for the world's most vulnerable, is this yet another broken promise for this government?
I have a lot of time for the honourable gentleman, but references to Little Britain are frankly quite nonsensical. I'm not entirely sure whether he listened to my statement. We're increasing funding next year to the British Council by 26%. That is not abandoning the British Council. We value the work of the British Council. We're going to be supporting them. We've stuck up for them. We've got them a good settlement going forward. We've helped bail them out when times have got tough. We'll continue to work with them to ensure that they continue the fantastic work that they do around the globe.
Now we go by video link to Sir Robert Neal.
Thank you, Madam Deputy Speaker. The British Council actually gives extraordinarily good value for money, as the Minister will know, and he will be aware that taxpayer support for the British Council is very significantly less than that of their counterparts and, dare I say, our commercial competitors in France, Germany and Japan, for example. Research by the British Council demonstrates that the building of trust and connections that they do generates itself greater economic activity. In doing that, will he bear in mind the importance of not spoiling the ship for a ha'porth of tar, and in promoting our values, will he also pick up upon the research which shows that our commitment to the rule of law and our free judicial system and the quality of our legal system is also one of the matters which are strongly recognised as being critical great British global values?
Well, my right honourable friend is spot on, and that's exactly where we are on this. We are, as the integrated review made clear, where we value the influence of the British Council globally. We'll continue to support it in playing a leading role. The Prime Minister in his forward reiterated our commitment to soft power and indeed recognised the contribution of the British Council in the forward. And I think the words he used were that the British Council is one of the vital instruments of our influence overseas, and that is why we are providing the support and continue to work very closely with the British Council.
David Warburton.
Thank you, Madam Deputy Speaker, and I'm very grateful to my honourable friend for his encouraging remarks, because as the former chair of the British Council All-Party Group, I saw firsthand just how the Council works across the globe as the engine room of soft power for the UK. But in the face of the budget shortfall, offices will close, programmes will be cut, and jobs will be lost. So does my honourable friend agree with me that the promotion of British culture and language is key to the UK thriving post-Brexit and vital in building a truly global Britain?
My honourable friend is absolutely right. And first time I've seen him in a very long time, and can I just congratulate him on how magnificent a specimen he is now looking these days, Madam Deputy Speaker, if you don't mind. He raises an important point, however. It's absolutely essential that we continue to promote the United Kingdom, and the British Council does exactly that. And research has shown that students, for example, are 15% more likely to choose the UK as their study destination after using the British Council services. And I thank him also for his work as a previous chair of the All-Party Group.
We now go by video link to Christine Jardine.
Thank you very much, Madam Deputy Speaker. It's been clear in this urgent question debate so far that there is absolute unanimity about the importance of the British Council in promoting Britain's interests, soft power across the globe. And indeed, the Minister himself has emphasised that. But there seems to be a contradiction between the commitment he expresses and the funding gap which is being allowed to develop. So can he tell us now, please, how the government would propose to close that funding gap in future years to ensure that the British Council does not move into some sort of managed decline as a result of a lack of funding?
Well, I can ensure the Honourable Lady it is absolutely our intent to support the British Council. That's why we've increased the funding to the British Council. And as I said previously, since the pandemic hit, this government have committed to providing £609 million. That's an increase, Madam Deputy Speaker, a considerable increase. We want to make sure that the Council remains on a stable financial footing. And I can also tell the Honourable Lady that the new CEO of the British Council, who was recently announced, is a formidable figure, and he, I am sure, will do a fantastic job alongside the Chairman Stevie Spring of the British Council. And I think it's got exciting times ahead under such formidable leadership.
Dr. James Davis.
Thank you, Madam Deputy Speaker. Now, in 2019 to 20, there were 6 schools in my constituency which benefited from excellent British Council programmes. 5 were twinned with schools elsewhere in the world, and 1, Ysgol Llywelyn in Rhyl, received an International School Award. Will my honourable friend confirm that opportunities such as these will not be impacted by COVID-induced financial pressures?
Can I thank my honourable friend for his question? I think he is referring to the Connecting Classrooms Through Global Learning Schools programme. This is a programme which builds long-term relationships between schools, communities in the UK and developing countries. The Foreign, Commonwealth and Development Office will continue to fund this programme for 2021-22.
Thank you. Now we go by video link to Tony Lloyd.
And thank you, Madam Deputy Speaker. There is unanimity across the House that the values of the British Council go way beyond the narrow commercial. It is about the values that we have as a nation. It's about the kind of world that we want to live in. But even in hard commercial terms, the British Council pays back to this nation what it costs, and in considerable excess. So can the Minister tell the House what consultation is had with other government departments, education, for example, international trade, BEIS, all those departments and others which would have an interest in making sure that we don't lose up to 20 British Council posts worldwide? That kind of information will allow us to assess whether the government's credibility is real on this one.
Thank you, Madam Deputy Speaker. Can I just correct the record? I may have said Stuart MacDonald was the incoming CEO. I'm confusing him with one of our colleagues. It's Scott MacDonald, who will be the new chief executive. Two of our colleagues, indeed, crikey. Well, I'm sorry to disappoint both of the Stuart MacDonalds in question. But anyway, Scott's going to do a fantastic job leading the British Council. And the honourable gentleman makes a good point. Of course, we talk across government about the work of, across all our network. We have BEIS employees in posts where there are British Council employees in posts around the country. We'll continue to do that. We want to support the Council in continuing its brilliant role in ensuring that our United Kingdom soft power is enhanced through its work overseas.
Jim Shannon.
Thank you, Madam Deputy Speaker. Can I ask the Minister, please, if he would, outline what other existing body promotes the British language, the arts, the global economy, climate connection, and so many other sectors that are so competently handled in the existing structure? And does the Minister acknowledge the tremendous work that has been done by the British Council so far? Thank you.
Absolutely. And I can say to the honourable gentleman, we hugely value the influence of the British Council. We'll continue to support it in the leading role it plays, enhancing the United Kingdom through its work overseas. And then, as I mentioned previously, the IR, the integrated review, it reiterated our commitment to soft power. It recognised the contribution of the British Council, and the Prime Minister's own forward on the integrated review did refer to the Council as one of the vital instruments of our influence overseas.
Karen Bradley.
Thank you very much, Madam Deputy Speaker. My right honourable friend, the Minister, will shortly, I know, be able to travel the world, and when he does so, he will find that the presence of the British Council on site is the best embodiment of global power, soft power that this country has. The British Council has a funding shortfall because it cannot operate commercially. Can my right honourable friend please find it in him to give that additional support to make sure that on-site presence is there for when he makes those ministerial visits?
Thank you very much indeed. And can I thank my right honourable friend? Sorry, apologies. She's a very good friend of mine. Correct the record. I'm not right honourable. I'm honourable member rather than right honourable. Either way, Madam Deputy Speaker, she will appreciate the plans for the global presence of the British Council are still being finalised. We've provided a package of support which has seen an increase in funding that I've said that many arm's-length bodies would be extremely envious of. It's of course a matter for the British Council to make comments on their plans for the overseas network, but I can assure my right honourable friend that final decisions will be communicated very shortly.
Patrick Grady.
Thank you, Madam Deputy Speaker. Does he not understand, though, that long-term or funding next year is not a remedy for cuts and decisions and closures that will take place now? There will be long-term consequences as a result of what he's trying to describe as short-term funding shortfalls. And isn't this the problem of the likes of the Prime Minister simply viewing aid as a giant cash machine in the sky? The government is losing sight of the long-term consequences of its short-term decisions.
With my honourable friend, with his assumptions, the impact of this pandemic has forced the government to take incredibly tough but necessary decisions in many areas. But despite this economic climate, we have managed not just to protect the grant and aid funding that the British Council received this year, but to increase it. We've also provided, as I said, a loan. We're providing a loan to help them get through the impact of the COVID pandemic. Last March, when the pandemic first hit, an immediate assistance of £26 million plus another £100 restructuring facility that we're working with the British Council on. So I don't accept his assertions whatsoever.
Sir Edward Lee.
The French and the Germans are steadily increasing their efforts through the Goethe Institute and the French Institute, where I've myself spent many happy hours trying to bone up my inadequate French. Meanwhile, we've been closing British Council libraries for decades, often the only place where people could get free access to English literature. So will the Minister go back to his officials and insist that English literature is our greatest cultural export and there must be no diminution in our efforts to expand and promote it worldwide?
Well, my right honourable friend is correct. British Council is a world-leading provider of language teaching, teacher training, examinations on behalf of the UK government. It reaches 100 million learners and teachers of English annually across over 100 countries. And it has been shown that increased levels of English language speaking does benefit the United Kingdom.
We now go by video link to Clive Betts.
Thank you, Madam Deputy Speaker. I think the Minister's heard from colleagues across the House the great support which the British Council has and the recognition of the incredible work it does and the great value it gives. In 2018-19, the British Council estimated that the German funding for their soft power agencies was 3 times that of the UK, and in France it was twice the level of the UK. Is the Minister not therefore concerned that the cuts the British Council are now going to have to make will further undermine and reduce our influence compared with our major European neighbours?
I thank the honourable gentleman for his question. Of course, other countries, their various programmes, the Goethe Institute, Institut Français, they have different models, and the British Council operates slightly differently with more commercial operations and is reliant on less government funding than the others. We will, of course, our determination to work as a force for good in the world, it's an important part of our soft power, and the British Council is the key driver in this, and will continue to act as a force for good for the United Kingdom, whether that's teaching English to young women in South Asia, the education that the British Council provides is outstanding, will continue to be, and we will continue to support the Council.
Gareth Thomas.
Thank you, Madam Deputy Speaker. I share the concern about the British Council's funding settlement and the potential office closures, not least because of the understated role that the British Council plays in helping to boost trade. Can the Minister in particular assure me that there will be no cuts in the Council's presence in India, Pakistan and the other countries of the Indian subcontinent, where we have both strong historical links and the need to boost trade?
I thank the honourable gentleman for his questions. He will understand if I'm not in a position to announce any of those arrangements at this point. The plans for the British Council's global presence are still being finalised, and it really is for the British Council to comment on their global network. But I can assure him that there will be decisions communicated very shortly.
Jerome Mayhew.
Thank you, Madam Deputy Speaker. Whilst it's generally agreed across this House that the soft power applied on behalf of the UK by the British Council has been enormous, surely we must take account that there are thousands, in fact there are tens of thousands of businesses across this country that have had to adjust to the financial disaster that COVID has applied to them, and the British Council should be no other than that, despite having hundreds of millions of pounds of support by this government.
Well, my honourable friend makes a fair point. These are extraordinary times, and the impact that the pandemic has had on world economies, not just the UK economy, have said to shockwave. We've backed the British Council, we've supported them, we're making sure they're having an increase in their funding for next year. He's right to point out how important a role the British Council plays in terms of soft power through its work overseas. I'm told, Madam Deputy Speaker, around 1 in 5 world leaders were educated at a UK university. That's more than any other country except the US. And given the fact that 15% of foreign students are influenced by the work of the British Council in terms of determining where they have their education, I think that's testament to the brilliant work the British Council does.
And finally, Lloyd Russell-Moyle.
Thank you, Madam Deputy Speaker. I can remember going on British Council activities in the Balkans after the Kosovo War, the importance that had of having local offices in Pristina and then local offices in Belgrade that connected with people. The same when I visited the British Council in Mexico. The same we could report across the whole of the world. That individual importance of having a base. And I can tell you, young people in those programmes that I was working with were already using online activities. If the pandemic has taught us anything, it's, in my view, that online does not replicate person-to-person contact in building trust and culture. If this were a reduction in UK export support for manufacturing, the government would be outraged and would be reversing any of the cuts I would suggest. Will the Minister just look again, particularly about the in-person support, making sure that there are offices in every location where it's needed, and ensure that the support during the pandemic allows the British Council to grow and not just survive?
I thank the honourable gentleman for his question, and it's good to hear his own experience of benefiting from the work the British Council does overseas. I'm absolutely confident in the British Council's ability to grow, not just survive. As I said, Scott MacDonald, Stevie Spring, these are formidable people, individuals who are going to be leading this organisation with huge commercial experience, and I can tell him that's exactly what the British Council needs. These are individuals that any organisation would be proud to have them leading from the front. So I've got full confidence in the British Council's ability under this leadership to take this fantastic organisation forward.
Thank you. I will now very briefly suspend the House for 2 minutes in order that arrangements can be made for the next item of business. Order! Order! Call Minister Paul Scully to make a statement.
Thank you, Madam Deputy Speaker. With permission, I will make a statement on the latest steps the government's taking to protect workers' rights as we look to build back better from COVID-19. This includes our plans to create a single body responsible for state enforcement of employment rights, modernise the regulator of trade unions, and address so-called fire and rehire negotiation tactics. This government has been absolutely clear that we'll do whatever we need to do to protect and enhance workers' rights in this most challenging year. In April, for example, we increased pay for around 2 million workers, and the coronavirus job retention scheme has already helped pay the wages of 11.5 million people across the country. We'll continue to champion our flexible and dynamic labour market and to maintain the UK's excellent record on workers' rights. Today, the Advisory Conciliation and Arbitration Service, ACAS, has published its report into fire and rehire. I know it's a matter of great interest to employers and workers up and down the country, and I encourage all members to read ACAS's report. This government has always been clear that we don't accept fire and rehire as a negotiation tactic. Workers up and down the country have worked flat out during the pandemic, carrying out essential work to keep our economy going, and it's crucial that employers take their responsibilities seriously and act appropriately when it comes to discussions about changing employment contracts. I've been deeply concerned by reports over the last year that some employers may be turning too soon to firing and rehiring employees, and are using this as a tactic in negotiations to put undue pressure on workers to rush into accepting new and often worse terms and conditions or face losing their jobs. It's unacceptable and frankly immoral to use the threat of fire and rehire as a negotiating tactic to force through changes to people's employment contracts, or for employers to turn to dismissal and rehiring too hastily rather than continue to engage in meaningful negotiations. Because we're not talking about something abstract here. This is about people's lives and livelihoods. At a time when many workers have shown great loyalty and commitment to carry out essential work and keep our economy going in the face of a pandemic, I expect employers to continue to treat their staff fairly and with respect. And that's why my department asked ACAS to gather evidence on the practice so that we could evaluate whether further action is needed at this time. And I'd like to thank ACAS for their work, which has provided my department with a balanced account based on insights from employer bodies, trade unions and professional bodies. The report outlines the circumstances in which fire and rehire can and has been used and offers views from a range of contributors on whether and how to tackle this issue. There's different views on whether the practice can ever be justified. For some of the organisations consulted by ACAS, it's never acceptable. For others, in its most legitimate form, fire and rehire is a route for employers to avoid redundancies and business failures after negotiations have been exhausted. It finds agreement, though, that fire and rehire can and should only be used in limited, legally prescribed circumstances. Some thought that should be further reinforced in law, whereas a number of participants cautioned against new legislation, warning that it may have unintended consequences, that is, leading to more redundancies. So this is clearly a complex area. Many of the people ACAS spoke to welcomed non-legislative interventions such as guidance for businesses, the vast majority of whom I recognise want to do the right thing. And that's why I've now asked ACAS to produce better, more comprehensive, clearer guidance to help employers explore all the options before considering fire and rehire and encourage good employment relations practice. Some of ACAS's participants raised concerns that fire and rehire is used by employers to break continuity of service. That is, to limit the ability of workers and employees to access their rights, as certain employment rights require periods of continuous employment. Government has already committed to legislate to extend the time required to break a period of continuous service. That would make it easier for employees to access their rights and also deter businesses from using fire and rehire to engineer breaks in employment in order to deny individuals important employment rights. In spite of the unprecedented government support during the pandemic, this has also been an exceptionally difficult time for businesses. Many businesses have shown an incredible ability to adapt and innovate and played a key role in tackling the pandemic. Even so, some employers may need to make difficult decisions in order to avoid redundancies and to ensure their businesses can survive and succeed. And in those circumstances, employers and employees should always aim to reach negotiated agreements about terms and conditions of employment and exhaust every avenue to achieve this. But the reality is that sometimes, regrettably, negotiations will fail. And in these circumstances, employers may need to dismiss staff and potentially re-engage them. Therefore, any potential reform must be balanced against the possibility of the remedy creating a worse problem than the one that it's intended to address. That is, we must be careful not to introduce measures that inadvertently run the risk of businesses going bust and thus more people losing their jobs. However, having carefully considered the report, the government wants to send a clear message to employers. Even if your business is facing acute challenges, all other options to save jobs and a business should be exhausted before considering the dismissal and re-engagement of staff. I believe that we can achieve this working in partnership with businesses and workers without heavy-handed legislation. The House should be left in no doubt that this government will always continue to stand behind workers and stamp out unscrupulous practices wherever they occur. And that's why today I'm also confirming that the next steps we'll be taking to modernise our labour market enforcement regime. In 2019, the Government published a consultation which set out the benefits of bringing together our 3 existing labour market enforcement bodies into a single organisation. And today, the Government has published its formal response to that consultation. This new single enforcement body will help the country build back better by taking a smarter approach to the enforcement of employment law. It will make it easier for the vast majority of responsible businesses to comply with the rules. It will ensure a level playing field through effective enforcement against those who cut corners and exploit workers. Today's Government response sets out the overarching details of the new body: responsibility for tackling modern slavery, enforcing the minimum living wages, and protecting agency workers will be brought under one roof, creating a comprehensive new authority. The new body will go further than current enforcement, enforcing holiday pay for the most vulnerable workers, as well as statutory sick pay. It will regulate umbrella companies and enforce financial penalties against organisations that do not meet requirements to publish modern slavery statements. And it will run the unpaid tribunal awards penalty scheme. Protecting workers requires support for businesses too, so employers understand how to comply with the rules. This is in addition to effective, visible enforcement action to deter irresponsible employers. The body will have a spectrum of powers and responsibilities to achieve this, including the ability to issue guidance and compliance notices, levy civil penalties for certain offences, and power to prosecute the most exploitative employers. Madam Deputy Speaker, protecting workers is not just about support for business and effective state enforcement. Trade unions have an essential role in the workplace, and I know from my regular close engagement with unions how important their work is. So today, the Government has published its plans to modernise the regulation of trade unions, bringing the certification officer in line with other regulators. These reforms will implement technical measures passed by Parliament via the Trade Union Act 2016, providing reassurance to union members and the wider public. We're confirming 3 changes to the certification officer today. Firstly, we're extending the certification officer's powers to enable her to proactively investigate when a third party raises concerns that a union or employers' association may have breached its statutory duties. We'll also expand the powers available to her to conduct those investigations. Secondly, we will give the certification officer the power to apply financial penalties to unions or employers' associations where the most serious breaches are found to have occurred. The sanctions will only be targeted at the small minority of unions that breach their statutory requirements and obligations. And thirdly, we will move the certification to a levy-funded funding model. And this will bring the certification officer in line with a number of other regulators, such as the Pensions Regulator and the Financial Reporting Council. Proper and fair regulation will ensure that all trade unions and employers' associations conduct themselves to the highest standards. Madam Deputy Speaker, the United Kingdom has one of the best records in workers' rights in the world, going further than the EU in many areas. And we are determined to build on that record by modernising our labour market enforcement regime, protecting workers more extensively, supporting businesses to comply with the law, and preventing them from being undercut by a minority of irresponsible employers. We can continue to be a high-wage, high-employment economy that works for everyone as we build back better.
Thank you. Andy MacDonald.
Thank you, Madam Deputy Speaker. The Government has overseen a crisis of insecurity and a lack of protections at work, and the proposals announced today will do little to address it. There is no plan to legislate for a single enforcement body, so can the Minister explain how and when this will happen, and given that the long-promised employment bill has been ditched? There's no new money in this announcement. We've had a decade of cuts and underfunding, which left us woefully unprepared when the pandemic hit. In the past year, just 1 in 171 workplaces had a safety or workers' rights inspection, and not a single employer has been prosecuted and fined for putting workers or the public at risk of contracting COVID-19. A staggering 2 million people are paid below the national minimum wage, yet there are currently just 18 employment agency standards inspectors responsible for inspecting 40,000 employment agencies. Without new funding, the Minister is simply proposing to merge several under-resourced agencies into a single under-resourced agency. The hollowness of the Government's commitment is underlined by the fact that the post of Director of Labour Market Enforcement has been left vacant for the past 6 months. However, the most glaring omission in this plan is that many of the most exploitative employment practices are perfectly legal. Bogus self-employment denies millions of workers in the gig economy basic rights and protections, including the national minimum wage, rest breaks and health and safety protections. For these workers, it's not a matter of enforcement because they don't have rights to enforce. They've been totally abandoned by the government. Will the Minister commit to giving all workers full employment rights to ensure everyone has dignity and security at work? On fire and rehire, the Minister says that the government has always been clear that we do not accept fire and rehire as a negotiation tactic. Madam Deputy Speaker, these are empty words. The only clear message would be to outlaw the practice. The government has hidden behind the ACAS report since February, using it as an excuse to do nothing about it. Today's announcement that ACAS will be asked to produce further guidance is kicking the can down the road yet again. 1 in 10, almost 3 million people have been subjected to fire and rehire since last March, allowing working people to be bullied onto low wages and worse terms and conditions is both morally wrong and economically illiterate. The government claims to oppose fire and rehire while encouraging it through their inaction because they believe this one-sided flexibility is good for the economy. How many more millions of workers is the Minister prepared to allow to be fired and rehired before he acts to outlaw the practice? The proposal to give the Certification Officer powers to commission investigations and fine trade unions, even when there's been no complaint from a member, funded by a levy on trade unions, is an ideological attack on working people. The Minister is proposing to solve a problem that doesn't exist. The Certification Officer had a tiny number of cases last year, resulting in just one enforcement order. This means unions will face financial burdens at times when their members are facing hardship, diverting time and resources away from protecting working people to deal with spurious complaints initiated by groups like the Taxpayers Alliance, rather than fighting for members. If the Minister is genuinely concerned about law-breaking, I suggest he looks closer to home. Staff in his department are balloting for strike action because of repeated breaches of employment law, including unlawful deduction of wages, which force staff to rely on food banks, as well as breaching the Working Time Directive and repeated breaches of health and safety COVID guidelines. Trade unions are the best mechanism for protecting workers' rights, yet the Minister wants to tip the balance of power even further away from them. Compare and contrast with Joe Biden, who is unshackling and empowering trade unions to rejuvenate the American economy and raise living standards. This government wants to hobble trade unions. The Minister has committed his government to do whatever they can to protect and enhance workers' rights. Madam Deputy Speaker, there's a chasm between the reality and the rhetoric. This is another deceit on working people. But I've got news for the Minister. He's fooling nobody.
Minister.
Thank you, Madam Deputy Speaker. The honourable gentleman talks about enforcement issues and funding. We have more than doubled the budget for minimum wage enforcement and compliance, which is now over £27 million annually, up from £13.2 million in 2015. There's more than 400 HMRC staff involved in the enforcement of the minimum wage. We concluded over 2,700 investigations in the minimum wage and returned more than £16.7 million in arrears to over 155,000 workers. We are determined that people should get a fair wage for a fair day's work, and included, especially as we build back better, we will build back fairer, and it will not be on the backs of the lowest paid. And that's why we will continue to increase the national minimum wage, the national living wage, and also to enforce transgressions in that area. In terms of the Health and Safety Executive and what's happened in COVID, there have been the Health and Safety Executive, in receiving £14.4 million extra funding, have conducted 234,000 spot checks in the last year. In terms of worker status, the worker status clearly is complicated when we have three issues of worker, employment and self-employed. But that allows us to have the flexible, dynamic labour market that allowed us in the last recession, after the last session, to build back better by delivering more jobs than the rest of the EU put together. And then in terms of fire and rehire, we hear a lot in this place about this binary choice about fire and rehire. But in reality, the situation is far more complicated, because what we want to do as we build that better, we want to make sure that we can protect people's jobs as well as their working conditions. And that's why we've got to get that balance right. But only this side of the House will deal with the economy, with businesses, but most importantly, the workers that are subject to transgression of their workers' rights by irresponsible employers, not just painting all employers with the same brush. He talked about the certification officer, changes to the certification officer's duties being ideological. Actually, what it's doing is adhering to the law. It's what we said we would do in the Trade Unions Act, and all we are doing is implementing what was agreed in this place, what was debated properly in this place and agreed under that Act. We will protect workers' rights, Madam Deputy Speaker. We will protect jobs. We will create more jobs, and it will be through a flexible, dynamic labour market, getting that balance right, rather than just having a 1970s-style binary debate. We want to work for a 21st century working conditions.
Mary Robinson.
Thank you, Madam Deputy Speaker, and I'm grateful to my honourable friend for his statement. Many of my constituents work at Manchester Airport and will welcome action to address fire and rehire in the aviation sector. A single body for employment rights is also welcome, but I would encourage the government to go further and establish a single body for whistleblowers to ensure that they're protected from retaliation and blacklisting and their concerns are properly investigated. Unfortunately, the current legal framework doesn't tackle these issues, and the recourse for whistleblowers is a heavily backlogged employment tribunal system where the average wait for a whistleblowing case is more than 2 years and the success rate is low. Does my honourable friend therefore agree with me that it's time for an office of the whistleblower to uphold the right to speak up and strengthen these employment rights even further?
I thank my honourable friend, and I'm glad that she had the opportunity to meet with the Secretary of State recently, and we continue to want to work closely with her and other colleagues on this basis. My honourable friend from Thurston Moulton as well, who also raises this issue on a regular basis with great knowledge from his constituents. And we do recognise how valuable it is that whistleblowers are prepared to shine a light on wrongdoing and believe that they should be able to do so without fear of recriminations. It's right and proper that we review the whistleblowing framework, and we will do that once we have the sufficient time to build the necessary evidence of impact on the most recent reforms. So we'll consider the scope and timing of a review.
We now go by video link to Douglas Chapman.
Thank you, Madam Deputy Speaker. Can I thank the Minister for his statement? I know that across the House we recognise that strong employment legislation, regulation and guidance helps the businesses that respect such standards be more successful, attract more talented and skilled people and build better teams than those enterprises that play fast and loose with their own employees' rights. Well, the Minister has outlined a number of measures today. All these things, the proof of the pudding will be in the eating. So will the Minister commit to working across the Chamber with trade unions and employers to ensure that the highest employment law expectations are maintained and enhanced, and the experience of the employee does exactly what it says on the tin when it comes to fair and just working practices? Honourable members' casework inboxes are already too full of such cases, and if the Minister were to commit to an annual review of the measures in his statement today, that would help ensure that we were getting this right and protecting workers across the 4 nations of the UK. Finally, Madam Deputy Speaker, on fire and rehire, I cannot speak on this subject without praising the work of my SNP colleague, the Honourable Member for Paisley and Renfrewshire North, for his dogged determination in supporting this campaign and his desire to seek fairness for thousands of employees who have been caught in this sordid, pathetic practice applied by unscrupulous employers. Today, this was the government's chance to right a wrong, a chance to end fire and rehire for good. The question is, why hasn't the Minister taken that chance to put fire and rehire out of its misery and protect thousands of hard-working people across the 4 nations?
I thank the honourable gentleman, and clearly, as I've said, we don't want to go back to the 1970s binary view of workers' relations. So what we want is a 21st century view. So, of course, we will continue to look. We will continue to review the impact of legislation, of guidance, and our work on workers' rights to check that it is working for a 21st century economy. We'll continue to do that, and we will continue to work with colleagues from either side of the chamber in order to hear the constituents' casework. In terms of fire and rehire, as I said, nothing is off the table. We are charging ACAS to strengthen the guidance in this area, to inform responsible employers how to conduct themselves within this area. But as I say, nothing is off the table.
Thank you, Madam Deputy Speaker. I thought I was the one after next, so forgive me for that slight delay in starting. Can I say to the Minister that I'm slightly confused by the statement today? He says that the government says fire and hire is wrong, yet did nothing to intervene to stop it being used inappropriately. He tells us that the single enforcement body will be introduced, which I welcome, but that requires legislation which is not lined up in the Queen's speech. This is merely a statement of intent, not a statement of action, a statement of all bark and no bite. So let me ask the Minister, by the end of this year, what will have actually changed?
Well, in terms of fire and rehire, that guidance will be there, because what I've said is that fire and rehire in itself is not a binary view, but it's the dynamic. We need a dynamic labour market, clearly. We need to protect businesses from making redundancies and losing those jobs and indeed saving businesses. And so that's why we are progressing along the way by charging ACAS to strengthen the guidance in this area. But clearly the single enforcement body, we will be working throughout the next few months to make sure that we can help when we are able to bring parliamentary time to bring the employment bill through to create the single employment body. It will be there and the prep work will have been done.
Richard Fuller.
Madam Deputy Speaker, the best form of employment protection is a thriving entrepreneurial business sector open to innovation and creativity. And the Minister has already outlined, Madam Deputy Speaker, that the UK has an enviable, flexible labour market with the highest participation rate of people in work, with the highest levels of employment we've seen for many years, with the fastest ever increases in the minimum wage, and with the highest take for the minimum wage as a proportion of average earnings. So will my honourable friend, rather than going back to the ideological arguments of the other side, join with me in praising the Biggleswade branch of the DWP, who I was in a conversation with today, who are embarking on promoting the Kickstart programme to get more people into work, particularly young people.
I thank my honourable friend for his usual eloquent way of talking up the economy, the dynamic, flexible economy that makes this UK the fantastic envy of the world in terms of its workers' rights, but in terms of its flexibility, which is why we're attracting so much inward investment. And I'm glad to hear what he's saying about the Biggleswade Job Centre promoting Kickstarter, because it's initiatives like Kickstarter, the extra money that we are giving it to employers to take on more apprentices as well, that will give people the opportunity, levelling up potential with opportunity.
We now go by video link to Sarah Olney.
Thank you very much, Madam Deputy Speaker. I was pleased to hear in the Minister's statement that he accepts that there's still some way to go in securing workers' rights, particularly those who are most vulnerable. I'm surprised that he hasn't concluded that further legislation is required. But if the solution is for the new body that replaces these three existing bodies to go further and do more to enhance and strengthen workers' rights, then there must surely be extra funding available to enable it to fulfil its responsibilities. I'd be grateful if the Minister could confirm that.
We've got good history in increasing the funding for enforcement measures, as I've already outlined, and indeed the single enforcement body, when we're able to introduce it through legislation, will have sufficient funding not only to do its work but also transition from those three bodies into one.
Ria Miller.
Thank you, Madam Deputy Speaker. And can I welcome the government statement, because a strong economy utilises all the talents of its workforce. And at the moment, despite some very strong laws, 1 in 4 pregnant women or women on maternity leave experience discrimination during the pandemic, and the Minister knows that every year more than 50,000 pregnant women feel they have no option but to leave their jobs because they are pregnant. So can he confirm that the new enforcement body will be looking specifically at enforcing pregnant women's rights at work and outlawing the use of non-disclosure agreements to cover up illegal employment right abuses.
Minister.
I thank my honourable friend and congratulate her for the work that she continues to do in this area. The law is absolutely clear. Discrimination in the workplace is unlawful, with clear regulations in place which every employer must follow. And the pandemic hasn't changed any of that. There is no place for that under any circumstances. We believe that the most appropriate way forward for pregnant women and new mothers is to extend the existing framework of protections set out under Regulation 10 of the so-called MAPLE, the maternity and parents parental leave, etc. And we'll do that by extending redundancy protections for 6 months for mothers returning to work and ensuring that pregnant women also benefit from these additional protections. We'll bring these forward as a part of the employment bill, which will also be the vehicle that will bring the single enforcement body together.
Gavin Newlands.
Thank you very much, Madam Deputy Speaker. And can I start by saying I'm very much looking forward to supporting the Honourable Member for Brent North's fire and rehire bill now that my own bill has fallen. Is this it? After months of warm words for the victims of fire and rehire, from the Prime Minister through to the Minister, what do we get? Guidance which amounts to nothing more than utterly shameful lip service. The statement today again says it is unacceptable and frankly immoral to use the threat of fire and rehire as a negotiating tactic to force through changes to employment contracts. I agree. So can you tell us, will employers still legally be allowed to do so? Yes or no?
I've talked about the fact that people should not be using fire and hire tactics as bully boy tactics. But the honourable gentleman talks about fire and rehire as if it's some sort of binary thing. If he can define exactly what, because the amount of examples I've had over the last year some have been within what we consider the traditional fire and rehire, been subject to this debate. Others have actually drifted into other areas of employment law. And so we need to make sure that we can continue the flexibility for employers so that they're not having to make redundancies in the first place, because clearly what would affect those employees badly is by not having a job in the first place. And so that's why we need to collect the flexibility and the dynamism, but making sure that we've got measures in place so that responsible employers can actually make sure that they can stick to their responsibilities for the lowest paid.
Okay, now we go by video link to John McDonnell.
Thank you, Madam Deputy Speaker. Can I say that that's possibly one of the most mealy-mouthed, weak-kneed, ineffectual statements I've ever heard in this House. It's a betrayal of working people. Fire and rehire commenced in my constituency with companies like British Airways and Heathrow Limited, and it spread like a pandemic, harming my constituents. And it's galling that these companies have been receiving taxpayer support on furlough, grants, loans, and tax reliefs. We need legislation, but not guidance that can be ignored. But if the government is to go down the guidance route, will the Minister confirm that the government will insist that no grant, no loan, no tax relief, no taxpayer support will go to companies that are not abiding by this guidance?
Sorry to the fact that the right honourable gentleman isn't here to talk about mealy-mouthed whilst throwing the Chairman Mao's little red book at me whilst talking about supporting business and workers. But no, look, we will going to strengthen the guidance. Nothing is off the table because we will clearly see what's going on. Work with ACAS, work with colleagues to make sure that we will see how this lands and what happens with irresponsible employers as well, because we shouldn't use it as bully boy tactics. But it's right that actually we have wrapped our arms around the economy with £407 billion worth of fiscal and financial support. We now have 407 billion reasons why to shape the economy, to allow these businesses to survive and to protect jobs and to create new jobs so that we can build back better.
Jonathan Gullis.
Thank you, Madam Deputy Speaker. And today's statement will be welcomed from across Stoke-on-Trent, North Kidsgrove and Talk. And I think of great employers like Churchill China, who the CEO, David O'Connor, started on the shop floor and has worked his way up because that employer invested in their company, invested in their workers and used the workers' rights that clearly laid out. They gave him the opportunity to be, as I say, someone firing the kiln all the way now to running a multi-million-pound business. And I find it confusing as a former trade union rep that the opposition are bemoaning the fact that trade unions should have to pay a levy rather than UK taxpayers. I'm assuming that's because they're worried there'll be less money in the Labour Party coffers. But does my right honourable friend agree with me that there's no reason why trade unions shouldn't pay their own way, and actually holding trade unions to account is perfectly acceptable, just like holding business to account?
I don't mind.
Order. We will not have shouting. Minister.
And it is great to hear that example of his constituent, because that is exactly the kind of flexible, dynamic economy we're talking about, that someone can come from the shop floor and go right the way to the top of their business. But he's absolutely right that unions, as was subject to the debate in the Trade Unions Act, that the unions can now be held alongside other regulators in terms of the strictures that are looking at them to make sure that they can do a good job for their members.
Very good. Yeah. We go by video link to Liz Saville-Roberts.
Diolch yn fawr, Dr Prylawerydd. Today's smoke and mirrors announcement, rhetorical rather than underpinned by legislation, amplifies this government's ongoing failure to introduce a new employment bill to protect workers' rights. And as we continue to struggle through the pandemic, one thing has become clear. The current approach to bereavement leave and miscarriage leave is insufficient and depends too much on the goodwill of the employer. Will the government now consider making paid bereavement leave and paid miscarriage leave an employment right from day one?
We will continue to work with her and other colleagues to look at the various things around neonatal leave, for example, and carers leave, but also we've introduced bereavement leave for newly born children. And we will look at what more we can do within the employment bill. But we shouldn't always, the Honourable Lady talked about rushing towards legislation. That should never be the first port of call. It's partnership with employers and employees and government to make sure that we can have that flexible economy that works for everybody.
Correct. Richard Holden.
Thank you very much, Madam Deputy Speaker, and I thank the Minister for his statement. I think one of the biggest issues that we have to see in employment is people having a job in the first place. And I'm happy to go toe-to-toe any day on our record as a party in government with the opposition's party, who've, every time they've been in government, they've left unemployment higher than when they came in. And we've seen a great record since 2010 on job creation. And we've created the conditions now to bounce back really well, with great job numbers coming through following the COVID pandemic. And it's great to see also that the government's looking properly at fire and rehire. But one of the biggest issues for people in my constituency, for workers in my constituency, is around pensions. It's brilliant to see that we've had auto-enrolment come through now. It's something great for a lot of workers in the workforce. But will the Minister agree to meet with me and look at extending that right to all workers over the age of 18? Because a lot of my constituents start work on the shop floor at 18 rather than after university at 22.
Thank my honourable friend, and it's absolutely right when he talks about that dynamic economy, and that's why voters turned in their drove to him to represent them in this place after decades of underrepresentation, and I would gladly meet him to discuss auto-enrolment.
Chris Stevens.
Thank you, Madam Deputy Speaker. The irony that the Government are consulting on enforcement powers against trade unions, but only guidance for bad employers is not lost on me. So, talking about bad employers, zero-hour contracts, unclear employment status, short-notice shift changes, all mentioned, Madam Deputy Speaker, in the Taylor report given to the Government 5 years ago. No rushing into legislation. So when will the Government legislate on the Taylor report recommendations, or will it be left to other members to bring legislation forward to address these bad employment practices?
The honourable gentleman talks about the certification officer as if it was something that's new, that's just been sprung. Clearly, this was the Trade Union Act 2016, so that's been 5 years, funnily enough, and it's only just coming in now because we try to get the detail right. But in terms of the legislation that he's talking about with the Good Work report, the employment bill will come to this place when parliamentary time allows.
Sunderland.
Madam Deputy Speaker, our business, energy and industrial sectors are pivotal to our economy. Does the Minister agree that the best way of safeguarding jobs and livelihoods for our fantastic workers is to comprehensively ease all COVID restrictions in these sectors? And will you please lobby number 10 to that effect?
Nobody wants the restrictions to go on one single day longer than they need to. We're coming up to we're in the middle of a frustrating point at the time when the decision is going to be made on the 14th of this month, and we're looking at the data. Every day that goes by gives us a richer set of data to make the best decision for businesses.
Now we go by video link to Stephen Timms.
Thank you, Madam Deputy Speaker. The case won by the GMB trade union against Uber over the status of its drivers is immensely important. But why is the government leaving it for these issues to be slugged out, employer by employer, worker group by worker group, in the courts? That is in nobody's interests. So when will the government bring forward, finally, this long-promised employment bill, which is so urgently needed?
That was a landmark judgment. My right honourable gentleman talks about the Uber judgment. That was a landmark judgment, and it's important that we reflect on that. But it's important that Uber primarily reflect on that and make sure that workers are getting their rights, because every worker is different, and indeed the contracts have changed over the last few years with Uber, and other members of the companies working within the gig economy have different contracts. So it is complicated, but that's the definition of flexibility. That's the definition of dynamism. But nonetheless, he talked about the employment bill, and as I said, the employment bill will come forward when parliamentary time allows.
Kevin Holland-Rake.
Thank you, Madam Speaker. Can I draw the House's attention to my entry in the registered members' interests? As a former employer, I absolutely support the government's approach to strengthening workers' rights and to stamping out bad practice. When it comes to enforcement, whistleblowers are far more effective at identifying inappropriate behaviour, inappropriate practices than regulators. But nevertheless, from a position where the UK used to be leading in whistleblower legislation, it has now fallen behind. This is a key area we could work on to improve the situation. Would my right honourable friend set out the approach the government's going to take in terms of improving this legislation?
I'm grateful for my honourable friend's work in this area, and I'm really looking forward to meeting him and colleagues to discuss this further, to get his knowledge and indeed get the experience from his constituent as well, who's been put in an incredibly tough and invidious position. But we will, as I say, review the whistleblowing framework once we've had sufficient time to build the necessary evidence, which will be including in that conversation, and we're considering that scope and timing of a review.
It would be helpful if we could go a little faster, because the House has a lot of business before it for the rest of the day. We go by video link to Charlotte Nichols.
Thank you, Madam Deputy Speaker. Polling for the GMB union has found that 76% of the public want fire and rehire to be banned, including 71% of Conservative voters. If it's only unscrupulous employers using fire and rehire tactics, as the Minister said in a previous answer, then a non-legislative solution will do absolutely nothing. How much more consensus is needed before the Minister acts to ban fire and rehire, rather than warm words that do nothing to protect workers in his constituency or mine?
Madam Deputy Speaker, I've noticed that from my long list of responsibilities in the ministerial portfolio, I can shrink it down to Minister for Unintended Consequences. And what I don't want to do is to have a series of legislation with a blunt instrument as if it's tackling a binary tool which will have unintended consequences for people's jobs and people's livelihoods, because actually that's what we want to do, is have the flexible economy to get both right.
Mark Pawsey. Oh, sorry.
Thank you, Madam Deputy. Thank you, Madam Deputy Speaker. I welcome the way the Minister is today extending the rights of the most important asset of any business, its people. And I'm sure he'll agree with me how essential it is to ensure the flexibilities which give workers the ability to work the hours that suit them best, whilst also allowing employers to respond to the changing demands of their customers.
I thank my honourable friend. He's absolutely right. When we do flexibility of workplace, including so-called zero-hour contracts, we know that actually the majority of people working with zero-hour contracts, for example, like the flexibility. What we do want to do, though, is make sure that we can clamp down on things like exclusivity contracts and those kind of things, which is why we ban those. It's important that we get the balance right.
Very good. Kirsten Oswald.
Madam Deputy Speaker, the Minister just said that the UK Government will do whatever is needed to enhance and protect workers' rights. But all he's doing on fire and rehire is providing more guidance. Minister, that shameful guidance is not what is needed here. We needed to hear about legislation to stop fire and rehire, to outlaw pregnancy and maternity discrimination, to give flexible working rights from day one to protect precarious workers. But the UK Government plainly won't do what's needed on employment. So does the Minister appreciate that what's needed now is to devolve this to the Scottish Parliament so they can do what's needed?
If the Honourable Lady will read the ACAS report, she will see that there is a divergence of opinions, there's a variety of opinions and a wider evidence base there about the extent of its use and how it's used. And that's why we are coming up with a proportionate response to that. And clearly the other issues she raised will be in the employment bill when parliamentary time allows.
Elaine Saxby.
Thank you, Madam Deputy Speaker. I know my honourable friend understands that honourable and right honourable members across this House want the UK to be on the front foot on workers' rights after we leave the EU. Can he offer me a categorical assurance that this will be the case and there will be no degradation of our world-leading protections?
My honourable friend, and yes, absolutely, that is the case. We are determined to make sure this is the best place, not only to set up a business, not only to have a business, but to work, for workers' rights, to have a high-paid, high productive economy that can only be done by valuing our people.
And now we go by video link to Rachel Maskell.
Thank you, Madam Deputy Speaker. I refer to my register of interests. The government may talk about enhancing employment rights, but never acts and never legislates. Recently, workers in York were being forced onto new contracts until a joint intervention by Unite and myself as a Labour MP stopped this firing and rehiring. I know it's embarrassing for the Minister to have to defend his government's empty promises, dither and delay, but to stop bad employers constantly undermining their workers, we don't need more guidance, but legislation. Will he bring forward a government bill to end fire and rehire practices in this parliamentary session, which also insists that any changes to contractual terms are negotiated with workers and their trade unions?
Outline what we're doing around fire and rehire, and and with regard to extra enhanced workers' rights, that will come within the employment bill. But these workers that she describes have recourse through ACAS, through employment tribunals, to actually be able to take their employers to task.
And finally, Laura Farris.
Thank you, Madam Deputy Speaker. I welcome today's announcement, and my honourable friend is quite right to point out the nuance in fire and rehire. Speaking as an employment barrister, I want to just stress that the issue that we lawyers have had is that the employer is only required to show that it's a genuine reason, in other words, there's low profitability. They're not required to show that they've exhausted every other option, and I welcome that now being a devolved function of ACAS. But would my honourable friend consider putting the last resort clause into primary legislation, either the Employment Rights Act or the new bill, to give employees rights to go to the tribunal?
My friends, load of friends, considered response as ever in this area with her expertise that she brings to bear. And clearly, as I say, nothing is off the table. So we're putting the guidance in place now with ACAS, but we'll clearly look at more measures should we need to.
Thank you. Point of order, Kevin Jones.
Thank you, Madam Deputy Speaker. Earlier last month, I received from a constituent some serious allegations about the conduct of individuals in the cosmetic surgery industry. These allegations involved a surgeon who had been struck off the GMC register in this country, conducting consultations via Zoom with UK patients from a private clinic overseas. A separate allegation was that a doctor in the UK was continuing to refer patients to the struck-off surgeon, and that his services were being advertised on a UK-based website. On the 20th of May, I wrote to the Health Minister, the Honourable Member for Mid-Bedfordshire. On the 3rd of June, I received a direct response to my letter, but lo and behold, not from the Minister, but from the CEO of the Transform Hospital Group, a private company. I know that this was a direct response, as the CEO actually states that he'd received my letter directly from the CQC. Now, I take a very extremely dim view that my correspondence with the Minister is being passed on to a private company without my knowledge or consent. I consider it a major breach of confidentiality and trust, but also that of my constituent who made the complaint to me in the first place.
Now, I don't think a minister's correspondence should ever be shared with a private company and break that bond of trust we have with our constituents. I would seek your advice, Madam Deputy Speaker, in terms of how I can rectify and ensure this doesn't happen again.
I'm grateful to the honourable gentleman for having given me notice of his intention to raise this point of order. Mr. Speaker shares his concern that sensitive correspondence appears to have been passed from the department to a private company for response, and Mr. Speaker will be drawing this matter to the attention of the Leader of the House to ensure that these important issues are understood across government and not only by the people who are paying attention to this particular point of order this afternoon. The 2016 guidance produced by the Cabinet Office on the handling of parliamentarians' correspondence goes into some detail, which I won't quote in full here, but the honourable gentleman is right in pointing out that that guidance says that departments should treat correspondence with great care to ensure that confidentiality is not broken. It also states that official replies to letters from MPs should be authorised in exceptional circumstances only. Now, it would appear that guidance has possibly not been followed in this case. I would have said to the honourable gentleman, I will make sure that the Minister gives an answer to this, but I'm delighted to say that the Minister in question is here in the chamber, and I will call her to respond to the point made by the honourable gentleman. Minister Nadine Dorries.
Thank you, Madam Deputy Speaker, and I thank my honourable friend for his advance notice of his point of order, because in the very short time I've had, it's enabled me to do some investigation and officials to investigate to find out what has happened in this situation. And the chronology is that the department was passed a letter sent to me by the honourable gentleman on the 26th of May. The letter raised some very, very serious concerns about the conduct of a doctor working for a cosmetic surgery provider referring UK patients for consultations with a former doctor who was struck off by the General Medical Council in August 2020 and who is now based in Italy. I think my honourable friend and I have had a number of conversations around the cosmetics industry and issues of this nature, and therefore he understands why I've taken this so seriously. Due to the nature of the allegations and the potential implications for patient safety, which I take very seriously, particularly when they pertain to women, my department raised the issues set out in the letter with the GMC, the General Medical Council, and it was also passed to the Care Quality Commission, which is responsible for regulating providers of cosmetic surgery in England, and that was to enable it to consider the issues that were raised. So they needed to go back to the provider to find out whether the allegations were true and to find out what happened in this situation. I take these complaints very seriously. We now need to find out, I can give him his assurance that, as he is aware, as we've spoken about, I hadn't even seen the letter yet myself. I can only believe that the process of sharing the letter with the GMC and the CQC was to ascertain what happened in order to inform a letter that I then sent to him. I've yet to see the letter. I take these complaints incredibly seriously. My department is reviewing how this information and the letter was handled and how the information was leaked, and I will write to him once our inquiries have been satisfied, and as he and I have previously discussed, I shall also write to his constituent.
Thank you. I hope the honourable gentleman is satisfied that the point that he's raised has been taken very seriously by the Minister, and the House will be pleased to know that the Minister and her department are taking this matter very seriously. Indeed, I will happily tell Mr. Speaker that that is the case. I will now briefly suspend the House for 3 minutes in order that arrangements can be made for the next item of business. Order!
already. Okay. Order. We now come to presentation of the bill. Secretary of State for the Environment, Food and Rural Affairs, Minister Donald. Oh, marvellous. Right. Second reading. Oh, sorry.
Kept Animals Bill.
Second reading what day?
Tomorrow.
Tomorrow. Okay. Right. We now come to the emergency debate. I now call Andrew Mitchell.
Thank you, Mr. Speaker. I draw the House's attention to my interests set out in the register and beg to move that this House has considered the matter of the 0.7% official development assistance. Mr. Speaker, yesterday you made one of the strongest statements I have heard from the Chair in more than 30 years, and you made it clear that the House should receive from the Government a meaningful vote. Naturally, Mr. Speaker, in accordance with what you have said, we are not seeking to divide the House on this motion today. We seek the meaningful vote which enables the House to decide whether the Government can break our promise and arguably our law. And I see, Mr. Speaker, that I and my right honourable friends are described as rebels. Mr. Speaker, it is the Government that is rebelling against its clear and indisputable commitments. And who, Mr. Speaker, are these so-called rebels? A short perusal of yesterday's order paper shows we have among our number 8 select committee chairs, 4 distinguished former select committee chairs, 16 former ministers, 12 privy councillors, and 4 knights of the realm. And from the new intake, my honourable friends for Totnes, Milton Keynes North, Bury South, Penrith and the Borders, and Keighley, and others too recently arrived in this House, who have shown great courage and determination in the face, Mr. Speaker, of the possibility of being tarred and feathered by the Government Whip's Office. We are also supported, Mr. Speaker, by every former Prime Minister, and I believe every former leader of all 4 major political parties. And the Archbishop of Canterbury said this over the weekend. He said, and I quote, "The foreign aid cut is indefensible. Let us pray it is reversed and that our unconscionable broken promise to the world's poorest people is put right." And all 4 distinguished chairs, current and former, who are in the House of the Public Accounts Committee support our cause. My right honourable friend for Gainsborough, who describes himself, I think, as the last Thatcherite on these benches. Possibly my right honourable friend might wish to disagree, but he said this, Mr. Speaker: "There is no public accounting justification for slashing budgets by 80% in this way. It's like telling the builder before he finishes your garden wall that you won't pay at the end. Cancelling projects overseas is just a waste of taxpayers' money when we should be providing long-term stability for schools, clinics and clean water projects." My right honourable friend is absolutely right. I give way, of course.
Can I congratulate him on bringing this forward, and the House is very much united behind him. But I just want to say this: it's not just the scale of the AIDS cuts, but it's also the speed at which operations are being forced to shut down, which is hugely harmful. Aid and development is not a tap that you can turn off and turn on whenever you like. It's time for government, really, on this occasion, to step up to the spot and make sure that they reinforce and increase the aid budget back to where it was in the past.
Before we do, I'd just gently say, with a lot of speakers, and I do want to hear from everybody, if we are going to intervene, I'm sure you'll understand if you go down the speaking list. Andrew Mitchell.
Thank you, Mr. Speaker. My right honourable friend is absolutely right, and of course what he is saying has been reinforced, I think, by every single member of his party who serves in the House of Commons. And of course it's the point that my right honourable friend, former chairman of the Public Accounts Committee, was making, that if you turn on and off this expenditure in this way, the taxpayer doesn't get proper value for money. Nor, Mr. Speaker, is this about party politics. All 650 of us in this House, elected at the last election, promised to stand by the 0.7. The bill enshrining the 0.7 in law was passed unwhipped in this House with just 6 dissenters. And outside of this House, Mr. Speaker, in every single constituency in this country, there are people taking action as part of this growing environment and development group called Crack the Crises. Each and every one of us is accountable to these constituents who are taking action in their local schools, colleges, churches, mosques and charity shops, women's institute branches, congregations and community groups. 12 million people, Mr. Speaker, are supporters of the member organisations of this coalition of 12 million people, and they must be heard. That's on average across the House, 15,000 per parliamentary constituency. And the people who sponsor children through development organisations, the members of churches who are twinned with others in the developing world, the people who were there for Jubilee 2000, for Make Poverty History, they don't forget when we break our promises to them. They organise. And I can assure the House that were it not for the COVID restrictions, the same people who made the human chain around the Birmingham G8 summit and the 250,000 people, Mr. Speaker, who marched on Edinburgh before the Gleneagles G8 would be preparing today to descend on Cornwall to make their views known at this G7 and to protest this unethical and unlawful betrayal. And they would be joined, Mr. Speaker, by a whole new generation of young people who are today watching this government breaking our promise to the world's poorest. They do not like what they see. And this weekend, Mr. Speaker, they may not be on the streets, but they will be watching and they will remember. Mr. Speaker, for 2 decades, UK has been a development leader, not just because it's morally right and accords with our values, but because it's in our own national interest. By making the countries we seek to help safer and more prosperous, we make life for ourselves here in Britain safer and more prosperous. I will.
I'm most grateful. And he has been courteous and persuasive in trying to get me to join his cause, but I have declined to do so because I think this government is doing precisely what he describes, but in ways that do not qualify as aid. And I've asked the government to clarify all the other things that we're doing that are contributing to reduction in global poverty, and indeed what we will do with the vaccine programmes in future to contribute to alleviation of disease and distress in the poorest countries.
Well, I very much hope that my honourable friend will stay for the whole debate, so he hears the views across the House, and I think he will. I'm sure that will be both instructive and interesting for him. Mr. Speaker, the way the government is behaving strikes at the heart of our Parliament, as you set out from the chair yesterday. We cannot secure a meaningful vote. Had we been able to do so yesterday, as I intimated to the House, we would definitely have won by 9 and probably by nearer 20. And it is precisely because the government fears they would lose that they are not calling one. Mr. Speaker, that is not democracy. When countries behave like that in Africa, we British, we say that they got it wrong. And the government needs to remember that the government and the executive is accountable to Parliament, not the other way round. And most especially, as this minister, very good minister, especially knows, on issues of supply. And that applies in all circumstances, whether the executive is being run by King Charles I or Boris Johnson. Now, Mr. Speaker, the government makes 2 key arguments.
King Charles II.
The first is that it is still spending a huge amount of money, and I'm sure that's what my right honourable friend will say this afternoon. And the second is that we are living in unprecedented times for our economy, and they will bring it back. So let me start first with the first one of those, that we are still spending a huge amount of money, and of course he is entirely correct. But we promised, all of us, to spend 0.7% of our GNI, not to change the target and spend 0.5%. All of us made that promise. I've seen every single member of the House's manifesto at the last election, and every single elected member made that promise. And it is arguable, at the least, that the action the government is taking is unlawful. One of the most senior and distinguished lawyers in the country, the Warden of Wadham, Oxford, the former Director of Public Prosecutions, has made it clear that the government is acting unlawfully because they have changed rather than missed the target. And I want to argue to the House this afternoon that what the government is doing is unethical, possibly illegal, and certainly breaks our promise. And on the point of the level of expenditure and the £10 billion, it's rather like buying a car and shaking hands on a deal at 15 grand, only to do a runner while the poor fellow is counting the cash after you've legged it, having handed over only 10 grand. And it's not proper, and it's fundamentally un-British, and we shouldn't behave in this way. It's about the girl whose school closes in South Sudan last week after the head teacher reads the letter from the Foreign Office explaining that it is only temporary. And the second argument, Mr. Speaker, is that we live in unprecedented economic times and that the government will bring it back. But, Mr. Speaker, the point 7 is configured precisely to take account of our economy. When the economy contracts and goes down, so does the amount of money spent under the point 7. And when it increases, it goes back up. And we're talking, Mr. Speaker, about 1% of the spending on COVID last year by the Treasury, quite rightly spent to sustain and support jobs and families and employment. This is 1%. It's practically a rounding error in my right honourable friend's books. And we offered an olive branch last night to the government, which the government could have accepted, and then we could all have cracked on with other things, by saying bring it back next year. We'll accept that they're not going to bring it back this year. Bring it back next year when the Governor of the Bank of England says that the economy will have rebounded to pre-COVID levels and growth would be strong. So if the government was serious about bringing it back when the economy improved, they would have accepted the olive branch that I and my right honourable and honourable friends offered. And the truth, Mr. Speaker, is everyone knows what this is about. It's not about the 1% rounding error in the Treasury's books. It's about the red wall seats. The government thinks that it's popular in the red wall seats to stop British aid money going overseas. Indeed, one Treasury Minister told me that 81% of people in the red wall seats do not approve of spending British taxpayers' money overseas. But, Mr. Speaker, you have to be careful about the question you ask, because other polling in the red wall seats shows that 92% of people there do not approve of cutting humanitarian aid. And it's also a very patronising attitude to people who live in the red wall seats, because in those seats, when these famines and disasters and dreadful experiences and floods and so forth take place, it's the people in the red wall seats who are the first to raise money through carte booth sales and pub quizzes to try and help those who are caught. So in the words of Talleyrand, the French statesman, this is worse than a crime. It's a mistake. And what I and my right honourable and honourable friends, the so-called rebels, are trying to do is to keep the government straight. And so, Mr. Speaker, we come to this week's G7 summits, when the leaders of the richest nations will assemble in Cornwall. And we will be chairing that summit, Mr. Speaker, my right honourable friend, the Prime Minister. And he goes into this summit in the teeth of a global pandemic where Britain is cutting its support to the poorest. No other country represented at the G7 is doing such a thing. The French have now embraced the point 7. The Germans will spend more than 0.7 this year. The Americans, by far the biggest funders in the world, are seeking an increase through Congress of $14 billion, an increase, Mr. Speaker, in the amount that is spent. We are the only ones going backwards. And other G7 countries are noticing what the government is doing. In a letter by a dozen members of Congress, is it any wonder that they have urged President Biden to upbraid Britain for breaking its promise? One sentence in their letter made me wince. It reads as follows, and I quote, "Cutting back on foreign assistance during the worst humanitarian crisis of our generation only undermines our collective global responsibility." And as the journalist who used to serve in this House and who probably understands the Conservative Party best, this is what he said at the weekend, and I quote again, "Try those seasick government whips will to mount one, there is no civilised defence of this cut. The cut looks like what it is, a cheap and brutal gesture, a piece of domestic applause seeking." And so I give way to the right honourable gentleman.
He's making a brilliant speech. I just want to flush out one point which I hope will be a point of consensus. It is possible this weekend that we get agreement on a fresh issue of $650 billion in special drawing rights. The UK will have surplus SDRs, and it's possible that they could be recycled to support aid. It would be a regrettable accounting trick if that in any way counted towards making good the cut that has been made. Is that a point of consensus across the House?
Well, the right honourable gentleman makes a good and useful point, and the decisions that are made on the SDRs will be extremely helpful. And if I may conclude, and so we come finally, Mr. Speaker, to the essence of all of this. For because of the way the development budget is configured, these terrible cuts are falling first and hardest on the humanitarian sectors. And let me just mention 4 of them. The first, girls' education, where the Prime Minister quite rightly has said it's his main aspiration on these international development issues, very strongly supported by my honourable friend from Worcestershire, to ensure that all girls get 12 years of quality education. It's a wonderful and it's a noble British initiative. But what has happened to the funding? It's been cut by 25%. So we have on the one hand the words, the aspiration, and then the reality that 25% of the cut has gone. And worse than that, Mr. Speaker, UNICEF, the children's UN agency, which has a fantastic reputation and which the British government judged just a few years ago to be the most effective of all the UN agencies, they have had a cut of 60%. And then we turn to clean water and sanitation, which is absolutely pivotal if we are to conquer this pandemic in the poorest parts of the world. 10 million people who were expecting to receive British taxpayer support will not now get it. And funding to the UN to save the lives of people suffering with HIV/AIDS has been cut by 80%, Mr. Speaker, a death sentence for the people who would have been helped. And finally, we are going to end food assistance for 250,000 people. These are not people who have missed eating for a few days. These are people who are starving. And we are going to cut our support directly for these people. Now, Mr. Speaker, I have never forgotten the experience I had as Development Secretary in Karamoja in northern Uganda, where I stood under a tree next door to a football pitch, which was covered by children who were starving. There were about 200 children there. They were waiting in line. They were suffering from acute malnutrition. And British taxpayers' money and British humanitarian workers were trying to help them. And, Mr. Speaker, if you catch them early enough, when they're floppy, but when they're not actually medically critical, you give them Plumpy Nut. It's a biscuity, peanutty substance. It costs about 5p a head, and they will be recovered in about an hour and probably running around playing football. But if you miss that point, then they have to go into a clinic, they have to have a drip up, and it costs about $180 to put them right. I will give way to my own friend.
Just as a final intervention to my right honourable friend, doesn't that point that he's just made around 5p make the point that while 4 billion is a small amount for a rich country like us, 4 billion makes an enormous difference in the countries that we're trying to help?
My honourable friend is absolutely right, and he puts it enormously eloquently. And so, Mr. Speaker, I end my remarks by saying that that story from Karamoja in northern Uganda has lived with me from the day I saw these things. I will be thinking of those children in this debate, and I urge my right honourable and honourable friends to think about them as well.
The question is that this House has considered the matter of 0.7 official development assistance target. Can I just say brevity from everybody will allow more members to get in. And as I said, those that intervene won't mind being moved down, because that's the way that we're going to help each other. Right, I now call Shadow Minister Preet Corrigan.
Thank you, Mr. Speaker, and I thank my friend, the Right Honourable Member for Sutton Coldfield, for his great work in securing this debate alongside many other members from across both this House and the other place with a keen interest in this issue. It is a great shame that the government has had to be forced into this debate today when they promised they would bring legislation to Parliament to ask elected members of this House whether they supported these cuts to the aid budget more than 6 months ago. And I thank you, Mr. Speaker, for your support in allowing this debate. We clearly have a government in hiding, a government that has tried over and over again to avoid scrutiny and accountability for the cuts that they have imposed, drip-feeding the public information on where the cuts are falling and refusing to release the impact assessments or rationale behind any of those decisions. We've been told conflicting accounts about whether impact assessments have actually been carried out on the cuts, suggesting either that the Secretary of State failed to ask for any, in which case he is clearly out of his depth, or he is afraid of the public learning the true impact of the cuts and the lives lost. So which is it? We are no strangers to hyperbole in this House, but it really is no exaggeration to say that the cuts to the aid budget by this government has cost people their lives. It is utterly shameful. And Mr. Speaker, let's not pretend that FCDO ministers are not ashamed of the cuts foisted upon them by the Chancellor and waved through by a Prime Minister either too weak or too incompetent to impose them. The Secretary of State and his ministers are the ones who have had to front debates, meet with their counterparts and post videos talking about the importance of clean water and sanitation while slashing funding by 80%, meaning 8 million fewer women and girls will have access to the most basic necessity of water. Or the life-changing impact of girls' education. A priority, says the Prime Minister, as he hopes no one notices, whilst cutting the education budget by 40%, meaning 700,000 fewer girls will receive an education. The government says Britain's focus should be on human rights, but they have halved the funding to the Human Rights, Democracy and Rules-Based International System programme. Why should we or the British public trust a word this government says? Yesterday, members of Parliament from across this House were ready to show that they do not support this government's callous and counterproductive cuts to the aid budget, because the real consequences are already being felt in Britain as well as the world. The Development Secretary has cut funding of research programmes by 70% that were tracking COVID-19 variants of concern around the world, including the Delta variant, making the British public less safe. Britain has built up a reputation as a global development power, thanks to our aid commitment. Our dedicated development workers, our academics, our researchers and scientists, strengthening our position in the world with both our allies and detractors. This government is tarnishing our global reputation, tarnishing our soft power and our national interest. And the US Democrats have said, as my right honourable member for Sutton Coldfield said, they say cutting back on foreign assistance in the middle of the worst humanitarian crisis of our generation only undermines our collective global response to the pandemic. And they are right. With days to go until the G7 summit, choosing to continue with this cut would see this government persist with undermining the UK's credibility on the world stage while ignoring its commitment to the world's poorest and most vulnerable people on earth. Britain is a proud, generous and caring country, and these cuts are an insult to the British people and our proud tradition of showing humanity and leadership on the world stage. Members of the US Congress and the Biden administration are already warning the Prime Minister about the impact of these aid cuts. During this deadly pandemic, global leadership and unity is more important than ever. But as the only G7 nation to cut aid and the third lowest donor this year, this signals a retreat. So much for global Britain. If we are really to assert ourselves on the world stage, we must be a country that looks outwards, a country that builds relationships outside our borders to tackle the global challenges of the future. This government has a choice. Continue down a path which will cost more lives, or listen to colleagues today across Parliament and end this retreat today by reinstating our commitment to 0.7% as a matter of urgency. Thank you.
Minister Stephen Bartley.
Thank you, Mr. Speaker. And let me begin by acknowledging the words and the good intentions of my right honourable friend, the member for Sutton Coldfield. He knows, as well as I do, that decisions such as this are not easy. The situation, in short, is this: a hugely difficult economic and fiscal situation, which requires, in turn, difficult actions. Mr. Speaker, responding to twin health and economic emergencies, the government has acted on a scale unmatched in recent history, to protect people's jobs and livelihoods and to support businesses and public services, with £352 billion of support since the start of the pandemic for last year and this. This is equivalent to 17% of GDP and one of the largest fiscal support packages of any country in the world. And our plan is working. The economy grew by 2.1% in March alone. The Bank of England now expects the economy to return to its pre-crisis levels by the end of this year, 2 quarters earlier than previously expected. At the beginning of the crisis, unemployment was forecast to reach 12% or more. The latest projections, Mr. Speaker, show that it is due to peak at 5.5%, meaning almost 2 million fewer people will lose their jobs than were expected to do last spring. But as the House notes, much of that response has relied on borrowing. Last year saw the highest peacetime levels of borrowing on record, £300 billion of borrowing. And we are forecast to borrow £234 billion more this year, and indeed a further £109 billion the following year. So without corrective action, borrowing would continue at untenable levels, leaving underlying debt rising indefinitely. Now, at our higher level of debt, the public finances are more vulnerable to changes in inflation and interest rates. Indeed, a sustained increase in inflation and interest rates of just 1% would increase debt interest level spending by over £25 billion in 25-26. So the goal of any government should be sustainable finances, but the current level of borrowing are, Mr. Speaker, not sustainable. Now, my right honourable friend used a number of very emotive terms around the morality of the context of these changes. But leaving the next generation vulnerable to the degree of fiscal threat that would be entailed with a high debt level is not itself morally sound. And at the same time, loading ourselves with more debt now might well damage our ability to spend on aid later. There are some in this House who say that since we're already borrowing to protect jobs and businesses, what is £4 billion more? Indeed, the nature of the intervention from the member for Winchester. Well, in a moment. Crucially, the only reason we were able to act during the pandemic in the way that we have is because we came into the crisis with strong public finances. And we believe it is our duty as the economy recovers to return to a sustainable fiscal position. Of course I do.
I'd like to thank the Chief Secretary for giving way, and I appreciate his fiscal stance, but why is it, can he explain to the House, that the only manifesto pledge that he has chosen to break is the one that forces the World Food Programme in South Sudan to choose between feeding hungry children and starving children?
Well, the point is we have made a number of difficult decisions, and I will come on to that. But also we continue to be spending £10 billion in response to the commitments that we have made. And as a former Treasury Minister, I'm sure she is well aware of the fiscal reality that we face. Strong public finances means making difficult decisions, such as increasing corporation tax, one of the difficult decisions my right honourable friend the Chancellor has made, alongside the decision around overseas aid. And indeed, Mr. Speaker, this is something that the International Development Act of 2015 explicitly anticipates when it refers to the effect of one or more of the following: economic circumstances, and in particular any substantial change in gross national income; fiscal circumstances, and in particular the likely impact on meeting the target on taxation, public spending and public borrowing; and circumstances arising outside the United Kingdom. In other words, the 2015 Act clearly envisages situations in which departure from the target may indeed be necessary. It provides for the Secretary of State's accountability to Parliament by way of the requirement to lay a statement before Parliament, and if relevant makes reference to economic and fiscal circumstances as well as circumstances outside the United Kingdom. And indeed, the Foreign Secretary has already committed to doing so as required by the Act. So, of course.
Thank you, Mr. Speaker. Thank you, Minister, for giving way. But that accounts for the cuts in July, but surely it was a political decision to cut to 0.5 and potentially an unlawful one in November.
The point is, Mr. Speaker, as the provisional data shows for the 2020 ODA figures, the 0.7 was met. The point is the Act allows for the economic and fiscal instance that I just set out. It is actually within Section 2 of the Act. And indeed, if the UK were to spend 0.7% of gross national income as the ODR, it would cost the country an additional £4.3 billion this year. And so, given our commitment to fiscal sustainability, we could offset that by either raising taxes or by cutting public spending. And to put that in context, well, we can come on to that, put that in context. 1p in increase in the basic rate of income tax, or around a 1% increase in the standard rate of VAT, at a time when taxes are at a historic high. Of course I can.
The Treasury really must do better with their figures than that. 1p on income tax is worth nearly £6 billion, so it's much less than 1p.
Well, in the context, 5 to 6 billion, but the point is that what he didn't set out in his speech is to address the gap, which were the fiscal measures that my right honourable friend was suggesting. Was he suggesting a specific task, in which case I did not hear that in his remarks? Was he suggesting on borrowing, in which case one needs to look at the impact on our stock? Was he indeed suggesting spending? From their sedentary position, the Right Honourable Lady mentioned test and trace. 80% of the test and trace budget relates to testing. If she is saying she wants to get rid of PCR testing or lateral flow testing, she needs to set out that detail, Mr. Speaker, but that speaks to the lateral detail that we have and that is strikingly absent from the alternatives put forward. The fundamental point before the House, Mr. Speaker, is that the scale of our overseas aid remains significant. In fact, we continue to lead the world in overseas development. This year, we will spend more than £10 billion to improve global health, fight poverty and tackle climate change, including £400 million on girls' education in 25 countries, and we're doubling our commitment to international climate finance to £11.6 billion for the period 21 to 26, with at least £3 billion for climate change solutions that will protect and restore nature and biodiversity. And according to the OECD, in 2020, we were only one of only 2 G7 countries to actually meet the 0.7% target, and the only country to do so each year since 2013. Even after the change we are debating today, we're still the 3rd largest donor in the G7 as a percentage of gross national income. And 0.5% is considerably more than the 29 countries on the OECD's Development Assistance Committee, who average just 0.41%. Importantly, Mr. Speaker, the Foreign Office makes its aid spending choices based on maximum impact, coherence and value for money. The integrated review has reaffirmed our pledge to fight against global poverty and to achieve the UN Sustainability Development Goals by 2030. We're the 5th largest contributor to the UN peacekeeping budget, the 3rd largest bilateral humanitarian donor, the 2nd largest member state donor to the World Health Organization, and among the world's largest donors, Mr. Speaker, to the COVAX Advanced Market Commitment, the global initiative supporting developing countries with access to vaccines. And the funding will continue to make available to countries all over the world is helping to educate young girls, it's boosting diversity, it's tackling climate change, it's vaccinating the needy against deadly disease like Ebola and malaria, and it's improving the nutrition of staple food crops. Millions of lives improved, millions of lives saved. So, Mr. Speaker, this is a generous and outward-looking country whose impulse has always been to help others around the world. We don't and we won't shy away from making a determined contribution to the world's problems. But at the tail end of a huge economic emergency, we also have a responsibility to the British people. We are absolutely clear about our intention to return to 0.7% of our national income on overseas aid when the fiscal situation allows, but cannot do so yet. We will, however, keep the matter under careful and regular review. I know that members on both sides of the House will make their cases cogently and passionately. But for now, Mr. Speaker, the tough choice is the right choice.
We now come to the Leader of the SNP, Ian Blackford.
Thank you, Mr. Speaker. I can't help just reflecting on what the Minister has delivered in the phrase that's often used, that he knows the price of everything and the value of nothing. Mr. Speaker, let me begin by commending the efforts of all those that have made it possible to have this emergency debate today. Those that requested the debate, led by the Right Honourable Member for Sutton Coldfield and yourself, of course, for granting time today. As we know, it's not been an easy task getting to this point, a point where this government has been finally held accountable to its actions and made to answer for what is a callous cut to overseas aid. Because, let's be very clear, this Tory government has been shamed into coming to the House today. Ever since announcing this disgraceful decision to slash aid for the world's poorest, the government has been on the run on this issue. For weeks now they have avoided questions, dogged accountability, but they've been dragged to the dispatch box today. And as usual with this government, the person most responsible for this decision to cut aid is the person first to hide and the last to face accountability. On an issue of this importance and a policy this fundamental, it tells you everything that you need to know about this Prime Minister, that he doesn't even have the guts to come before this House to justify his government's decision to cut support to those most in need. He is a Prime Minister who casually signs off on these devastating decisions, but a leader who always fails to take any responsibility for the consequences of these decisions. And no damaging decision appears to be off limits for this government. Overseas aid, living up to our legal responsibilities, Minister, to those most in need, should be something that unites various strands of political opinion across this Parliament. Instead, that moral mission of 0.7% spending is being shamefully undermined by a morally bankrupt government. Mr. Speaker, it is also important to put this decision into a broader context, because cutting the aid budget is not alone cruel and counterproductive on its own terms. It's also an isolated act from a UK government increasingly alone on the world stage. The UK is virtually the only country that has cut its aid spending. Nearly every other wealthy country has recognised the greater necessity of helping those in need at this unprecedented time of a humanitarian crisis. The government's timing couldn't be worse. International opinion on these cuts is crystal clear. It is rightly seen as a disgraceful abdication of the UK's international responsibilities in a year, Minister, where we should be showing some international leadership at the G7 and the COP26. Simply take a look at what some of these G7 countries are doing in comparison to the UK. This year, Mr. Speaker, Canada's aid budget will see an increase of 28%. France will contribute a 36% increase, and under the Biden administration, the US will see a 39.4% increase. And yet, this Tory government thinks it's somehow morally justified to impose these cuts. It is morally and ethically flawed. It is intellectually flawed. And it shames all of us that this is done in our name, but I can say to the Minister, it is not done in the name of the majority that have been sent to this House. Mr. Speaker, the harsh reality is that this decision will cost lives. It will cost lives, Minister. Brexit Britain is rapidly exposing the future it offers, out of step and out of influence on the world stage. Because one thing is for sure, if the Tory government digs its heels in and slashes the aid budget, they are adding insult to injury to those dwindling few that still desperately cling on to the notion of global Britain. Mr. Speaker, digging into the detail of these cuts reveals what's at stake if they are allowed to continue. The headline figures are stark enough in themselves, with aid spending amounting to £10 billion this year compared to £14.5 billion in 2020. But it's the impact of where exactly these cuts will fall that tells the real story and exposes the real damage. Almost unbelievably, conflict zones are facing some of the worst cuts. Syria, Somalia, the Democratic Republic of Congo, Libya, Nigeria and the Lebanon, all, Mr. Speaker, are poised to lose more than half their funding. More than half the funding in the countries of conflict. Is that where we stand? Is that where the Minister stands? Is that where his government stands? Children are the next target, with the United Nations Children's Funds facing a cut of 60%. Mr. Speaker, this is harrowing. This is heartbreaking. May I ask the Minister, where is the government's humanity at a time of need? And some of the most established and impactful projects are equally at risk, with cuts to the UN agency that fights AIDS and HIV of £12.5 million. That's more than an 80% cut. An 80% cut in a programme to fight AIDS, condemning people to an early death that could be avoidable. Much has already been made of the fact that by imposing these aid cuts, the government are brazenly breaking their own manifesto commitment. In particular, though, I want to draw attention to the fact that they are breaking a very specific commitment they made to voters in terms of girls' education right across the globe. And I think it's worth putting this on the record of the House. In 2019, the Conservative Party manifesto promised, and I quote, to stand up for the right of every girl in the world to have 12 years of quality education. And yet, that promise has been broken. Analysis by Save the Children shows that spending on education for girls will be reduced by at least 25% compared to 2019-20 levels. This is horrific. So not only will these cuts impact now, the damage will reverberate into the future for those young girls and young women. Their hopes and fears crashed on the dogma of the desire to cut UK aid spending. Only this weekend, a letter from 1,700 charities and academics said that families are going hungry and girls are missing school as a direct result of these decisions. I can see the Minister is nodding. I'd ask him, please reflect. Please reflect and change the government's policy on what they're doing. Whether it's broad promises or specific promises, they're apparently all the same to this UK government. They are telling people that they think their promises are only there to be broken. Mr. Speaker, I want to say this though. I acknowledge and I give credit to the courage of the many Conservative backbenchers who stood against their Prime Minister, who is reneging on the very manifesto that he stood on. Their stance has given us at least a chance to face down the government on this issue and hopefully force a U-turn. But from a Scottish perspective, I can't hide my genuine disappointment that we can't count the Scottish Tories amongst the Conservative backbenchers with a backbone. For weeks now, they have maintained a deafening and shameful silence. But even at this late stage, they have the chance to do the right thing. Because whatever our differences, I think they know that cutting international aid during a pandemic does not represent the values of Scotland or the values of our people. That's why the Scottish Government is doing what it can with the powers it has at Holyrood, where we have increased international aid spending by 50%. That's what you do in a pandemic, Minister. So the Scottish Conservatives have a choice. Either fall in behind their Prime Minister, no matter what he decides, or join us in saying that these cuts to the world's poorest are not done in our name. If they fail to oppose these cuts, the Scottish Tories should be well warned. Not only would it be an inhumane act against the most vulnerable, but it would be an act of sheer hypocrisy. Mr. Speaker, let me conclude on this. Today's debate on aid spending is obviously all the more significant because of the place and the context in which we all find ourselves. Morally, we have a responsibility to help protect the most vulnerable around the world. But it's also self-evident that if this UK government is serious about the eradication of COVID-19, then it must include a commitment to helping eradicate COVID-19 around the world. Because until all of us are safe, none of us are truly safe. These aid cuts are severely undermining that commitment and limit our power in meeting the COVID challenge. But there is a broader point too. As we attempt to emerge from this pandemic, the values we live by and the choices we now make become even more important. COVID has affected every country and every person around the world. We have all faced the same threat. We have all been in it together. If we didn't know that before, we should know it now. But the truth is that just because we have experienced the pandemic together does not mean our challenges are in any way equal. We are privileged. We can live in the hope and the expectation that the crisis of the pandemic will pass. But for too many millions in this world, this pandemic is only one more disaster to deal with for these countries who suffer under constant crisis and struggle. Now is not the time to turn our face away from those countries and those people in need. Now is the time to redouble our efforts and our commitment to them. The World Bank predicts that the pandemic will push an estimated 88 to 115 million people into extreme poverty. And in the world's poorest countries, hunger and the causes of malaria are rising. So unless we act now, one crisis will be followed by another, and the cycle will go on and on and on. We simply can't break that poverty cycle by breaking our commitment to overseas aid. This is the choice for the government. It is the choice for every member of this House. On these benches, our choice is clear. It is time to live up to our commitments on aid spending. It is time to live up to our responsibilities to the world's poorest. It is time to break the cycle.
Can I just say that if we can try and help each other now with brevity, it would be very helpful. Theresa May.
Thank you, Mr Speaker, and thank you for granting permission for this debate today. I oppose the cut from 0.7% in international development funding for 3 reasons. First, I stood at the election on a manifesto which said, and I quote, "We will proudly maintain our commitment to spend 0.7% of GNI on development." Now, the government will say, as the Chief Secretary has today, that COVID has changed the circumstances. But the government is also taking pride and responsibility for the fact that our economy will bounce back this year. And COVID has also changed the circumstances for the poorest people around the world. And for many of them, there will be no bounce back, because for some of them, it will simply be too late. So I urge the government to stand by its word and stand by its manifesto commitment on international development funding. My second reason is the impact, which I've just alluded to, that this cut will have on the poorest people around the world. My right honourable friend, the member for Sutton Coldfield, in his thought-provoking and forceful speech, gave us some examples of the impact this cut will have, the damage it will cause to lives, the lives that will be lost. I want to just mention one particular area of interest to me, modern slavery. As one example, the Global Fund to End Modern Slavery is having its funding cut by 80%, 80%. That means that programmes will be lost, including programmes to work to end the commercial sexual exploitation of children, with all the damaging and devastating impact on young lives the loss of that programme will have. Now, the Global Fund will try to restore that money from elsewhere, including from other governments. The United Kingdom has been the world leader in tackling modern slavery. Now we see organisations having to go cap in hand to other governments to make up for the shortfall that caused by the UK's decision to cut international development spending. Aid spending isn't just about people in countries far away. Tackling modern slavery has an impact here on the streets of the United Kingdom. Supporting economic development elsewhere will help to cut the number of people who feel they have to migrate to the UK in order to look for work. And cutting ODA spending has an impact on other government departments. I recall in the Home Office, we used ODA spending to fund some of the work we did with refugees. Now, if you cut that funding, either the work won't be done, or the Home Office will have to find that money from other parts of its budget. And the third reason why I oppose this cut is because of the impact on the UK's standing in the world. People have respected us for our commitment to 0.7%. Now, as we've heard, we're the only country in the G7 that is cutting aid at this time. People don't listen to the UK because we are the UK. They listen to us because of what we do, They listen to us because of how we put our values into practice. And our commitment to that 0.7% has enabled us, for example, to argue the case for different definitions of ODA spending. So cutting this will have an impact on our standing. Will we suddenly see countries cutting us off? No. Will we suddenly be kicked out of international tables? No. But the damage it does to our reputation means that it will be far harder for us as a country to argue for the change that we want internationally. That is across the board, including at COP26, and also including setting out and putting into place the ambitions of the integrated review. An integrated review which, in reference to modern slavery, I see, doesn't even mention modern slavery as one of the development priorities of this government. I only hope that modern slavery is still there on the G7 agenda, as it has been in the past. So this cut from 0.7% will have a devastating impact on the poorest in the world, and it will damage the UK. I urge the government to reinstate the 0.7%. It is what it promised. It will show that we act according to our values, and it will save lives.
Sarah.
Thank you, Mr. Speaker, and thank you for your assistance in securing this debate. I think the number of people that have campaigned on this for the last year, but also that want to speak today, shows the true strength of feeling on this and the cross-party support for this. Mr. Speaker, I want to talk today about hypocrisy, and it's something that I just can't stand. And unfortunately, the government's approach to ODA foreign aid spend is dripping in hypocrisy. It has stated its 7 global priorities. We know the priorities for the G7 coming ahead, but unfortunately what it actually doesn't match up in any way. And I want to use this speech just to highlight specific examples of where it is failing. So global health security. We're cutting by 95% our funding to the Global Polio Eradication Initiative at the exact moment that we're about to eradicate polio. UN AIDS cut by 83%, impacting the provision of life-saving HIV treatment to the most marginalised. A programme by the Liverpool School of Tropical Medicine building stronger, more resilient health systems in low and middle-income countries is cancelled. King's Global Health Partnership programme saving lives due to improve care for thousands of pregnant women cancelled. Funding for neglected tropical diseases wiped out. Funding for life-saving water, sanitation and hygiene projects slashed by 80% in the face of COVID-19 and climate change. Concerned worldwide project providing healthcare to people living in remote and disadvantaged areas of Bangladesh terminated. This was due to reach 2.6 million people, including 140,000 living with a disability. The G7 foreign ministers committed to end violence against women and girls, while girls' education is a key priority for the government. Yet, Women's Integrated Sexual Health Programme is cut by 72 million. International Planned Parenthood Foundation described this as a brutal blow for the world's poorest and the world's most marginalised girls. UK Bangladesh Education Trust Project, educating girls forced into domestic labour, has been cut entirely. In Tanzania, Children in Crossfire and UK's AIDS project supporting children, including disabled children, access education cut entirely. UNFPA is cut by 85%, potentially leading to 25,000 unintended pregnancies. STIR education projects supported marginalised families across Uganda. Access education cut entirely. SALV's project supporting girls living on the streets to return to school is cut entirely. Women for Women Female Empowerment Project in Nigeria and Afghanistan terminated, leaving thousands of marginalised women abandoned. UNICEF's core funding cut by 60%, impacting their ability to provide children with access to water, sanitation, education and health services. An IRC project in Lebanon to prevent and respond to gender-based violence and child protection has been cut, depriving 107,000 from accessing these services. In Sierra Leone, the budget for an IRC programme was cut by 60%. It reached over 3 million people, mostly adolescent girls. Humanitarian preparedness and response is also a priority.
alongside the G7 commitment to support developing countries tackle and prevent humanitarian threats. Yet, aid to support Rohingya refugees in Bangladesh cut by 42%. Mines Advisory Group programmes cut by almost 50%, with all funding for work in Lebanon withdrawn. Humanity and inclusion projects providing speech and physiotherapy sessions for disabled Syrian refugees is cut entirely. Tomorrow's Cities project, working to reduce the risk of disasters such as earthquakes, volcanoes, landslides to poor countries, is cut by 70%, compromising the ability of vulnerable communities to respond to disasters. Aid to Yemen slashed by nearly 60% in the face of catastrophic famine. I could go on, and these are only the beginning of the cuts that this government is bringing. It not only wrecks our international standard, it wrecks the security of this country as well, because we are cutting money, not just humanitarian projects, but projects to prevent conflict, projects that prevent poverty. And what is one of the main drivers of conflict around the world? Unstable governments, famine, and lack of opportunity. We were the leading country in the world on a number of these projects, which kept us safe and allowed the world to prosper. By cutting these, by stubbornly refusing to give us the data of when the fiscal circumstances allow for us to go back to 0.7, you are undermining this country and the investment made thus far by the taxpayer. Thank you, Mr. Speaker.
Thank you, Mr. Deputy Speaker. I can be very brief. The arguments for the moral case that we're arguing today should be clear to anybody who's listened to the discussions of the last few days, weeks and months. The arguments on the financial grounds are clearly wrong, the government's arguments, clearly wrong. This is a rounding error in the national accounts. The Treasury cannot forecast the economy to within £4 billion each year. So how can they account on that basis for this judgment? I've heard that the argument, that the reason for it is political, that it's a judgment that the working class of the northern red wall seats do not like foreign aid. Well, I've defended a blue brick in that red wall for 33 years, and I can tell you that they're wrong. The simple truth is that if you say to somebody in one of those seats, do you want to spend money on the Ethiopian Spice Girls? They'll say, no, I'd rather spend it on the local school or cutting poverty in Barnsley or whatever it may be. But if you ask them the proper question, the real question, they'll give you the real British generous answer. If you say, do you want to act to prevent children dying from dirty water? 76% will say yes. If you say the same about starvation, about the same number will say yes. If they say, do you want to act to prevent an emergency and a crisis? 92%, my right honourable friend said it, will say yes. 92% of all British citizens will want their money spent on that. So what would they think of the 60% cut in the contribution to Yemen, the most difficult emergency in the world today? Or South Sudan, or the DR Congo, or Syria? These decisions have consequences, and they are just as smart as we are. They will see those consequences too. In the Sahel, 270,000 people get medical support, which is life-saving. Life-saving medical support, and that's going to be cancelled this year. Now, that's interesting, isn't it? Because we're also sending 200 British soldiers to the Sahel to help suppress terrorism. And what will this do for that? This will be a recruiting sergeant for terrorism in the Sahel. So this is actually acting against our interests and against our soldiers' interests. And we should remember that when we're doing our accounting sums. And bear in mind that this won't just be poverty. It'll be poverty which will be blamed on the West by the people who are acting against us in the Sahel. So the Minister claimed that our actions, the actions he's outlined, are in our national interest. Well, in the long run, doing the morally right thing is what is always in our national interest. This is not the right thing. It's the morally wrong decision for the world, and it's the practically wrong decision for our country.
Hilary Benn.
Thank you very much indeed, Mr. Deputy Speaker. Well, this issue isn't going to go away, is it? Why? Because it's about the promise. The brilliant speech made by my right honourable friend, the member for Sutton Coldfield. It's about the promise we made to people who, in all likelihood, know nothing of its existence, but whose lives have been changed by our generosity. People who've drunk clean water, people who've gone to school, mothers who've seen their babies safely delivered or been vaccinated, thanks to the immense generosity of the British people. And therefore the question is a very simple one. How can it be right or moral to break this particular promise that we gave in good faith to others? Well, the answer's very simple too. It isn't. It's wrong. And as we've heard, it is damaging our international reputation. I say to the Minister, the Prime Minister will sit down opposite the G7 leaders at the end of this week, who are facing exactly the same fiscal pressures as he is. But has the United States or Germany or France or Canada or the other G7 countries cut their aid budgets? No, they haven't, because they understand the moral argument. And why have we... well, I will give way.
He listed a few countries there. Of course, none of those countries actually commit to 0.7% of their GDP anyway.
With respect to the honourable gentleman, it is not the point. We made a promise, and I presume he is as committed to keeping promises he makes as the rest of us here in this chamber. And what of the human cost? We heard from the Right Honourable Member for Maidenhead in her powerful speech. Lives blighted, lives shortened, lives lost. Let me just take one example. How can it be right to cut aid for clean water by 80%? Now, the arguments against doing that are so strong. The importance of clean water for hand washing in a pandemic. The fact that the single most important thing we can do if we want to reduce infant mortality, apart from improving immediate postnatal care, is to provide clean water. Because every day, babies and small children die because they drink dirty water. And the fact that clean water helps girls to go to school, the very thing that the government says is a priority. And I learned as the International Development Secretary, and the Right Honourable Member for Sutton Coldfield talked about his experience. And there are those moments, well, those of us who have the privilege to do the job, when our minds are changed and we learn and we understand. And we realise why something is so important. And in this example, I came across a well one day, and a lot of people standing around it, and I was told that the well was closed. Now, Mr. Deputy Speaker, I'd never come across a closed well before. But it was explained that because demand for water in that part of the city was so high, that after the first rush of buckets were drawn from it in the morning, the well had to be closed so the water table had time to replenish to allow the well to be reopened. And one of the people waiting was a girl of about 13 or 14. The well was here, and she was standing there. I can remember it to this day. And she told me in a very quiet voice that it was her responsibility in her family to get the water every day, because until she did so, she could not go to school. And because the well was closed, not just that day, but many days, she was often late for class. And that's what this is about. A lack of plentiful clean water that all of us here take for granted meant a lack of education for her and millions of other girls like her. And are we really going to say that it is acceptable to cut our support for clean water? Is anyone actually going to argue that these cuts are popular with the British people? Because I fundamentally disagree. The British people are much more compassionate than that. And Mr. Deputy Speaker, it's not a competition between charity at home and aid abroad. We can, we should, we must do both.
Video link, and with immediate effect, a time limit of 4 minutes. Sir Roger Gale.
Thank you, Mr. Deputy Speaker.
I want to touch on the two aspects of this, the core aspects, the political and the humanitarian. Dealing first with the political, we are promoting global Britain, we are told. And we are taking our place once again proudly on the world stage, we are told. And that is right and that is good. But if we are going to do that, then we have to be able to hold our heads high. And I cannot see how damaging some of the poorest people in the world is going to enable us to do that. But politically as significant is the fact that where we leave a vacuum, others will fill that vacuum. And those others will be China, the Russian Federation, and Russia's client states, Azerbaijan, Belarus. And I just wonder how many colleagues are prepared to see the emerging democracies turn to communist dictators for their assistance because we've pulled the rug out from under them. And second, and this has been touched on over and over again, of course, is the humanitarian effect of this. And in 38 years tomorrow, in this House of Commons, I've been privileged to travel fairly widely to some of the poorest regions of the world. I assume that the former Foreign Secretary, now the Prime Minister, during his time in his previous office, was able to do that. And I'm quite sure that the Chancellor of the Exchequer is a widely travelled man. Well, I suppose that they, like I, will have seen and smelt and tasted the death that comes from poverty and starvation, and seen the misery of young girls having to walk miles every day to fetch foul water. And to now see the opportunities taken away from those young people around the world is, I believe, unforgivable. Yes, of course, we have run up a huge debt in the course of the COVID crisis. But put this in perspective, we are talking about a cut upon a cut. As my right honourable friend, the member for Sutton Coldfield, said in his opening remarks, this was designed to scale against a reduction in gross national income. And by reducing the figure from 0.7 to 0.5%, we are exacerbating that cut. And in so doing, we are hitting what used to be known as the bottom billion, the 1 billion people in this world who are living on less than $1 a day, the figure that the United Nations believes to be the sign of abject poverty. Mr. Deputy Speaker, I want our Prime Minister to be able to go to the G7 with his head held high. I extol the virtues of our contribution to COVAX. But this cut that's been put forward by the Treasury is unforgivable, and it must be reversed next year.
Liam Byrne.
Thank you very much, Mr. Deputy Speaker. I want to congratulate the Right Honourable Member for Sutton Coldfield, and I want to thank the House authorities and the Speaker for bringing this debate today. I've risen to speak today because at one and the same time, this decision seems to me a decision which dishonours our word, dismays our friend, and delights our enemies. There are just 3 points I want to make in this debate. The first is simple. This decision defaces and demeans the strategy that was set out in this House by the Prime Minister as long ago as 69 days, when he came to that dispatch box to present to the House the integrated review. This is what he said to the House, Mr. Deputy Speaker. He said that he was determined to build resilience at home and abroad and to tackle risk at source. We will be dynamic abroad, he said. 2021, he declared, will set the tone for the UK's international engagement abroad. Well, let's hope not, because on the eve of the G7, this Prime Minister is leading by retreating. The only dynamism he is showing is the speed with which he is breaking his promises to the world. Now, the Prime Minister, the former Prime Minister, the Right Honourable Lady for Maidenhead, didn't make many speeches about foreign policy, but there was a phrase that she used often which was good. It was the notion of the rules-based order. We should have a government that extols the benefits, the virtues of a rules-based order. But now we've got a Prime Minister who is ordering the breaking of the rules, not just with the nonsense around the international protocols in Northern Ireland, but now our international promises to the world community. One has to ask, why would anybody trust him? The truth is, the Prime Minister will soon discover that unless he is more hardline about keeping his promises, then our influence will diminish in the world. Once upon a time, we were known abroad that our word is our bond. That is not something to surrender lightly. Second, the Prime Minister now risks a serious imbalance in our foreign policy. In today's world, defence of the realm entails a mixture of deterrence and development. President Biden has a useful guide. You talk about values, he says. Show me your budget and I will tell you what your values are. Well, we now have a situation where defence spending is rising by £24 billion and development spending is falling by £4 billion. A £28 billion gap. I give way to the Honourable Member.
I thank the Honourable Member for giving way. Could he confirm, when he was Chief Secretary to the Treasury, did the UK ever meet its 0.7% target?
We were proud to set the ambition and we set a critical path to doing it because we knew precisely this point, that development and deterrence are two sides of the same coin. They are essential to the defence of the realm. Now, the Prime Minister, when he came to give the integrated review, liked to boast of the fact that we were about to send the Queen Elizabeth in this new carrier group on a worldwide tour. Well, I have to ask, how many of the 100 countries where we are cutting edge will that carrier group come in to port? Because I bet what we find is that everywhere it does, we will find that our projection of power is as of nothing compared to the power of a project to make poverty history. 2/3, Mr. Deputy Speaker, of the world's poorest live in fragile, conflicted and violent states around the world. It beggars belief that under these proposals, nations like Libya and Iraq will no longer receive bilateral aid. There should be a simple rule of policy, Mr. Deputy Speaker, that we will not drop aid in places where we drop bombs or where others drop bombs that they have bought from us. Investing in places where we can alleviate poverty is one of the biggest investments we can make in safeguarding our security for the years to come. The final point simply is this. The Chair of the Select Committee very helpfully set out the extraordinary range of cuts that are now being confronted. But as Chair of the Parliamentary Network on the IMF and the World Bank, I asked the IMF for an update this afternoon on the sheer scale of investment that is now needed to get the global community back on its feet. Low-income countries will now need £200 billion extra to step up their COVID response, followed by $250 billion extra in accelerated investment as we try and move from the pandemic to the agreements set out in the Paris Agreement. That we are now going to be...
Sorry, we have to leave it there. Terribly sorry.
Tougher to do that, and that
Karen Bradley.
Should be reversed.
Thank you very much, Mr Deputy Speaker, and can I refer to my entry in the Register of Members' Interests? Can I also congratulate my right honourable friend in securing this urgent debate? Mr Deputy Speaker, the United Kingdom is a nation of islands. Apart from one well-known land border, we're surrounded by sea. And if you're surrounded by sea, you have a choice. You can turn your back to the sea. You can look inwards. You can look only at the people that are within your own country, your own town, perhaps even your own village. I think it makes you smaller. I think it makes you poorer. Or you can turn round and you can face the sea. You can face the world. You can be part of a global nation. And I think that makes you wealthier. It makes you give you a better quality of life. And it makes us better as a country. Being an outward-looking global Britain means many things. It means taking our seat and playing a full role in global institutions. It means meeting our commitments on defence, which the government is very proud to have done. It means trading and promoting free and fair trade around the world. And it means doing our bit for the world's poorest. Now, there are 3 points I wish to make. The first is that I accept the pandemic is an exceptional time. In fact, there's nothing I like about this pandemic. I don't like how empty this house is. I don't like not seeing my loved ones. I don't like anything about it. And I accept that it is an exceptional time. But there are organisations that need certainty about the funding from the United Kingdom. And my right honourable friend from Maidenhead talked about the Global Fund for Ending Modern Slavery. I too have spoken to the Global Fund, who have seen an 80% cut in their spending. They will get by going to other countries. But if they don't know that the United Kingdom is going to meet our commitments, they will have to close programmes. And that will leave thousands and thousands of children at risk of exploitation. And that brings me to my second point about keeping our promises. I proudly stood on that manifesto that talked about proudly keeping to 0.7. There are some that think that this is some sort of ruse to introduce 0.5 by the back door. I really hope that isn't the case. Everything that the Minister said and that my right honourable friend the Prime Minister has said say that we will revert to 0.7 when the economic situation allows. Well, when is that going to be? When can we have that vote on this matter? When can we know that we will meet our commitments? Because the organisations and the programmes and the people that depend on that money need to know that it will be coming. And then my final point is about the world and how joined up it is. Now, if there's one thing the pandemic has shown us, is we can't isolate ourselves from what happens in the rest of the world. No matter how much we might want to turn our backs on the sea and look inwards, we can't. Variants that develop in far-flung parts of the world, or a virus, in fact, that developed in a far-flung part of the world, in a city that probably most people hadn't heard of 2 years ago, have meant that our way of life has changed fundamentally this year. We cannot isolate ourselves from the rest of the world, and we have to take an active role. And a small amount of money, relatively speaking today, helps to stop refugees being in boats on the Channel. It helps to stop victims of slavery producing the goods that we're buying in our supermarkets and retailers. And it means that girls will get that 12 years of education. So in this week, the week of the G7, this year, the year of COP26, this is the time for the United Kingdom to stand with our head held high, show that we meet our global commitments and lead the world.
Video link. Leila Moran.
Thank you. May I start by congratulating the member for Sutton Coldfield on securing this debate and on his speech. And I have to say, his recollection of starving children in Uganda actually brought a tear to my eye. And I was reminded of when I lived in Ethiopia in the late 1980s and the extreme poverty I saw. He's right, those memories never leave you. And it's those children that I met, many of them my own age, who are at the front of my mind now too. Now, in his remarks, the Minister drew moral equivalence between maintaining our promises to starving children and leaving future generations with extra debt. How shameful. There is no equivalence there, because one is a death sentence and the other is not. And especially when our young people, just like the rest of our country, overwhelmingly support 0.7% being spent on aid spending. To abandon those commitments comes at a real cost, and it's not just the humanitarian cost. And it is true that more lives will now be lost this year and the next and the year after that, until the day when the government finally decides to return to 0.7%. And that's notwithstanding the mess that has been caused by cutting off those funding streams as quickly as they've been cut. But there is also a cost to the UK's global reputation. How on earth are we to convince developing nations at COP26 to trust our leadership on the most pivotal climate change summit in a generation when in the same breath we have undermined our credibility with them? This is a government that says one thing and does another, that cannot be trusted, that behaves in a way so fundamentally un-British that it makes me feel ashamed. When the Prime Minister stands up at the G7 this weekend, what will our allies and friends think? The Prime Minister will encourage our allies to pledge more to fund girls' education, while he cuts spending by nearly £200 million. He'll offer a hand of friendship to Italy, Germany and France, while his Brexit negotiator continues to make incendiary comments about the Northern Ireland Protocol. And he will speak of the importance of promoting democracy around the world and adhering to the rule of law, when this government denies elected representatives the chance of any vote on aid spending, even when lawyers suggest we are breaking our own law. So if the Prime Minister wants to make a statement about his government's global ambitions, the single most meaningful and impactful thing he could do right now is to give us a vote on whether we should reverse these cuts. And if a vote is granted, then the Liberal Democrats, who introduced the legislation that enshrined 0.7% in law, will join others from all sides of this House and vote to keep our promises, to vote to hold on to our word. I said earlier that this government in its actions makes me ashamed, but by contrast, this debate and the clear will of colleagues from all sides of this House to do the right thing should make all Britons proud. And I look forward to continuing to work with them for as long as it takes until this government listens. Thank you.
Thank you. Sir Edward Lee. There have been some very moving speeches, and I could spend the time allotted to me repeating the humanitarian points, which, by the way, I believe in, that we do have a duty to the world's poorest. But my criticism of the government's actions is not so much based on that as whether this is the right way of proceeding if you are seriously concerned about running the public accounts in an efficient way. We'll leave it on one side, the fact there's a manifesto commitment, which is important. I accept that the situation has changed with the pandemic. Our economy has declined, and of course the government could have cut £2 billion from the overseas aid budget without any adverse criticism, because it was linked to 0.7%, and as our economy declined, we could have very easily cut the aid budget by £2 billion, no argument. But the government decided to cut it further. Now, I think what they should have done at that stage is to be completely honest with the House and the people and to say, if that is their view, that we don't actually believe this commitment to 0.7%. But no, they said we still believe in it. This cut is entirely temporary. But what does temporary mean? Is temporary 6 months, a year, 2 years? And it's worse than that, because the government is in a sense hoist by its own petard, because it said this is only temporary. So it has ordered the civil servants in the department to go on cutting all these programmes. And by the way, the one way you build in a lot of waste is if you cut too quickly. It's almost as wasteful as increasing spending too quickly. And I was often critical of the former Labour government when they were increasing spending too quickly. So a lot of waste has now been caused by these civil servants going around cutting all these budgets, and will leave, of course, aside the terrible humanitarian effects of all this, because that point has been made very effectively by my colleagues already. But if you accept the government's own logic, the same civil servants in 6 months' time or in a year's time are go on running around restoring all these programmes. And there will be a huge amount of waste, and incidentally, a lot of people would have died in the meantime. A lot of wells would have run dry. A lot of girls' education would have been ended. People will have died, and there will be a huge amount of waste. So let me offer this compromise to the government. Just be honest. Just be transparent. Just be open with Parliament. Accept parliamentary democracy. Set a date. If you want, it can be by the budget next year or sometime early next year, but set a date where the government will come honestly to Parliament with a policy. I'm prepared to be open-minded about this 0.7%. I'm prepared to accept that although it's a manifesto commitment, you know, there may be occasions where it might cause feast to famine to feast, but let the government make its argument honestly. After all, this is the law. We are supposed to spend 0.7% of our budget by law. If we no longer believe that, then we have to come to Parliament and repeal that act. Or we have to come to Parliament in the budget debate and present an alternative. I'm not even asking for the government to commit now in the budget next year to restoring 0.7%. I'm just asking the government, and I'm trying to reach out for the government, and this is a compromise, to announce very shortly, to end this debate now and forever, that there will be a transparent, open debate within the next 12 months so we can determine this issue forever. Put Parliament first.
Video link or audio link, Vrinder Sharma.
Thank you, Mr. Deputy Speaker, and I hope to be very brief. Looking around the world, as many right honourable friends have already raised, we see so many problems that need our help. It has been a courtesy to this House and to millions of people up and down the country who voted in 2019 for 0.7% that this government tried to cut that without any discussion or debate. I was heartened by the Prime Minister dispatching ventilators and oxygen converters to India, but the Nepal is still waiting. While India leads the world in vaccine research and production, Nepal has no facilities to produce vaccines. Millions of vulnerable people in Nepal need vaccines, especially second doses that are not coming. But we have 500 million doses for 70 million people. Mr. Deputy Speaker, I have visited amazing programs, met people whose lives were changed and saved by British aid. No one who has seen that would condone a cut. The cut is barbaric at this time. Mr. Deputy Speaker, when I meet people abroad and online now, I'm nothing but proud of our record as a donor to good works. But the work on gender equality, clean water and sanitation, 12 good years of education, ending human trafficking and modern slavery, tropical diseases, tuberculosis, and not let this government waste that work without a fight. We must end this debate and support 0.7 to come back as our commitment to the nation and to the world. Thank you.
Thank you very much. Sorry about those communications problems, but we got the vast majority of it, Mr. Sharma. Tobias Elwood.
Thank you very much, Mr. Deputy Speaker. Could I very much welcome this debate today and congratulate my right honourable friend. It will help widen our understanding of how British overseas aid commitments work, and also our soft power, which allows us to speak with such authority on the international stage, and indeed goes in part to justify our seat on the UN Security Council. But it also plays a pivotal role in supporting our economy and strengthening both our national and international security. And that's what I'd like to focus on today. But I will say, for too long, our aid programmes worked in isolation of wider government strategies, often without a British flag to even acknowledge its origins. We have come some way, but I'd be the first to say taxpayers' money must be wisely spent. As a former soldier, I was saddened and indeed horrified to see that the failure to utilise our aid programmes in both Afghanistan and Iraq. We won the war, but we lost the peace. Hard power and soft power are two sides of the same coin, and we're going to need a lot more of both over the next decade, something the G7 summit, no doubt, will attempt to address. Our world is on a worrying trajectory. Rising authoritarianism, growing extremism, and now new challenges of climate change and, of course, defeating a brutal pandemic that continues to damage economies and take lives. But the West has become risk-averse. An absence of leadership, of resolve to address these issues, with weakened international institutions no longer able to defend our rules-based order. This G7 summit offers an opportunity for Britain to step forward, as we've done in the past when other nations hesitate. But when we step back, we not only cause hardship, as we've heard today, we also leave a worrying vacuum that gets filled, either by extremists in such places as Yemen or Somalia, or more specifically by Russia and China, who pursue a very different bilateral relationship, most likely ensnaring yet more nations into economic programs they can ill afford. China has weaponized its soft power to extend its influence economically, militarily and technologically across Asia and now Africa. And nations are increasingly obliged to look west or east for assistance. We are progressively seeing our world splinter into two competing geopolitical spheres of influence. That is the face of the new Cold War which looms ahead, and this is not the time to reduce our soft power footprint. If this is all about the money, and we understand the huge bill that the Treasury faces, £400 billion, then why not learn about what we did after the war, ring-fence this debt, rather than using austerity measures to balance the books before the next general election? The last war debt we paid off actually was paid finally in Gordon Brown's era as Prime Minister. We should do this the same. Find that fiscal instrument that allows us to manage the books more sensibly here today. As our history shows, we are that Churchillian nation which steps forward when others hesitate. And I say this to the House from a security perspective. The next decade is going to get extremely bumpy indeed. Now, the US is once again keen to play its part on the global stage. In the spirit of global Britain, let's be that reliable ally. Let's stay firm and honour our manifesto commitment.
Video link. Chris Law.
Mr. Speaker, if there was ever a time for humanity to come together, it is now. Millions have lost their lives to COVID-19, and millions more will continue to suffer the effects of this global pandemic. So why is this government choosing to impose devastating cuts to worsen and prolong the suffering of the poorest and most vulnerable communities in the world? Surely, the way to honour those who have lost their lives and livelihoods to COVID is to ensure we build forward better across the world. This is the only and the right thing to do. The Prime Minister talks about global Britain, but this means nothing when this government is determined to scale back life-saving assistance to the most in need. He stated that a new Royal Yacht Britannia would be, and I quote, a clear and powerful symbol of our commitment to be an active player on the world stage. However, living up to international aid commitments is far more effective at this than a flag-waving, nostalgia-driven vanity project. If it is financially prudent to spend on a new national flagship and stockpile even more nuclear weapons, then there is simply no excuse not to reverse this devastating cut if we are to be an active player on the world stage at the G7 summit this week. Indeed, how can this government have any credibility whatsoever in calling for others at the G7 to commit to further spending to ensure global recovery when they, and they alone, are cutting back? The UN specifically urged governments to meet the 0.7% commitment and warned that 120 million people have been plunged back into extreme poverty, and the Sustainable Development Goals could be pushed back 10 years due to this pandemic. Yet despite all this, this government has done the exact opposite. Mr. Deputy Speaker, it does not need to be like this. Other G7 countries are increasing their aid, and we in the SNP have called for development spending to be ring-fenced at pre-COVID levels. The Scottish Government, like others in the international community, will add to vital aid contributions by increasing our International Development Fund by 50%. Mr. Deputy Speaker, the day Scotland becomes an independent player on the world stage cannot come quickly enough. Let's be clear, these cuts cost lives. Estimates suggest that 1 million excess child deaths could occur as a result. These could be any of our children. Are we to turn a blind eye because they're someone else's children? Aid to Yemen, the world's worst humanitarian disaster, has been cut by 60%. Aid to Africa, where 85% of the poorest billion people will live by 2045, will fall by more than 2/3. And in the middle of a pandemic, this government decided that funding that could have provided 10 million people with access to water and sanitation, the most basic defence against COVID, should be withdrawn. Finally, Mr. Speaker, no one has escaped this pandemic, but the poorest have been expected to pay the ultimate price. No one is pretending either that the challenging of recovery from COVID is easy, but as the rest of the world is stepping up, the UK should not be stepping away. Indeed, this isn't just about political debate or defeating the government, it is about saving lives. It is about those who rely on the international community to give them support, who have had their livelihoods destroyed, who will die in the hundreds of thousands, who have little or no voice. This government can choose to listen to this House and reverse these cuts, or it can abandon the world's poorest and become an ever smaller and insignificant Little Britain that we want no part of.
Marie Miller.
Thank you, Mr Deputy Speaker. And can I draw the House's attention to my entry on the Register of Members' Interests? Mr Deputy Speaker, we've heard some very powerful speeches today, and of course I pay enormous tribute to my right honourable friend, the member for Sutton Coldfield. I respect his impassioned arguments and long-standing commitment to international aid, but I have to respectfully offer an alternative view today. The UK's commitment to international development is globally recognised, and we're proud of our commitment to supporting developing nations. And we've heard that today, and it hasn't always been this overwhelming a debate in the past, from the many years I've been here. But we have to be honest, Mr Deputy Speaker, the unprecedented circumstances of the past 12 months have forced this government, as it would of any complexion, to take some very difficult decisions. Circumstances are exceptional. Exceptional because so much of our money, and I think probably a globally unprecedented package, was put together to shore up our health service and to shore up our businesses in the face of a global pandemic. So I think the government is right. Just give me a moment to make my argument. So the government is right not to put its head in the sand. It's not possible to continue with business as usual. These are not normal times. And I think we have a responsibility as a parliament to act, and to simply dismiss £4 billion worth of expenditure as a rounding error is something which I think is the first time I've heard in a debate such as this. I give way to my right honourable friend.
I'm very grateful indeed to her, and she and I obviously don't fully agree on this, but would you like to speculate on why Britain alone of the wealthy nations is cutting its aid when everyone else is either maintaining or increasing? Why is our economy so bad that we have to balance the books on the backs of the poorest people in the world, unlike all the other rich countries?
I think my right honourable friend is right, and I would speculate, although I would need to look at the figures in more detail, that perhaps our country has put more money into supporting our health service, more money into supporting jobs, and maybe we will be in a better position to resume our international aid spending when we come out of this pandemic on the other side. But he is right that we need to look at that in more detail. I think, Mr Deputy Speaker, we can't always forecast the future. And that's why the legislation has provisions in it to be able to make the sort of changes the government is proposing today. And I would say to my right honourable friend that he makes a very strong argument about the importance of international aid, and he knows I agree with him on that. I don't think he should be oversimplifying his argument, though, in the way that he started to in his opening statement today, because the actions that the government's taking is not simply red wall politics. The fiscal crisis the country faces is a result of the pandemic, and that speaks to every constituency throughout the country. Now, nobody would choose to be in the situation that we face today, but to paint this as the UK walking away from its global responsibilities, I think is wrong, and I think that sends very, very wrong message from this place to the rest of the world. We remain, as a matter of fact, if I cannot give way again, else I'll get into trouble with Mr Deputy Speaker, we remain one of the main funders of international aid around the globe, and we need to be proud of that. There's been much talk of reputation in this debate,
And I believe that reputation for fiscal competency is also a key part of our reputation around the world. And I believe if we are to remain one of the biggest contributors to international aid, we also need to retain our reputation for fiscal competency as well. Perhaps some of the fragility of the funding regimes that have been talked about today by a number of Right Honourable and Honourable members highlights the fragility of what is going on in the international aid sector and indicates the importance of increasing the numbers of countries who are investing to the level that we have consistently over a number of years, that more are doing that, but also that we are working together more so that there is not this fragility in times of crisis. Now, my right honourable friend, the member for Staffordshire Moorlands, is absolutely right. We cannot isolate ourselves, and the pandemic has demonstrated that amply. So I hope that my right honourable friend, the Minister, will be back here soon to confirm when the UK can return to its normal terms of business when it comes to international aid. I also hope that he can talk more, perhaps, or his colleagues can talk more about how the government is going to be doing more to fulfil its promises in its equality strategy, so well set out in 2018. But for now, because that will all give certainty for the future, but now I believe the approach that he's taking is prudent, not just for us, but for future generations as well.
Luke Coyle. Thank you, Mr Deputy Speaker, and I refer the House to my declaration of interest. The UK is at a crossroads. Our citizens and the international community wait to see which way this government will take. But it isn't that ministers can't pick a route, it's they've chosen, in the words of the brilliant speech by the Right Honourable Member for Southern Coalfield, they've chosen to go backwards. And I would add, Mr Deputy Speaker, they've too frequently, chosen to go backwards on their own word, because this government was elected with a manifesto commitment to retain aid spending. Ministers now seek to break that promise, despite their massive majority and despite the global pandemic. Just when we are needed more than ever, and when global Britain could mean something to the countries and people we are in a position to help, no other G7 country, as we've heard, is taking this approach. Germany and the US are increasing their help, and the outcome is also known. Ministers backtracking and breaking their promise will mean the avoidable loss of life, the preventable spread of disease, and even, in one case, the failure to provide clean water in a Yemeni refugee camp. It could mean more refugees trying to reach the UK. The broken promise also contradicts the great British tradition of not ignoring problems, not walking on by. We are the Good Samaritan. We pitch in, we help, and we do so because it is the right thing to do, but also not just through altruism. We do it because COVID has proved more than ever that no one is safe until everyone is safe. Our aid prevents other diseases like HIV spreading to our shores, can help prevent conflict involving UK armed forces, can help prevent the creation of refugees seeking further help from the UK, and can help facilitate trade benefiting British business. Ministers seem ready to stand by and abandon all that. Mr Deputy Speaker, global Britain means nothing to most people, but will mean even less without the agencies needed to deliver it. All those international aid organisations who currently have so little faith in ministers after the deceitful claim that they were consulted over the abolition of DFID, and now the devastating £4 billion cut in help they deliver on the front line. And we all recognise that COVID affects things, but the government needs to be more ambitious for our international reach and for our country. And let's compare how this country has recovered from previous crises. The post-war Labour government achieved house building on a scale never seen before, created a social security system our whole country has benefited from ever since, and delivered an NHS still proving its worth in the face of COVID today. A post-crisis Labour legacy the whole country remains proud of. By contrast, this government seems to seek no positive post-COVID legacy. Ministers are abandoning even their own manifesto promises to the British people despite that massive majority on aid, on cuts to the armed forces, on abandoning the pledge to overhaul social care, and even on free TV licences for some pensioners. It is a truly pathetic agenda. That said, Mr Deputy Speaker, I do respect the noble aims of the Right Honourable Member Sutton Coldfield and others on the government backbenches, including the former Prime Minister. I genuinely hope they're successful in overturning this government's betrayal of its own manifesto and its wider betrayal of the British people who voted for it.
Steve Bryan.
Mr Deputy Speaker, thank you very much. I've had hundreds of contacts from constituents concerned about the changes being made to our aid programme. Not all of them agree with me, many do, and my judgment is that the people I represent, like their MP, are really proud of the support that we give around the world. But we should be honest. Yesterday's amendment that led to today's debate was far from perfect. It wouldn't have restored all of the projects that we've heard about today. We are still spending £10 billion this year, as the Minister rightly said, and we have seen the biggest drop in economic output for 300 years. But in spite of all of that, so does this therefore matter? Does the 0.7 to 0.5% cut matter? Have we rather pompously overblown our world-leading reputation in this area? My answer to those two questions, Mr. Deputy Speaker, is yes, it does matter, and no, I don't think we have. I have held the International Health Brief at the Department of Health. I have attended G7 and G20 meetings, not at the level of my former neighbour, the former Prime Minister and the former Secretaries of State that we've heard from, but I have been in the room. And I hear the talk that it damages our reputation around the world, and maybe some think that's overblown, maybe some think that's part of our pompous overblowing of this issue, but it does matter. I have seen that in the room, and it does matter what the UK does, and countries do follow us, and we are in a position to ask them to do so because of our deeds. I've also seen much of the good work that we do. HIV is one of the many examples. And I know about, and I'm particularly worried about. It's why an open letter today from a wide group of organisations working in this field, plus Lord Fowler, who knows a thing or two, fears these reductions risk, the letter says, setting the stage for a resurgence of the AIDS pandemic. And it sits at such odds, Mr. Deputy Speaker, with the domestic progress that we've made in HIV and the HIV Commission that I was proud to be part of and the recommendations that made to ending new HIV transmissions by 2030. It's tragic, Mr. Speaker, what's going to happen around the world with the HIV reduction programmes. I'll give way.
Thank the honourable member for giving way. He's making an important point about HIV/AIDS. The fact that it has been cut by 80% because of this decision is kicking the can further down the road and making it a bigger problem in the future. This jeopardises everything that we have worked for. Does he agree with that?
Yes, and frankly, it doesn't really matter whether I do or not, but the organisations working in this field, dozens of them, have written an open letter in the Telegraph today setting out why and how this matters, and I'm really worried about it. Mr. Deputy Speaker, I think back to my early days in this House. One of the first things that I did in Winchester that I'm so proud to represent was held a session with the former Minister, Stephen O'Brien, who was a very good international development minister. Ask the Minister, it was called. It was in St Paul's Church in Winchester, and we had dozens of constituents who came to that meeting to listen to that manifesto commitment that we'd made in 2010 and the way that we were going to then legislate for this. So for me, you know, this is not just a manifesto commitment made then and made since and made in 2019. It's a personal commitment, and it's one that I want to stand by. You know, I know that to meet it, we have to make choices, but it was a choice to make the pledge in the first place, and it's a political choice to keep it or not now. Abandoning June the 21st, Mr. Deputy Speaker, as we may do next week, that's also a choice which will have a price tag attached to it. Maybe there's a correlation there. And finally, an example from my own Winchester constituency that really saddens me is actually rather personal given the global health budget that I used to hold. For many years, Hampshire Hospitals, which runs my local hospital and the University of Winchester, have obtained funding and used that to provide support for overseas projects such as stroke services in West Africa, paediatric maternity surgery and anaesthetic care in several East African countries. And that's been funded through something called the THET, the Tropical Health and Educational Trust, which receives money through something called the UK Partnerships for Health Systems. That's had its programme cut from 2020 through 2024 as a result of this reduction. So it's not just a one-year hit, Mr. Deputy Speaker, which some say, and they are devastated about the work they're not now going to be able to do. Let me just close by saying this. If anybody on that side of the House or any side of the House, friend or foe of mine, or any of my colleagues speaking against this today, think that we enjoy this and that we are somehow enjoying giving the government a hard time, we do not. You know, I'm here to say what I think, Mr. Deputy Speaker, on behalf of the people that I represent, and I think this is wrong. Even now, even at this late stage, let's not do this. As I always say to constituents who disagree with me on this subject, and there will be many, Charity does indeed begin at home. It just doesn't end there.
Catherine West.
Thank you very much, Mr Deputy Speaker, and it's a pleasure to hear so many members across the House joining together and looking at the progress that's been made on HIV/AIDS over the years and urging the government to change its mind on this funding question. I know my honourable friend, the member for Cardiff South and Penarth, who chairs the all-party group, which is cross-party, also has done an enormous amount of work on this. I want to talk today about the impact on British science, but before I do, I just wanted briefly to talk about many of the wonderful experiences that we've had as members, travelling, for example, as members in different parties, for example, to Kenya or to Nigeria, where so many children die from malaria. And we know that with the Commonwealth Heads of Government meeting this month, we are meant to be showing a very strong sense of leadership, and I feel this kind of decision does undermine that. I was very pleased to hear the member for Lee talking about the waste of the in-year cut. When you cut budgets in year, it's like you may as well not spend the money at all, you just throw it away. So some medication which has been provided through programs will actually be disposed of because of an in-year cut. It's a really bad way to manage programs. In terms of British science, I declare an interest because my other half is a scientist and is very involved in malaria research. And I understand that Dr. Gilbert, who of course in Oxford invented the vaccine, she invented it because she's got a background in trying to find a vaccine for malaria. It's a very different kind of parasite from coronavirus, which of course coronavirus is much simpler and therefore it's much easier to get a vaccine. But the reason that she's a vaccinologist and understands vaccines is because she worked in global health. And the UK is just known for its excellence in that area, and these ODA cuts will have a massive impact on our regional universities, which is of course what we're trying to address, the regional inequalities within the UK. And we know, for example, that, and the member for Winchester mentioned the trust in Hampshire, but also we know that there are 500 health facilities across Africa and Asia which work closely with the Liverpool School of Hygiene and Tropical Medicine, and they actually teach medical science and they teach medical research to Africans and in Asia as well, but particularly the concept is so good, and this is what was one of the very special things about many of the DFID programs, that it was a hand up, not a hand out. Everybody wants to see these programs where British scientists work closely with African scientists. They are equal scientists and they do work together and they collaborate. It's not just a handing out and a kind of philanthropic to make us feel good. It is working on the global problems which affect each and every one of us. And we are so far ahead in our vaccine project because of that background in global health. This debate is taking part in the context of the Times Rich List, where there are 23 more billionaires this year than before. Our economy has the potential, but we have to make our economy work harder so that we can afford this, because it's the inequality which is going to bring down our society, which is going to cause even more problems, and we must tackle that difficult problem. Christine Lagarde has been saying it for years, the IMF is saying it. Tackle inequality and the rest will look after itself. The 23 billionaires, we have to find a way of them helping to pay for the 4 billion that we need to maintain this UK excellence across the world. Thank you.
Steve Dubbin.
Thank you very much, Mr Deputy Speaker. This is a very difficult debate for me. It's very difficult because I can genuinely see both sides of this debate. It's difficult because I find myself with a different view to many colleagues on these benches who I respect very highly. And it's difficult because I, in my 6 years of this place, have possibly been one of the most enthusiastic supporters of our overseas aid budget. But we have got to make some tough choices at this time, and I'm sure that this is going to be the first of many tough choices that this House and this government is going to have to make in the months and years ahead. This pandemic started as a health crisis, but the longer-term impact will be an economic and a fiscal challenge. And I say that representing one of the most disadvantaged parts of the UK, and one where it is forecast that the economic impact will be felt deepest and the longest. The money to continue our level of aid spending has to be found from somewhere. And I'm concerned that one of the effects of the last year is that we do seem to have lost a sense of proportion of financial discipline. Colleagues have spoken of £4 billion as a rounding error. I can remember when hundreds of millions of pounds was talked of as a big government spending item, and now we talk of £4 billion as a rounding error. What has happened? A lot have said about us breaking a manifesto promise. I would remind colleagues that our manifesto also promised that we would reduce the debt over this Parliament, and the debt at the end of this Parliament would be smaller than at the beginning. Now, we are having to break that promise. We all understand why. But let's not pretend that cutting our aid budget at this time is the only promise we're going to have to break in our manifesto because of the very difficult situation we find ourselves in. I find it very uncomfortable that we are having to make this cut in our aid spending. But I also feel very uncomfortable adding to the debt that my grandchildren will probably have to pay back for this country. And that is a tough choice we have to make. We will remain one of the largest contributors in the world. The way some are talking here today is though we're completely cutting our aid budget and never going to spend another pound. We are still contributing £10 billion, the third highest in the G7. And several have made the comment about us sort of providing leadership and losing our influence. Well, I have to say, for all the years we stuck to our 0.7% aid target, how many followed us? Not very many, I have to say. So let's not overplay our global influence in this regard. And what I'd say, Mr. Deputy Speaker, is it's been common this week to trail through tweets. And I have been quite surprised that some people on these benches who have been the most enthusiastic today talking in favour of 0.7, just a short while ago were putting out tweets saying it was the wrong decision for the government to make. So I do think we need to take a look at the wider picture. I would simply say to the government two things. I do not find this easy, but I do understand in the current context why this decision has to be made, to start to make those tough decisions to restore financial discipline. And that is something that we, on these benches in this party, should stand for. I would just ask the Minister two things in winding up. Can we please make sure that in applying this cut to overseas aid, we make sure it is done in a way that minimises the impact on the world's poorest and most vulnerable? I think there are savings that could be made, but let's make sure they're made in the right way. And lastly, with a heavy heart, I support this, but can we please make sure we return our international aid budget to 0.7 as soon as we possibly can?
Video link. Claire Hanna.
Thank you very much, Mr. Speaker, and thank you for allowing this emergency debate today. The decision to abandon the government's own manifesto commitment wasn't just morally regrettable, but like a disturbing number of actions by this government in this term, it has been unlawful too, and the government has again bypassed Parliament and demonstrated contempt that it has taken until today and an emergency debate to address this matter. And I commend those Conservative members who have achieved this debate and for their articulation of our shared norms of global interdependence and democratic norms as well. And while I appreciate that nobody who has spoken today is relishing this change, we have heard from cheerleaders of this policy that we need to help our own instead. And that false binary might just ring true if those same voices weren't those who are actively advocating against meaningful pay for healthcare workers, against funding catch-up education, and if they weren't actively misrepresenting with tabloid myths that insult the intelligence of the public, as well as the real achievements the UK has made through aid. And nobody credible is denying the very serious economic contraction and situation that we are in. But what we are advocating is a principled choice being made, and this government, and I think nearly all members of the House, keeping a promise they made. Last November, speaking about the Security and Defence Review, the Prime Minister said that Britain must stand alongside our allies sharing the burden. But this retreat does the opposite. For the first time in many years, development progress around the world is going backwards, and reports estimate that 200 million people will be pushed back into extreme poverty because of the pandemic. Decades of practice and evidence underscores the truth that long-term development investment, the likes of which UK aid successfully supports, creates resilience that helps the poorest and the most vulnerable to withstand the economic and environmental shocks which are becoming more frequent in very large part due to our actions and our consumption. So this cut is at very best penny wise and pound foolish, because economic investment in aid is far-sighted. Well-nourished children will learn well in school. Empowered and informed women will see their children survive and thrive. And innovative, invested farmers will be able to feed their families and have more for market. And we know that aid as well creates a more secure world, draining the reservoirs of poverty, guards against extremism taking hold, which creates a safer future for all of us. The UK's development record in being a generous aid supporter has been something to be really proud of. And as many other members have spoken about, I've seen that money in practice many times, working for over a decade in the aid sector. And being an Irish MP in the UK Parliament, it's fair to say that some of the rhetoric and the symbolism that I hear around sovereignty and militarism and flags doesn't move me politically, but I, like many others, have been deeply proud of the UK's record on spending and effectiveness in aid. It is the mark of a serious global actor and an inclusive, modern, progressive union of people. And I say that whoever policy decisions like this are designed to appeal to, please do not forget that there is a mainstream of public opinion there who believe in multilateralism and generosity, and that we exist as well. The UK's aid spend saves lives around the world, but it enriches all of our lives here as well, and it should be protected.
Thank you. Harriet Baldwin.
Thank you, Mr. Deputy Speaker. Can I start by thanking you and Mr. Speaker for allowing today's emergency debate, and congratulate my right honourable friend, the member for Sutton Coldfield, on securing it. I've had the privilege of representing the UK as a minister in the Foreign Office and the Department for International Development, and I've had the privilege of seeing around the world the good that our aid budget does. Whether it was in the midst of the Ebola outbreak in the eastern part of the Democratic Republic of Congo, where the fact that the UK had invested in vaccines and cold chain deployment of those vaccines meant that we were able to contain that deadly disease, whether it was the work that we put into neglected tropical diseases, which means that we have been able to contain and control other diseases from reaching the UK. Surely we should have learned from all of that how important it is for the UK for us to be working on these types of shared global challenges for humanity. And I have had the privilege of going to Goma, near where the volcano is erupting, and seeing how we had brought fresh water to Goma, where it had been UK expertise and UK firms that had won the contract to do that. It is something that benefits our economy here as well, benefits those exporters. It is a win-win for the UK public and for the world. And I do feel very strongly that it was a great privilege to be able to say that we're the only G20 country, or we used to be, that meets its NATO 2% target and the 0.7% UN target in terms of aid. And surely global Britain, if it means anything, it means that. And being able to say that so proudly. And so I was particularly proud to stand on a manifesto that again committed to those metrics in terms of our position in the world. And I think that in terms of manifesto pledges, politicians hesitate to break them because they know that the electorate will punish them at the next election if they do. Whether it's George H.W. Bush and, read my lips, no new taxes, or whether it's Nick Clegg and his tuition fees, people realise that they don't break manifesto pledges because the electorate dislikes it. But I feel in this case, Mr Deputy Speaker, that the people who benefit from our aid budget the most are the ones who have no voice in this place. And I have met with them, and I need to articulate on their behalf how important this spending is. Then there's another reason, Mr Deputy Speaker, why I feel particularly passionate on this subject, and that is the fact that we have enshrined the 0.7% into law. Now, I know that there is a get out under 2.C or something, that if you inadvertently don't meet 0.7, then you can come to Parliament, explain why and how you're going to get back to it. But it's an absolutely contentious legal issue to actually target 0.5. And I think that's something that may well be challenged in the courts. And I think the simplest thing to do would be to come to Parliament for that consent, if it's such a good idea. The government has a large majority. The power that the executive has is derived through us in Parliament. And therefore, it needs to show the respect to Parliament by coming and asking us and giving us a vote, as the Honourable Member for Gainsborough put so powerfully. And so, Mr Deputy Speaker, I could expatiate for a length of time about how passionately I feel that we're making the wrong decision. But in this week, when we're hosting the G7, when we need to vaccinate the world, where cases now are beginning to really grow exponentially across many African and Asian countries, when the IPU 142 Assembly last week, we heard from every country they need the vaccines. Let's get out of this hole by giving our vaccines to the world.
Thank you, Mr Deputy Speaker. And I want to congratulate the former Minister on that speech just now. And she speaks very powerfully from her own experience of visiting projects. And I think when I was first elected back in 2005, the first overseas visit I was invited to go on was Oxfam taking me to the camps for internally displaced people in the north of Uganda. And I obviously never seen poverty on that scale. It very much was like the sort of images that you would have seen during Live Aid broadcasts, and that made a huge impact on me. And other overseas trips, like, for example, looking at a disaster release effort after the earthquake in Kashmir. And again, just seeing on the ground how much good that we can do with often very small amounts of money, but much needed money. And I think many of us, we sometimes get criticism for travelling abroad as MPs, but I think it really does bring home to us the importance of pledges like this. And it is frankly shameful that during a global pandemic, when the need for international leadership and for that support for poorer countries is greater than ever, the government would renege on its commitment to support the poorest people of the world and would do so without bringing it to this House for a vote. The pandemic has fuelled an increase in gender-based violence, it's disrupted children's education, it's increased food insecurity and threatens access to crucial healthcare. And yet, as we've heard, the UK aid budget for education has been slashed by 40%, UNICEF has lost 60% of its core funding, and UNFPA has lost 85%, which they say could mean 250,000, that's 250,000 more mother and baby deaths. In Yemen, home to the world's worst humanitarian crisis, we are cutting funding by nearly 60% while refusing to suspend arms sales. And the Trade Secretary, in response to letters that I've written to her, says that current arms exports are legal and match the consolidated criteria. But we cannot simultaneously be peacemaker and arms dealer. I want to make a special plea today, though, for the government to recognise, ahead of COP26, our obligations towards climate-vulnerable countries. These countries bear very little responsibility for our changing climate, yet are most affected by its consequences, be that rising sea levels, changing temperatures, droughts, declining crop yields, or extreme weather events, which are becoming ever more frequent and more severe. There is an urgent need for more funding for climate adaptation, as well as aid to help address the deepening inequalities linked to climate change. And as we play host at the G7, we should be leading on debt relief for the poorest countries too. We can't carry on giving with one hand and giving less with one hand and taking away with the other. I also want to particularly flag up the plight of the small island developing states as chair of the new all-party group. Although the UN has recognised SIDS as having particular social, economic and environmental vulnerabilities, the common metrics used to determine vulnerability and need when it comes to ODA do not take this into account, and as a result, many SIDS do not qualify for aid. Yet work by the UNDP on a multi-dimensional vulnerability index shows that the majority of SIDS are far more economically vulnerable than their income level would suggest. SIDS are not only facing some of the very worst consequences of climate change, but have also been devastated financially by the pandemic because of the collapse in tourism and are particularly prone to extreme weather events and other natural disasters. The recent volcanic eruption could cost St Vincent and the Grenadines up to 50% of GDP. Other SIDS are trapped in a vicious cycle of debt, such as Belize, which has defaulted or restructured its debt 5 times in the last 14 years. To conclude, Mr Deputy Speaker, we are facing the biggest global challenges in our history, with a pandemic that has devastated the global economy and a rapidly changing climate. We know some nations are more prepared for these challenges than others, and we cannot turn our backs on the vulnerable now.
Video link. Neil O'Brien.
Thank you, Mr Deputy Speaker. The last year has had unprecedented effects on our economy and our public services and on the world. And it left us facing this autumn some very profound choices. For all the reasons that numerous honourable members have mentioned during this debate, none of us wanted to have to make the changes to international aid spending that we are looking at having to make. But if we look ahead to the promises that we've kept and the choices that we're facing this autumn, there are some very difficult choices. We have promises to help children catch up on their education, and tomorrow we'll be having a debate in which numerous members will say that they want to spend more on that. We have promises to catch up the NHS backlog, which of course is inevitably built up during a year in which nurses and doctors and everyone working in the NHS have worked overtime, worked their socks off, but nonetheless have been under an unprecedented level of strain, which has caused a large backlog in terms of NHS demand. We also face long-standing questions, the question of social care, the crisis in social care in local government, where again and again in my surgeries, I have people coming to me to complain about squalid conditions, difficulty of accessing care, impossible burdens of paying for care. And last, of course, but not least, I should declare an interest here, we have the whole question of levelling up and the many things we promised to do to change the grotesque inequalities in life expectancy in this country, the grotesque differences in income levels and opportunity around this country. So we have many, many promises to keep. And of course, because over the last year, we've done unprecedented things to save jobs, to help save livelihoods, we have spent like never before. After that, of course, we now face some very, very difficult choices. So I'm not somebody who decries the value of aid. I can see that it does much good around the world, and we will continue to be one of the world's biggest spenders. But nonetheless, I do think that to be in government is to make choices, and we face difficult choices. We have many, many promises to keep on lots of different fronts. And ultimately, all of us are elected to serve the people. To be servants of the people. And it's very clear to me that if you look at every poll and every conversation you have, the public know that you have to make choices. They know you have to prioritize. And ultimately, the things that they say that to me they want to prioritize the most are our health services and giving opportunities and jobs to places that need them. So these are horrible choices to have to make. I salute all the colleagues on the other side of this argument who've come to a different view to me. But nonetheless, with a heavy heart, I do think that this is the right thing to do because of the difficult choices that we're facing. Thank you, Mr. Deputy Speaker.
Video link. Afzal Khan.
Thank you, Mr. Deputy Speaker. We have a moral duty and currently a legal obligation to help those in need, whether it is securing girls' education or responding to humanitarian crisis in conflict zone. Aid can be the first and last hope of improving lives. Britain is the only G7 nation to cut aid during this global crisis, and now its allies are taking note. With the G7 summit set to begin later this week, the stubborn refusal by the government to reverse its decision will weaken the country's position considerably. The US Congress has already written a letter urging the UK to reconsider its position. For aid to be truly effective, the recipient must have consistency and reliability, and this is currently at risk under this government. My constituent, Nicola Sansom is the CEO and co-founder of Salva International, a small UK international development charity that has been supporting street-connected children in Uganda since 2008 to have a brighter future through education and family reunification. She had been awarded the Small Charity Challenge Fund worth £50,000 and received the devastating news that it had suddenly been cut. Nicola's case is just one of many. Given the last-minute decision to cut funding for Salva, can the funding be reinstated so that the hard work done by the organization does not go to waste and can make a genuine difference to girls' education in Uganda? Can the minister also reconfirm his commitment to get 40 million girls into school by 2025 in light of an estimated 25% cut to girls' education funding? And how does he expect to fulfill this commitment without adequate funding to ensure girls aren't subjected to violence, abuse, and harassment? In light of the recent events in Palestine, we saw complete disregard for international law by Israeli forces. UNRWA funding provides much needed aid, vital health and educational programming, and helps strengthening cooperation between Israelis and the Palestinians. Given the ongoing blockade of Gaza and the devastating human rights violations, can the minister guarantee the UK's funding commitment to UNRWA work will not be included in this government's indiscriminatory cut to the UK's aid budget? So in conclusion, Deputy Speaker, there is an undeniable case that the UK aid helps the world's poorest and most vulnerable. During these difficult times, it is even more important that we continue to empower the powerless. Thank you.
Mr. Deputy Speaker, and can I start by congratulating the member for Sutton Coldfield for everything that he has done to get this debate, and indeed the team behind him who have done an extraordinary job in helping run this campaign. It is, of course, no easy thing to go against the grain of your party, although given the amount of times I've rebelled, I'm not sure the whips are going to believe that in me. But I don't do it lightly. I do it with the consideration of why I was sent here, what I believe in, and what are the views that the people who support this party would expect us to do. Over the course of my time in Parliament, we have had numerous debates about global Britain. And for me, it's quite simple. The definition of global Britain, what it embodies, is defence, diplomacy, trade, and of course, development. Each one of those pillars relies heavily upon the other. Our trade ambitions, our defence operations, our diplomatic networks, and our development programmes all peak and trough depending on one another's successes. Whatever the variation, that quartet of sectors helps to promote Britain on the world stage. They represent a Britain that does not step back, but steps forward, as was pointed out by the Right Honourable Member for Howden, I beg your pardon. In trade, we are striking many new positive free trade agreements. We are being ambitious and global and outward-looking. In defence, we are sending our aircraft carriers around the world. Our diplomatic network is still viewed as one of the finest networks in the world. And up until last year, Mr. Deputy Speaker, I would have maintained that our commitment to 0.7% was not just the correct thing to do, but an act of global leadership that benefits our trade, defence and diplomatic missions, all of which is truly reflective of global Britain. In committing to the 0.7% target, we offered not just warm words, but firm action for those most in need. Now, I have listened carefully to the words of colleagues during this debate and over the course of the last year. I have heard all too often that we simply can't afford to pay the 0.7 development budget given the pandemic and the economic climate. Now, leaving aside the fact that the 0.7% target fluctuates depending on the strength of our economy, ensuring that in good times there is more money and that in bad times there is less, I humbly remind everyone in this House that we brought it in the wake of the financial crisis, wherein our economic growth was possibly at its lowest, with no forecast to bolster it, no forecast to boost it. I will.
I'm most grateful to my honourable friend for giving way. He's making an extremely good and sensible speech. But can I also thank him for the immense amount of hard work and leadership he has taken in advancing this argument and getting it to this point today.
Incredibly generous of the right honourable member, and I appreciate it. But we stood up in the early, just post the 2010 election, because it was the right thing to do, and because it demonstrated our global leadership, and it encouraged others to follow suit. And it is simply not the case to say that other countries haven't followed suit. With France and Germany now hitting the 0.7% target, with America and Canada doing so also. It is a reflection that our leadership has led and encouraged them to do so. And with a new President of the United States who is reaffirming the rules-based order, we can truly say that we have a global group that will support 0.7%, but not if we do not stick to our guns on this. We have been able to assist in humanitarian crises and conflict zones around the world. We have been able to address the health issues, sanitation issues, education issues, but all of that is put into jeopardy. As has already been mentioned, what we are doing in this cut from 0.7% to 0.5% is cutting global health budgets down by 14%, girls' education down by 25%, clean water down by 80%, the UN and HIV AIDS programme down by 80%. All of these cut during a pandemic where the problems are exacerbated as opposed to diminished. No impact assessment has been undertaken, no review of what these cuts would mean to the different organisations. A simple strike of the pen, no vote in Parliament, and absolutely no consideration for the consequences. It is a staggering miscalculation to ignore our international obligations and moral duties, because we cannot protect ourselves at home if we do so. Many have argued that that money should be spent abroad. But if we wish to tackle terrorism, asylum and climate change, then we have to be out there. We have to be cooperating on an international scale to ensure that each of these points are addressed and that we live in a truly globalised world. Mr. Deputy Speaker, we have been told that tough fiscal decisions will have to be made, and I accept that, and I recognise the extensive cost of the government's very generous support packages. But as of today, the only area in which the government has cut funding has been the 0.7%, minus, of course, the public sector pay freeze. Perhaps the Minister, when he returns, might answer why that is. In a party that has committed 0.7% in 2019, 2017, 2015, 2010, we all won those elections on the basis of promising it to our electorate. It would be a shame if we could not stand up for the promise to the world's poorest people, to our electorate, and to deliver on all the programmes who are depending on UK funding.
Video link. Florence Shalami.
Thank you, Mr. Deputy Speaker. And I'd like to thank the Honourable Member for Sutton Coldfield for his persistence in bringing this issue to the House today. I'm deeply concerned about the UK stepping back from its global responsibilities to the world by the world's poorest and abandoning its commitment by cutting aid. And so are many of my Vauxhall constituents who have contacted me. 6 years ago, in 2015, we were the first G7 nation to enshrine in law our commitment to the UN's target of 0.0% of our gross national income in overseas aid. But as we prepare to host the G7 summit at the end of this week, the UK is breaking its promise, while other G7 countries like France and the USA are maintaining or increasing their aid commitments. This isn't the global Britain we want the world to see. The aid budget should be used to tackle the global challenges facing us all: the pandemic, the climate crisis, and rising poverty and inequality. A few months ago, on the 8th of March, we celebrated International Women's Day, and men and women from across the UK spoke out against the violence against women and girls. We can choose to challenge and call out the inequality we know that so many women continue to face. Mr. Deputy Speaker, I'm sure that members across the House will agree that one of the best ways to help address this inequality is to ensure that women and girls have access to vital education, not only at home here in the UK, but right across the world. The UK's ambitious target of getting 40 million more girls into school and 20 million girls reading by the age of 10 by 2026 have been adopted by the G7. Indeed, the Prime Minister said a few weeks ago on the 12th of May, supporting girls to get 12 years of quality education is one of the smartest investments we can make as the world recovers from COVID-19. Otherwise, we risk creating a lost pandemic generation. I'm going to be working throughout the UK's G7 presidency to ensure leaders invest in those girls and boost children's life chances across the world. Reducing the age budget is a direct contradiction between the rhetoric from the Prime Minister a few weeks ago and the reality faced by millions of people working across the world to support women and girls and many others across the aid sector. These cuts will have far-reaching consequences for some of the world's most marginalised and vulnerable people. Projects like the International Rescue Committee's Girls' Education Challenge, the UK's key programme for supporting girls' education in Africa and Asia, could now be at risk because of this cut. And I'm concerned by the UK's sudden rollback
I think we've just lost Florence. I'm terribly sorry.
on this international have come together.
Sorry, carry on, Florence. I think we'll have to leave it there. Pauline Latham.
Speaker, a little earlier than I anticipated. Could I congratulate my right honourable friend, the member for Sutton Coldfield, for securing this debate, sad though it is that we have to have it, and also the Speaker and Deputy Speakers for allowing us to go ahead. And the saddest part is that we're not going to be allowed a vote on this issue. We are not going to be able to decide democratically what this House wants to do. It's been decided for us. And I'm very disappointed that the Minister isn't in his place at the moment, because I wanted to paint a picture of things that I've seen when I've been travelling with the International Development Committee. And I want everyone in the chamber to imagine that their daughter has got married young, too young, and that there's now no contraception for that daughter. So she has a child early. But we're not managing to help that mother, future mother, with nutrition. So when she has her baby, if she survives it, she will have a child who is stunted. And that child, and it could be any country that we help, because these are the poorest people in the world, this child will never get the brain power that it deserves because it's been starved during the gestation period. But we're cutting the amount of money for nutrition. So she or he will never catch up, can never catch up, because once your brain is stunted, you can never do that. Now, none of us in this chamber want to see that to happen, but that is the reality of it. The mother could die because there's no contraception. The child will not reach its potential because it is stunted. The child will not maybe be able to afford it or have a job that they can then afford to send their children to school. And the cycle goes on and on. And the problem with that is we are going to be partly responsible for that because we are cutting our aid budget so much. And it seems to me, having seen some of the figures, and I have to say that my honourable friend for Rotherham listed out quite a lot of the cuts that seem totally random. They do not seem as if they have been thought through. Oh, we'll just cut that. Oh, yes, we'll do that. And I think there's a problem with some of the ministers who have made these decisions, that they haven't been and seen for themselves the devastation that it will impact on those poor people, the poorest people in the world, that I believe we, as a very rich nation in comparison, should be helping. And I've spent 11 years in this place, sitting on the International Development Committee, so I've seen the good that it's done. It's not perfect. We don't always get everything right, but we get a hell of a lot that's right, that helps those poorest people. We save lives. We're going to lose lives. And I think the Minister is not a callous man. The Minister is not a cold man. And I'm sure that when he made his speech, it wasn't one that he wanted to give. And I'm sure he will do what he's told and give the speech he's been given at the end of this meeting. But I'm disappointed, and I hope that now he's returned to the chamber, he will read what I've said about what we are doing to these poorest people in the world. And I believe that what he should do is go back to the Treasury, go back to the Prime Minister and say, we're wrong. And it's as simple as that. Let's change our policy and go back to 0.7%.
I'd just like to say we are trying to get Florence Ishalami back on, so just give her the last minute and we'll see how that goes. Howell Williams.
Thank you, Mr Deputy Speaker, and I am grateful to the Right Honourable Member for Sutton Coldfield for securing this debate and say that I admire the authentic passion that he brings to this subject. Mr Speaker, I oppose this unjustified and unwise cut to aid. The government is said to be motivated by a wish to balance the books, to manage public spending, but also it's said to be motivated by a wish to court popularity in the Red Wall seats. Well, I can tell the Minister that opinion in Wales is very much against them on this. It will do them no good. And when we get that long overdue by-election in the north-east of Wales, they will see for themselves. From a Welsh perspective, I note that smaller European countries have met their 0.7 GDP targets: Denmark, Sweden, Luxembourg, Norway. Indeed, Sweden has provided aid not to 0.7%, but to 1.14% of their GDP. Deputy Speaker, Sweden and the others can do this, and they achieve the 7.7% and more. Unfortunately, the UK can, but chooses not to. Now, leading figures in Welsh public life and local constituents alike have expressed their dismay, describing this cut as a double blow to the world's poorest communities at a time of the pandemic. And the Welsh Government themselves say in their policy documents on international matters on their agenda, they say, we are committed to promoting social justice, fairness and equality. Well, what value have these fair words from the Welsh Labour Government when we are tied to and overruled by this mean-spirited, short-sighted policy from the Westminster Government? The UN Population Fund is to be cut by 85%, UNICEF's core funding to support children cut by 60%, the total funding to be cut by 4.5 billion. Those figures would be a disgrace to any country. But given this government's pretensions to be a leading global power and an example to others, they are not only a disgrace, but also a major self-inflicted blow to the UK's international standing. I referred a moment ago to the United Nations Population Fund. Now, what does that cut mean in real terms? Funding is to go down from £154 million to £23 million, in turn leading, they say, to up to 7 million unintended pregnancies, 2 million unsafe abortions, 23,000 maternal deaths. UNICEF says that it is too soon to judge the effects, but they say children in some of the world's worst cities and conflicts will suffer as a consequence, as a deliberate effect of unfortunately, of this policy. And lastly, Mr Deputy Speaker, Save the Children say these cuts will trim the UK's borrowing by a fraction, but devastate the lives across many of the world's poorest countries. Because of all of this, I join others in appealing to the Minister and to the Government to withdraw this cut. Thank you.
Link. Margaret Greenwood.
Thank you, Mr Deputy Speaker. As hosts of this year's G7 summit, which takes place later this week, the government should be leading by example. Instead, it's abandoning its responsibilities to the world's poorest and most vulnerable people. The government's plan to cut UK aid to developing countries will have devastating consequences. The government's decisions will mean a cut of nearly 60% in humanitarian funding to Yemen in the face of what is considered the world's worst humanitarian crisis. A cut of 40% in aid going to education, resulting in 700,000 fewer girls receiving an education, and a cut of more than 80% of aid for water, sanitation and hygiene projects in developing nations. The government should be ashamed. Save the Children has highlighted that areas critical for children like basic nutrition, family planning and reproductive health are all set to see substantial cuts. Several constituents have emailed me in recent days to echo this. They have raised concern that the cuts will have far-reaching consequences for the world's most marginalised children, especially girls, at a time when they most need our support. In their view and mine, ministers have turned their backs on the world's most vulnerable children. How can the government claim that the UK remains a world leader in international developments? In cutting aid from 0.7% to 0.5% of gross national income, the UK will drop from being the third largest donor in the G7 to being ranked third from last, damaging our reputation and credibility on the world stage. The Conservatives' 2019 manifesto said, "We will proudly maintain our commitment to spend 0.7% of GNI on development and do more to help countries receiving aid to become self-sufficient." So much for election promises. Overseas aid of 0.7% is a figure enshrined in law. Lord MacDonald of River Glaven, a former Director of Public Prosecutions, has made it clear the government's decision to cut foreign aid without passing new legislation is unlawful. The government has said, "We will return to our commitment to spend 0.7% of gross national income on development when the fiscal situation allows." That is to ignore the immense suffering this cut will make right now. One Wirral West resident who wrote to me with her concerns said, "There is a danger that once reduced, it will not return to 0.7%. Other excuses will be found." Numerous charities working in the area of climate and international development, including Greenpeace, Christian Aid and WaterAid, have said that the cuts will make it harder for countries to respond to climate change and that they will inevitably harm the most vulnerable in society, pushing huge numbers back into poverty. Ministers should consider the long-lasting damage that their callous, short-sighted and counterproductive cuts to the aid budget will do to the UK's reputation globally. There is significant opposition in this House and right across the country to the government's decision to cut overseas aid. The government must think again and it must maintain the commitment to 0.7% for international development. Thank you.
Lawrence Robertson.
Madam Deputy Speaker, I also oppose the cut from 0.7 to 0.5%. As we've heard, the fact that it is a percentage based on the size of the economy means we have a reduction anyway, and this can only be described as what used to be known as a double whammy, a hit on some very, very poor people in the world. Just in preparation for this debate, I asked the Ethiopian Embassy to give me some thoughts on what it means to them. They are the second largest beneficiary of UK aid, and as the chairman of the all-party parliamentary group on Ethiopia, I'm very proud of that and what we've achieved in that country. And he said we've improved access to education, improved access to primary health care, improved access to clean water, and improved resilience to crises such as famine. So there we have it, education, health, clean water and food. Things which we in this country take for granted. Now I'm from, as many people are, from a very ordinary working class background, but I never had any problems with food or water or education or healthcare. I was very lucky. We all were very lucky to be born in this country. We did nothing to deserve to be born in this country where we have all those privileges. We were extremely lucky. There are many people in the world, millions of people in the world, who do not have that good fortune. Now, what I want to see is our continuing to provide these benefits to countries such as Ethiopia and very many other countries. And I think it's very important that we do retain the 0.7% because it isn't just about cash, it isn't just about money. It's a totemic policy. It's a policy that was put in place as a guide, as an encouragement to countries across the world so that they also may meet that target. Because we can't do it all on our own, we do need other countries to help. We can't tackle climate change all on our own. We do need other countries to help. And I would also point out, and I'm of course very, very proud of this country, very, very proud to be British, but we have to recognise, of course, that over the last 200 or 300 years, we've enjoyed the fruits of the Industrial Revolution, which was started where I come from, in the northwest of England. That's where it all started. And we've enjoyed the prosperity which came from that. Other countries have not enjoyed that prosperity. And as we tackle climate change, as we say to those countries, you can't do the same as we did, understandably, because we have a world crisis in terms of climate change, but if we're saying that, we have to help them get over it. And that is another reason why we should continue at the 0.7%. Now, I supported the coalition government in its attempts to reduce the massive deficit which we had between 2010 and 2015. I supported that. But what I would say is cutting this £4.5 billion, nobody in this country will benefit from that. We spent upwards of 300 billion on rescuing the economy because of the COVID pandemic. That's nobody's fault. We had to do it. But nobody in this country will benefit from our saving £4.5 billion. But there are many, many people across the world who will suffer if we save that £4.5 billion. And I cannot support that policy. Supporting absolutely correctly targeted and transparent international development aid was one of the reasons I wanted to come to this place, to support that policy. And it would be no shame for the government now to turn round and accept that they've got it wrong and they're reversing that policy. And I ask them to do that.
We now go to Ian Paisley.
Thank you, Madam Deputy Speaker. It's a pleasure to speak in this debate and to follow my colleague. The overseas aid budget is a very, very important issue, and therefore this debate is incredibly welcome to let Parliament have its say, not government, but to let this House have its say about the importance of this issue. Unfortunately, the government's stance has managed, quite frankly, to offend every single church group and charity group that I know in my constituency. They are appalled by the fact that the government has sought to undermine the aid budget in this way and to break a promise, a solemn promise that it made with the electorate, and in fact a promise that it appears to have made on behalf of the whole House, not just its own party. The impact on UK charities, on the work that they do, has been impacted unfairly by this. And I think that the government needs to look at that in particular. When charities go out there, make their stand, lobby, say that they're going to achieve things, their credibility goes on the line, and then their credibility is snatched away from them, not by something they do, but by something that the government has actually done. I'm sure the government didn't think tonight that they would be able to unite the Labour Party, members of its own party, the SNP, the DUP, Liberal Democrats. They didn't think that they'd be able to unite those parties, but they've succeeded in that tonight, in ensuring that the opposition to what they're planning on the aid budget has to be voiced. But I think that the government, Her Majesty's government, is breaking this promise, not just on behalf of itself, but on behalf of everyone in the UK. People voted in the last election with an expectation that this would be done. All the parties were committed to this. It became the law. And now that promise is going to be breached by the government. And in doing that, they damage the reputation of this mother of parliaments. They damage the reputation of all parties in here. And I think that it's a solemn breach that they have done, and they must mend it. This overseas aid budget is, of course, our soft diplomacy around the world. We've heard many of the calls about that, how other countries engage in much harsher and harder diplomacy, currency-led diplomacy. This is a soft diplomacy that shows that we care, that we're a passionate people, and removing it and reducing it says more about who we are as a nation than it does about anyone else. And I would implore the government to reconsider this matter and to reconsider it urgently. The government has set out all the excuses of the day, quite frankly, from that front bench, but none of those excuses add up economically, add up morally, or add up politically. And I would therefore say that the government really needs to revisit this and revisit it fast, because if they try to repair the damage, it will just cost them more money. So just reverse the decision, just put it right, just fix it, because this is something that we as a nation can afford and we want to pay for. And this is taxpayers' money, and the taxpayers say that they want this to be done. And I hope that we recognise the UK economy is in such a better place than we thought it was going to be, that it will be able to afford this. So let's keep our word as a parliament. Let's keep our word as a nation. And I implore the government to keep its word and to deliver on this promise. Thank you, Madam.
35 has withdrawn, so we go to Matt Weston.
Thank you, Madam Deputy Speaker. This should not be about political advantage. It is about the lives of hundreds of millions of people around the globe whose lives, already fragile existences, that are made more vulnerable now by the political calculations, as we've heard of the Prime Minister and the Chancellor. That's their decision. But it is choice for them to claim this nation is now free to forge its own future while demeaning our international stature by this decision. A reputation reduced at a stroke, as is so often the case under this government, but at a time when the world would ordinarily be hoping for greater leadership as we host the G7 as well as COP26 later this year. As we've heard, the only G7 country to cut its ODA budget, while others, such as the US, Germany and France, are increasing theirs. I'm afraid cutting the ODA budget at a time when less developed nations are the most vulnerable globally to the pandemic will be seen as one of the most callous choices made by a Chancellor in our lifetime. It is telling that so many across this House concur with our former Prime Ministers of all hues. As we have heard, we're talking about humanitarian aid cut by 70%, including the funding to Yemen, considered the world's worst humanitarian crisis, cut by 60%. Life-saving water sanitation and hygiene projects in developing nations, cut by 80%. Aid going to education, which will result in 700,000 fewer girls receiving an education, according to Save the Children's own analysis, cut 40%. Funding for the Global Polio Eradication Initiative, cut 95%. On a micro scale, the small British charity Dhaka Asania Mission, UK, whose FCO grant for work in northern Bangladesh has been cut 100%. The programme is to bring basic education to some of the poorest and hardest to reach rural children in Bangladesh, whose families live and work on some of the most marginal land within the flood areas of the north of the country. But it's the government's drastic cut to overseas aid also risks damaging the world's ability to fight the next global health disaster, which in turn, in self-interest, would keep Britain safe. 3,000 UK academics and global health experts in an open letter highlighted how critical are our interdependencies across our world, that the health risks and vulnerabilities are shared globally, and so should be the solutions if we are to address the emerging health threats. Remember, just over 2% of Africans have been vaccinated, whereas more than 75% of all vaccines have been administered in just 10 countries. And the decision to cut official development assistance funding has meant that UKRI need to find savings of £120 million in allocated funds in 21-22, hitting more than 800 global challenge research funding projects. For example, Warwick Medical School's work in Africa on digital health and the introduction of remote consulting, which in response to the pandemic, clinics have been contacting patients by phone rather than offering in-person visits, new and for the first time in the continent. Or the example of Newcastle University, perhaps the hardest hit of all, its leading work on water security and resilience to climate change, on river deltas, flooding and rainwater, working with 90 partners in 20 countries, helping them and stemming migration. These projects have shown Britain at its best, responsible and reliable, but no longer due to the cuts. We're happy to see an aircraft carrier travel around the world, but at the same time cut these projects to the most deserving. Madam Deputy Speaker, perhaps most depressing was hearing from the Right Honourable Member for Halton Price and Howden, who said this is something of a political gambit to win votes.
David Warburton is not here, so we go to Dr. Philippa Whitford.
Thank you, Madam Deputy Speaker. The Prime Minister has declared his aim to secure an agreement of the G7 to vaccinate the world against COVID by the end of next year. But it's hard to see how he would have the brass neck to push such a proposal when the UK will be the only one in the room cutting overseas aid. The overall budget is being cut by a third, but COVID funding masks the drastic cuts to core projects. These include the health and education of women and girls, which the government claimed was a key policy, as well as humanitarian aid, HIV/AIDS, conflict zones, famine relief, refugees, and child education. And it's hard to believe the government thinks it's remotely reasonable to slash funding for water and sanitation in the middle of a pandemic. Even if funding is restored in a couple of years, the staff, researchers, experience, knowledge, networks, and infrastructure of many of these projects will have been lost. The Chancellor has justified the cuts because of the cost of the pandemic. But what does he think it's been like for low-income countries that were struggling even before they were hit by COVID? The UK is also hosting COP26, but any promises by the minister responsible will have little credibility, as when he was International Development Minister, he made commitments the UK has now abandoned. In 2019, he promised more than 100 million a year for the Global Polio Eradication Initiative, only for the funding to now be cut by an eye-watering 95%. The WHO has estimated that 80 million children are at risk from infectious diseases such as diphtheria, polio, and measles, due to the disruption of immunisation caused by the COVID pandemic. So vaccination projects shouldn't face cuts. They need extra support to fund the necessary catch-up programmes. We mustn't allow the re-emergence of polio and other infectious diseases to take a toll on the children of low-income countries. COVID is a global crisis and calls for a global response. So far, the international community has struggled to live up to its warm words of last spring. But the UK is alone in cutting aid at such a critical time. Low-income countries have received less than 0.5% of all COVID vaccines delivered so far. And the UK is one of those blocking the sharing of intellectual property and technology. This will prolong the pandemic for all of us and delay the economic recovery of low-income countries. But the UK government mustn't compound the problem by removing support from some of the most vulnerable in the world. While I support the call to restore overseas funding, I don't believe it can wait until next year. The COVID crisis is now.
Alexander Stafford.
Thank you, Madam Deputy Speaker. I rise today to make a simple but yet resounding contribution to the debate on behalf of the people of Rother Valley, who are wholeheartedly in support of the government decision to temporarily reduce foreign aid from 0.7% to 0.5% of our GNI. The coronavirus pandemic has resulted in the most severe economic situation for 300 years, and residents across my constituency are experiencing great hardship, from losing jobs to struggling with mental health. My position is clear. I was elected to look after the people of Rother Valley first and foremost, and I shall do exactly that. I cannot support proposals to allocate 0.7% of our GNI to foreign aid when there's deep-rooted poverty in my own constituency. Across Rother Valley, the claimant rate is about 5.5%, and about 10% is youth unemployment. This has massively increased due to the corona pandemic. This is far too high. For example, in Maltby, a staggering number of 8% of all residents are unemployed. And in fact, Maltby in Rother Valley is one of the most deprived wards in the country. And this is mirrored throughout throughout Rother Valley, such as Swallownest and parts of Dinnington. This is where our aid money should be going. This is where the support should be going during this national emergency. And this should go towards helping level up Rother Valley for the British people. But more importantly for this debate, I find, is that we are not donating our own money. We are not donating taxpayers' money to this, which would warrant examination itself. But instead, we are sending abroad money that we, the government, the state, is borrowing. That's right. In fact, we are borrowing money where we can least afford it so we can send it abroad to foreign powers. How ridiculous that sounds. We are in debt and can be further in debt due to the coronavirus pandemic, yet we are borrowing more money so that we can send that money abroad. This is not our money. We are borrowing this money. So we are getting our own country into more and more debt. We cannot actually afford this at this point. But on top of this, we should be careful about where some of this money is going. We're sending vast sums of dictatorships to countries with space programs, nuclear programs, and nations who have been receiving aid for decades with little change or positive results. It's a disgrace that we are sending aid to the People's Republic of China, a hostile state with advanced military industrial programs led by a communist regime which threatens the rules-based world order and British interests across the globe. Yet we still have homeless veterans sleeping on our streets. This is not acceptable. Of course I'll give way to my honourable friend.
I'm very grateful to my honourable friend for giving way. He mentions China. And it's a very good point, because we shouldn't be spending any aid in China. It was cancelled on my first day in office 10 years ago, unless it was legally required. And the aid, I'm afraid, is being spent wrongly, in my view, by the Foreign Office.
I thank the clarification, but due to time, I will move forward and end my speech very shortly. But of course that we should donate our money to the most vulnerable, and my honourable friend did mention those who most needed it. But we should never forget the UK is the third largest donor in the G7, spending more than £10 billion this year alone. And we have led the world in providing vaccines to poorer countries. But what seems to be lost in the noise is the government has committed to returning the aid budget to 0.7% of GNI when fiscal circumstances allow. And there is no doubt that this will be the case. In fact, the Conservatives are the only party who have ensured that we have met the 0.7% target. Labour has consistently missed it. And this sums up the difference between the Conservatives and Labour. We are honest with people about the difficult choices that protect the British people. We are not flip-flopping. What we are doing is trying to make the difficult choices at a difficult time and this difficult situation.
Brendan O'Hara.
Thank you, Madam Deputy Speaker. The decision by this government to take essential life-saving money from the world's poorest people is absolutely shameful, and it's confirmed once and for all that the idea of global Britain has already lost its moral compass. And for that idea to have been confirmed in April's integrated security review simply beggars belief. The idea that by making the world's poorest people even poorer somehow makes us safer is an absolute nonsense, and it takes gaslighting to new extremes. Does the government really expect us to believe that the best way to make the people of the United Kingdom more safe and more secure is to slash vital humanitarian aid to parts of the world which are already ravaged by conflict, war and famine, and thereby forcing tens of millions of people to uproot their families and go in search of a better, more secure future? And it was with breathtaking insensitivity and to insult to injury that that same integrated review announced that money that could and should have gone to help underprivileged and poor people across the world will actually instead be spent on increasing the United Kingdom's stockpile of nuclear weapons. It is utterly abhorrent. This country has a historical moral obligation to those countries which are now in the developing world. We have to help them because we are responsible for where they are now. For more than a century, the United Kingdom grew rich and powerful on the backs of the poor, and the countries that we invaded, conquered, divided and plundered, they need our help now, and we cannot cut it off like this. It is abhorrent.
Bob Seeley for 90 seconds.
I shall try to sum up, Madam Deputy Speaker, by thanking my honourable friend and my honourable friend from Totnes for the debate and suggest a compromise. I'm happy to sign up to 0.7, but I do think we need to work to change the definition, because the definition we use is a technical official one, and actually we can do better. And I would suggest broadening the definition of aid so it includes peacekeeping operations and includes the BBC World Service and TV. If I was the government, I would seek a compromise here to try to say we'll get back to the 0.7, but let's work on a longer-term definition that broadens the definition of aid from purely economic development, which is what the current DAC, ODA, OCDE, whatever definition is, to one that encompasses peacekeeping at the beginning of the developmental process and goes all the way up to the BBC World Service and Radio, the support of civilisational values at the other end. That is a longer-term solution than the stale and dry argument between 0.7 good, not 0.7 bad. Thank you so much.
Andrew Mitchell.
Thank you, Madam Deputy Speaker, and thank you to you and to Mr Speaker for granting this SO24 today. I urge the Minister to hear the voice of the House. The Minister is a decent and understanding, fellow, and I hope he will reflect on what he's heard this afternoon. I think only 4 of the very many people who have spoke in support of the government's cuts. And I very much hope he will reflect on the innate decency of the British people and what he has heard across the House in all parts this afternoon. The House is not with the government on this, and the government should hear that. And they should also hear the voices of their loyal friends on these benches. We want the government to get it right. We are genuinely, hugely concerned. We know that the cuts will lead inevitably and unavoidably to hundreds of thousands of avoidable deaths. And we are worried about the trashing of our international reputation. These are the concerns that are shared across the House by the government's friends, as well as by the people who are not warm towards this government. So I really do urge my right honourable friend on the front bench to consider what he's heard this afternoon and to reflect upon it in the discussions which he's having in these very difficult circumstances in the Treasury. I note, Madam Deputy Speaker, that I and my colleagues were referred to in a normally very wise national newspapers as the sort of people, and I quote, who attend left-wing dinner parties in North London. And while, Madam Deputy Speaker, I confess that when I am in London and not in my constituency, the royal town of Sutton Coldfield, then I do live in Islington, I should make it clear that most of my friends who have joined me in this matter today wouldn't be seen dead at a left-wing dinner party, let alone in North London, Madam Deputy Speaker. But I'm extremely grateful to you for the debate today, for giving the House the chance to consider these matters, to influence the thinking of the Treasury and of the Chief Secretary, and to try and make sure we get this right.
Order. That concludes the debate, and I will now suspend the House for 3 minutes. Point of order, Anthony Mangle.
Thank you, Madam Deputy Speaker. Yesterday, the Speaker said that the government should come forward with a vote in this House. He was pretty insistent on it, in fact. And then today, I see that the press officer of Number 10 has suggested that there will be no vote on 0.7% because the government feels it does not have to do so. Could she perhaps provide some guidance on whether or not this is in keeping with the House and with what the Speaker has said?
Well, I thank the honourable gentleman for that point of order. I'm afraid that's rather a continuation of the debate that we've had, but I don't think there's much else to add to what the Speaker said yesterday, but I am sure that the Treasury bench will have heard his views. Right, we're now suspending the House for 3 minutes. Order. Order. The clerk will now proceed to read the orders of the day.
Compensation London Capital and Finance plc and Fraud Compensation Fund Bill, second reading.
No.
Before I ask the Minister to move the second reading, I'm going to introduce a 3-minute time limit for backbenchers. As colleagues will know, it's a very short debate, but I will try to get as many people as I can in. Minister Guy Opperman.
Madam Deputy Speaker, I beg to move that this bill be now read a second time. In the United Kingdom, there are a wide range of opportunities for people to invest. The government's role is to try and ensure that the system of regulation of financial investment is suitably robust so that individuals are treated fairly and that they have confidence in the financial system that they invest in. Unfortunately, no system of regulation can completely eradicate the risk that firms fail or that there are bad actors intent on committing fraud. This short bill is aimed at 2 areas where it is necessary for the government to step in. The first clause relates to a new government scheme to compensate London Capital and Finance bondholders who lost money after the firm entered into administration in 2019. The second is to arrange a loan to the board of the Pension Protection Fund to pay compensation to occupational pension scheme members who have been the victim of pension fraud following the recent High Court judgment in the PPF versus Dalradia. I'll now expand briefly on these measures in detail. I will very briefly give way, yes indeed.
I'm grateful to the Minister for giving way. He will understand that part of the reason why we are here today is because of Dame Gloucester's excoriating report into the capacity of the Financial Conduct Authority. Is he now certain that the Financial Conduct Authority has the powers it needs and, crucially, the capacity it needs to ensure that consumers of financial services businesses are properly protected going forward?
Yes, I believe that is the case. I believe that the Treasury and the FCA are working together. They're under new management, as the honourable gentleman will be aware, but more particularly, there is an acceptance by the FCA of all of the findings of Dame Elizabeth Gloucester's report, and more particularly, there is a fresh thinking, one hopes, that will be applied going forward.
On that point, would you agree?
For the last time, and very briefly.
Powers are one thing, willingness is another. The FCA has shown a remarkable reluctance to hold people to account for incompetence or bad actors, as he says. Does he find it absolutely unacceptable that and is it not the fact that these failings will simply continue unless the FCA starts to identify individuals with its own ranks or within the banks for these failings and holds those people to account?
Well, clearly, it's not possible to comment on specific future events. But I think, as ministers, we are liable for the actions of civil servants and through vicarious liability, and we would expect regulators to take a similar approach, and putting it simply, to own the problems that they're trying to solve. And if that is a lesson learnt from this particular saga, that would be a good thing, in my humble opinion. But clearly, it is for the FCA to take a good, long, hard look at themselves and other regulatory bodies and to decide how it is that they are going to run themselves going forward with suitable input from government. So, I'm not going to give away any more. I do apologise, but we're trying to do the whole debate in 58 minutes, so bear with me, please. As the House will be aware, on the 19th of April, the Economic Secretary provided a written ministerial statement on the government's approach to setting up a compensation scheme for London Capital and Finance bondholders who lost money following the firm's collapse in 2019. LCF was an FCA-authorised firm which sold unregulated, non-transferable debt securities, commonly known as mini-bonds, to investors. Sadly, 11,600 bondholders lost around £237 million when LCF went into administration. For some investors, this will have formed part of an investment portfolio, but for others, it will have represented a significant portion of their savings. Following the LCF collapse, the Economic Secretary directed the FCA to launch an independent investigation into the FCA's regulation and their supervision of LCF. As we've discussed, Dame Elizabeth Gloucester led the investigation. She concluded that the FCA did not effectively supervise and regulate LCF. The LCF business model was, it is accepted, highly unusual, both in its scale and its structure. In particular, the firm was authorised by the FCA, despite generating no income from regulated activities. This allowed LCF's unregulated activity of selling non-transferable debt securities, known as mini-bonds, to benefit from the impact of being issued by an authorised firm. While other mini-bond firms have failed, LCF is the only mini-bond firm which was authorised by the FCA and sold bonds in order to on-lend to other companies. In response to the regulatory failings detailed in Dame Elizabeth's report and the range of interconnected factors that led to losses for bondholders, the government announced two things. Firstly, it would establish a compensation scheme, and secondly, it would accept all of Dame Elizabeth's report, as did the FCA. It is, however, important to emphasise that the circumstances surrounding LCF are unique and exceptional, and the government cannot and should not be expected to stand behind every failed investment firm. This would, with respect, create the wrong incentives for individuals and an unacceptable burden on the taxpayer. The first clause in the bill, which is the LCF measure, covers two key elements. Firstly, it provides parliamentary authority for the Treasury to incur expenditure in relation to the scheme. Secondly, it is a minor technical change which disapplies the FCA's rulemaking processes for the purpose of the LCF compensation scheme. The Treasury intends to use Part 15A of the Financial Services and Markets Act to require the Financial Services Compensation Scheme to administer the scheme at speed on the Treasury's behalf. The scheme will be available to all LCF bondholders who have not already received compensation from the FSCS and represents 80% of the compensation they would have received had they been eligible for FSCS protection. Around 97% of LCF bondholders invested less than £85,000 and will not reach the compensation cap under either the government scheme or the FSCS. The government expects to pay out around £120 million in compensation to around 8,800 bondholders in total, and is committed to ensuring the scheme has made all payments within 6 months of this bill securing royal assent. As colleagues will be aware, this is a two-measure bill, the second clause of which concerns the Department for Work and Pensions and involves loans to the Board of the Pension Protection Fund. Clause 2 amends the Pensions Act of 2004, and it inserts a new section which will give the Secretary of State a power to lend money to the Board of the Pension Protection Fund. The Pension Protection Fund manages the Fraud Compensation Fund, which pays compensation to occupational pension schemes which have lost out financially due to dishonesty. When set up in 2004 by the Blair government, the PPF and the FCF did not envisage that pension liberation schemes were in scope for FCF payment. This clause will allow compensation to an estimated 8,806 individuals who have been defrauded following the pronouncement of the recent court judgment in Dalradia. Pension liberation fraud involves members being persuaded to transfer their pension savings from legitimate schemes to fraudulent schemes with promises of high investment returns or access to a loan from their pension scheme before the age of 55 without incurring a tax charge. The pensions regulator has now placed professional pensions trustees in charge of these affected schemes. Those trustees are seeking compensation on behalf of scheme members through the Fraud Compensation Fund. Following receipt of a significant number of applications, the Pension Protection Fund sought guidance from the High Court in a test case on which schemes should be eligible for the Fraud Compensation Fund. The court judgment in the case of the Pension Protection Fund versus Dalradia was pronounced on the 6th of November 2020, and the High Court concluded that such pension liberation schemes would be eligible subject to meeting an eligibility criteria. The government has decided to fully accept the court's judgment on this and is committed to ensuring all those who have been victims of pensions liberation schemes are able to claim through the Fraud Compensation Fund. However, it is estimated that claims will exceed £350 million, which is far, far greater than the £26.2 million of assets currently held in the Fraud Compensation Fund. Hence the requirement for Clause 2 of this bill and the action that the DWP and the government is taking. Madam Deputy Speaker, this is a necessary, urgent and important bill which will ensure financial protection and fair outcomes for those falling victim in these particular circumstances. My hope and expectation is that this bill will receive widespread support and I commend its contents to the House.
The question is that the bill be now read a second time. I call Shadow Minister Pat McFadden.
Thank you, Madam Deputy Speaker, and I'm grateful to the Minister. As he said, the bill does two things. It enables a government compensation scheme for the victims of the collapse of London Capital and Finance, and it authorises a government loan to the Fraud Compensation Fund, part of the Pension Protection Fund, to be paid for through a levy on the pensions industry. Let me take each of these in turn, and let me start with Clause 1 on the LCF compensation scheme. The Minister set out the background, and I don't need to repeat it here in a short debate. 11,500 investors losing a total of around 237 million. Some 56 million has been paid out by the Financial Services Compensation Scheme to just under 3,000 of those investors, covering those parts of LCF activity which came under the remit of the Financial Conduct Authority's regulated activities. The bill aims to compensate the rest up to 80% of the £85,000 FSCS limit, meaning payouts of up to £68,000 for those eligible. This is expected to cost the taxpayer around £120 million. Yes, I'll be good.
Talking about the cost to the taxpayer, I wonder if he continues to be shocked by the fact that a member of this House, the MP for Plymouth Moorview, received over £85,000 from subsidiaries that were mis-selling, from a company in my constituency that defrauded my constituents, and that actually that money has never been paid back, and that member received money from the taxpayer, and actually we should be looking at ourselves.
Order. Shadow Minister.
I'm grateful to my honourable friend, and I do think it ill behoves any member, given the scale of the losses and given the necessity of the government to bring in this bill to compensate people for the losses, to profit from this either directly or indirectly. And I think that should be clear to all of us. Now, the reason the government is doing this, is legislating on this, is because of the litany of regulatory failures set out in the report on this issue carried out by Dame Elizabeth Gloucester. These failures included failures to respond to repeated warnings from investors and potential investors, LCF repeatedly running promotions implying its products were regulated by the FCA, failures of communication between different parts of the FCA, all in the end leading to this collapse and financial loss. Had the FCA acted earlier, far fewer people would have invested through this firm, losses would have been lower, and the taxpayer would not be faced with the £120 million that we are talking about today. I will give way once more.
Thank you, gentleman. Giving way. I would like to ask his view on a couple in my Kirkcaldy and Cowdenbeath constituency who invested £10,000 each, or £20,000 in total, and they did so because the FCA backed the scheme. They feel that the real responsibility lies with the FCA and their derogation of that responsibility in ignoring warning signs. Whilst many responsible lenders, such as them, have lost money, they can ill afford. So does he not find it, as I do, a bit rich for the Minister to now say that they can't back every scheme when it was actually the regulator that was at fault in encouraging other people, as he has just said, to invest in that scheme?
Well, many investors did invest because they thought that these mini bonds were authorised by the FCA, and they were not. And that is a big part of the problem here, is where you have a regulated firm marketing unregulated products. But if I'm right, his constituents may be eligible for the compensation authorised by the bill. Now, Dame Elizabeth's report makes clear how badly the investors were let down by the regulator. And both the government and the FCA have said that they accept the findings. I've got a number of questions that I want to put to the Minister for his wind-up at the end of the debate. Can I ask, first of all, why the level of compensation that he's chosen is 80% of the FSCS level? On what basis was that decision made? Secondly, how will this work practically? I understand that the government wants to avoid the involvement of claims management companies, and that's something I think we'd all endorse. How will the government do that and avoid repeated rounds of claims? But the bill also gives rise to some important broader questions about policy. The failings identified were serious and substantial and have to be addressed. And the first of those broader questions is this: when should compensation paid for by the taxpayer be paid and when not? The Minister quite rightly said the taxpayer can't stand behind every investment loss. It would be unfair on taxpayers to expect them to do so, and it would produce perverse incentives. After all, we all know that the value of investments can go down as well as up. Now, in the case of LCF, it was bonds that were being sold, and the advertising implied a guaranteed payout when such payouts could not in practice be guaranteed. And regulation is aimed at enabling people to make reasonably informed choices and to understand the risks they're taking. So having made the decision to offer taxpayer-funded compensation in this case, when does the Minister believe it is justifiable that the taxpayer should be asked to do this and when not? What was the discussion in the Treasury about how to ring-fence this failure and this company from broader claims for financial compensation? Because there are calls for compensation quite regularly when investment failures happen. And how confident is the Minister that the Treasury will not be subject to legal action from victims of other investment failings? Secondly, how confident is the Minister that the FCA can actually make the changes necessary to avoid a repeat of the findings set out in Dame Elizabeth's report? Callers were phoning the FCA for 3 years before the company's collapse. Annex 6 of Dame Elizabeth's report says that the FCA received 611 queries from consumers regarding LCF. 611. That's not a random phone call at 5 o'clock on a Friday that can be missed. It's a pattern of people trying repeatedly to raise red flags and getting nowhere. Individual A, 15th of July 2016, and I quote, "This company is doing exactly what the pyramid scams are doing. What they're doing is paying the money out, the interest out from money which people are paying on the bond. In other words, it's just a pyramid scheme. They're saying they've got charges on their property, security on them, assets on their property. Of course, they don't have any assets. It's all horrendous, really, the whole thing." There was call after call like that, and they were not acted on. They weren't passed up the line, partly because the mini bonds weren't regulated. In fact, one caller was told by the FCA call handler, it's not a scam. There was also the letter from independent financial advisor Neil Liversidge in 2015, fully 3 years before the collapse of the company. He warned that LCF had one customer who was, and bear with me on the language, Madam Deputy Speaker, I'm quoting, worth the square root of bugger all, and tried to raise warnings about the practices and health of the company. Now, it appears that this letter was lost. And one of the more damning findings in Dame Elizabeth's report is that even if the letter had not been lost, and I quote again, it's unlikely that it would have resulted in any substantive action or reaction by the FCA. So little faith did she have in the processes, she appears to be arguing it didn't matter that this warning letter had been lost because it wouldn't have been acted on. So imagine if the FCA had acted in 2015 or 2016 when these reports were received, rather than only at the end of 2018. So another question for the Minister is, what's the FCA going to do to improve its handling of reports like this? Then there's the issue of the so-called halo effect. Regulated companies selling unregulated products. Being regulated by the FCA featured very heavily in LCF promotions. Now, the financial promotions team at the FCA did warn them to dial back on the advertising, but the pattern went on, and no one drew the conclusion that this wasn't just an advertising problem, it was a problem with the content of what they were actually selling. Dame Elizabeth says in her report, a substantial proportion of the bondholders said they would not have invested in LCF had it not been for the fact it was regulated by the FCA. So how will the FCA avoid this difference between unregulated activity and regulated companies from being exploited in the future? The Gloucester report was also the subject of a well-publicised disagreement between the Governor of the Bank of England, Andrew Bailey, and Dame Elizabeth about the nature of responsibility and accountability. Now, where does the government stand on this issue? It was all played out before the Treasury Select Committee in several hearings. Is it the Treasury's view that senior officials in leading regulatory bodies are responsible for the failings that happen on their watch, or should responsibility only apply to the organisation collectively? Does the Minister agree with the statement in the report that, and I quote, "It is difficult to see why an individual's willingness to take on challenging tasks in public bodies should absolve them from accountability"? Or does the Treasury accept the statement from the Parliamentary Commission on Banking Standards quoted in the report that a buck that doesn't stop with an individual stops nowhere? Madam Deputy Speaker, these broader questions matter because with ever more complex financial markets, the regulators have to be equipped to do the job, equipped through their leadership, equipped through their systems, but also equipped through the resources at their disposal. And part of the backdrop of this is the FCA taking on responsibility for tens of thousands more firms after they took on the responsibilities of the OFT back in 2014. So is the Minister confident that they have got the resources after the LCF collapse? Now let me turn to Clause 2 and the Fraud Compensation Fund. The bill authorises a loan to be made as a consequence of greater than expected claims on that fund arising from the Dalriada case. It's estimated that the judgment in this case could result in claims of over $300 million, and this loan will be funded by a levy on the pensions industry to be paid back over the next 10 to 15 years. Madam Deputy Speaker, this comes on top of the levy to pay for the Financial Services Compensation Scheme, rising sharply since the introduction of the government's pension freedom legislation in 2015. Back then, the levy was £300 million. This year, it will be over £1 billion. That's a 48% increase on the previous year and more than triple the level of 5 years ago. So I have to ask the Minister, why is it he thinks that the FSCS levy has had to increase so much since the pension freedom legislation was introduced in 2015? And now we have a new fraud levy to boot. Surely the right way to tackle this issue is to ask why more and more pensioners are being exposed to frauds and scams in the first place. Why does the Minister think this is happening? Why are more pensioners losing their money? When the previous Chancellor introduced his pension freedom changes, he said, and I quote, "There'll be free, impartial guidance available to all." 6 years on, the take-up of that advice is just 3%. Even when the Department of Work and Pensions made a targeted push to increase that, the level only got up to 11%. So the vast majority of people using these freedoms are not using this service. And of the small number who do take up the option, 72% say they do something different after receiving advice than from their first inclination. So it's clear that such advice can help people make a better decision, but take-up is nowhere near the promise that was made at the time. So the promise of pension freedom being matched with good, trustworthy financial advice has not been kept. And these levies, which will have to be paid by the pension schemes, which have been nowhere near fraud and are trying to offer a good service to their members, are being put in place, at least in part, as a result of the government's own pension reforms, which have left more pensioners exposed to frauds and scams. And that conclusion was endorsed by the Work and Pensions Select Committee in their recent report. Madam Deputy Speaker, what unites both of these clauses is people being subject to fraud, often through online advertising. There's a clear need for greater action on this. People are being bombarded on a daily basis with adverts on investment, some of which are scams and attempts and fraud. Financial innovation can be a great thing, but consumers need help in navigating this world. And they are currently being failed by a regulatory system which is lagging behind what's actually happening in the financial markets. There is an online harms bill coming, which as things stand does not include plans to crack down on financial crime. I urge the government to think again on this. To proceed with that bill without tackling online financial harm would be an enormous lost opportunity to protect consumers against this type of crime. The answer is not just compensation when people lose money. It is to protect people against financial scams happening before they lose their money. It is to crack down on the fraudsters while they are peddling their scams and to stop these adverts reaching people in the first place. Madam Deputy Speaker, not all thieves wear masks. It's possible to rob people of their money through misleading websites and illusory promises of financial gain. And it's critical that the laws that we pass in this place keep pace with the innovations in fraud and financial crime which are taking place. And for that to happen, it will take a lot more than the 2 clauses on compensation in this bill.
We now go to the Chair of the Treasury Select Committee, Mel Stride, who has 4 minutes.
Thank you, Madam Deputy Speaker. This is a very important bill. It seeks to compensate for some very significant wrongs. We have heard on the Treasury Select Committee, as part of our ongoing inquiry into London Capital and Finance and the FCA's response to that, many harrowing stories of those who have lost, in many cases, life-changing amounts of money as a consequence of what has happened. The Treasury Select Committee has been involved in the LCF situation for some time. In fact, it was my predecessor, Baroness Morgan, who initiated that inquiry by Dame Elizabeth Gloucester through approaches from the committee to the Treasury and the FCA. And can I take this opportunity just to offer my thanks on behalf of the committee and indeed of the LCF bondholders for the very thorough report that she and her team produced, and also for the witness session that she attended as part of our inquiry, and for the courtesy and information that she provided me outside of that witness session, both by way of correspondence and discussions over the telephone. She has carried out some very excellent work, and it's very clear, as a consequence of her report, the level of the failings that there have been on the part of the FCA. Indeed, the answers to the key questions that were put by government to Dame Elizabeth as part of the directions for her inquiry were clear. The answers were that the permissions granted to LCF were not appropriate for the business that it carried on, that the FCA did not adequately supervise LCF's compliance with the FCA's rules and policies, the FCA's handling of information from third parties regarding LCF was wholly deficient. The FCA had appropriate rules to regulate the communication of financial promotions by LCF. However, the FCA did not have in place appropriate policies. There were so many, numerous red flags, Madam Deputy Speaker, that the committee examined, and yet these were missed over a long period of time. There were wider failings within the regulatory system, and we've heard some of those from the Shadow Minister. The FCA's approach to the perimeter was limited. They did not take a holistic view of the perimeter, and therefore there was inadequate supervision of unregulated activities. The halo effect that the Shadow Minister also raised was undoubtedly a wider systemic problem within the FCA. Madam Deputy Speaker, our inquiry is ongoing. We've taken evidence from Dame Elizabeth, from senior personnel at the FCA, including Andrew Bailey, who was, during the appropriate period, the Chief Executive Officer of the FCA, and of course my honourable friend, the Economic Secretary to the Treasury. And we will have much to say in our report, which will be published no later than the end of this month. Looking ahead, the speakers so far have quite rightly asked the question, how do we make sure that this doesn't happen again? That lies within the transformation programme that the FCA is now undertaking, and the committee will be showing a very close and careful interest in the progress of that transformation programme. And I also note, by way of intervention, my honourable friend, the member for Thurston Morton's observation about the importance of those who are responsible for shortcomings being held accountable, and we will no doubt have something to say about that in the report. It does lead on, I think, Madam Deputy Speaker, this whole issue of compensation to the issue of whether the general view that there should be personal responsibility for investments as well as government backing, and we will need to look at that. I am terribly short of time, so I will leave it there. But thank you, Madam Deputy Speaker. I welcome this bill.
Thank you. We now go to the SNP spokesperson, Peter Grant, who I'm sure will be acutely aware of the very limited amount of time we have left for the debate. Peter Grant.
Thank you, Madam Deputy Speaker. I'm pleased to be able to speak in this short debate and to confirm that the SNP won't oppose the second reading, but I'm angry and frustrated that this debate needs to take place at all. Both parts of this legislation are only necessary because of a catalogue of failures of government, failures of legislation and failures of regulators. I want to look briefly at the second of the two parts, first of all, on the Pension Protection Fund, because one of the first times I spoke in Parliament, just a few days after my maiden speech, I raised concerns about pension liberation scams and asked the then Secretary of State what steps the government was taking to protect people from them, to make sure that changing the rules wasn't just going to make open season for the scammers. We now know the answer to that question was the government were doing nothing, or if they were doing anything, they weren't doing nearly enough. £850 million has been stolen from people's pensions using these scams. It's right that those pensioners should be compensated from the Pension Protection Fund, and I'll certainly support the provision in Clause 2 to allow that to happen. Clause 1 sets up the promised compensation scheme for victims of the London capital and finance scandal. About 11,000 people were affected. About 2,000 got some compensation, about 9,000 got nothing. I don't think any of the 11,000 understand why some qualified for compensation and some didn't. So it's very welcome that the bill will provide some redress for the 9,000 or so bondholders that otherwise would have got nothing. It's welcome, it's not enough. The House of Commons Library has described the government's decision to set up the compensation scheme as a somewhat exceptional response. The response is exceptional, but the scandal it is in response to is anything but exceptional. It's the latest, sadly almost certainly not the last, but the latest in a roll of shame that includes Equitable Life, Premier FX, Connaught, Henley Pensions, Blackmore Bond and many, many others. The victims of some of these schemes get compensation, tens of thousands get nothing. Blackmore Bond, for example, went into administration in May 2020. Their bondholders are unlikely to see any of the £46 million investment that the company's directors had promised them is safe and guaranteed. One of my constituents lost his £40,000 life savings to Blackmore Bond. And I have to disagree with the Minister's claim that LCF is unique or even distinctive in any material way from Blackmore Bond and various other mini-bond failures. LCF hid behind their own FCA registration, knowing that it had nothing to do with the products they were selling. Blackmore Bond and others hid behind the FCA registration of other companies who acted as the representatives. But the intention in all cases was clear. The intention was to mislead investors as to the degree of protection that the Financial Conduct Authority would give them, when in most cases the companies knew that the Financial Conduct Authority would give no protection whatsoever. And like LCF, again, Blackmore Bond could have been stopped much sooner if the Financial Conduct Authority had acted on the warnings it was receiving as long ago as early 2017 from an eyewitness who offered to let them into his office and watch and listen at first hand to the unlawful telephone sales practices the company's representatives, Amima Limited, were using, his words, not mine. It took 2.5 years for the Financial Conduct Authority to remove Amima's right to act as an authorised representatives. And then several months later, again, as part of its response to the collapse of LCF, the Financial Conduct Authority banned the sale of mini bonds to small retail investors. £26 million of the total investor losses in Blackmore Bond were from bonds that they sold after March 2017, after the Financial Conduct Authority had enough information to take decisive action, but before they had taken action that was needed. So I want to see legislation, or possibly even an amendment to this bill, to allow schemes similar to the London Capital and Finance Compensation Scheme to be made available to victims of other pension and investment scams without having to wait for a public inquiry and a new Act of Parliament for every single one. I want to see the government getting serious about dealing with the shysters and charlatans who too often seem to walk away unscathed from these scandals, or more likely get driven away in their chauffeur-driven luxury cars, leaving their victims, in many cases, almost destitute. And I want to see a regulatory regime that works, not just to compensate the victims of public expense, but to stop the crooks and chancellors from being able to con people out of the money in the first place. The fact that the Minister admitted in his opening speech that paying compensations to all victims of pension or investment scams would place an unacceptable burden on the public finances is one of the biggest admissions of regulatory failure by any government minister that I can ever remember. So while we welcome the steps taken in this bill, the message, I think, very clearly from the SNP, as it was from the Labour front bench a few minutes ago, is that this is not even enough to be the start of the action that is needed to make people's pensions and investments safe from the crooks. Thank you.
James Grundy.
Thank you, Madam Deputy Speaker. First of all, can I thank my honourable and right honourable friends on the front bench for bringing this bill before the House. I welcome the second reading of this bill and am pleased the Government is making tangible progress on this issue. I would also like to thank Dame Gloucester for her report into this matter, and I welcome that the Government has accepted the 9 recommendations made in her report. My contribution to this debate will be very brief, and given the time constraints, I hope other members of the House will forgive me for not taking interventions. I hope that my honourable friend's department will clarify whether bondholders will be required to surrender all their bonds in order to qualify for the government scheme. If this is the case, some of my constituents who invested considerable sums into the scheme would be forced to surrender all their bonds, regardless of the amount invested, to receive the maximum £68,000 compensation offered by the government, as opposed to being able to surrender a portion of their bonds to gain access to the government's compensation scheme, while still potentially being able to receive further dividend payments direct from the administrators, ensuring their loss is reduced. This is an issue that my constituents need clarity on, and consideration of this matter by my honourable friend's department would be most welcome. I have recently written to my honourable friend on this matter, and I very much look forward to his response. Thank you, Madam Deputy Speaker.
We now go to John MacDonald.
This bill will bring relief to thousands of investors who were let down by a failed company, but they weren't just let down by a failed company, they were let down by a failed system. That's why we need a bill that will address the failures of regulation, governments and auditing. This bill does none of that. It's the government yet again bailing out victims of an under-regulated finance system that is regularly ripping off smaller investors. And I have to say, government ministers are guilty of gross negligence for standing by while this happens time and time again. The LCF is offering customers mini bonds, has been said. The FCA said, and I quote, "There's no legal definition of a mini bond," but it did nothing to stop this mis-selling. The FCA saw no issue with LCF's operations, yet in March 2019, HMRC found that products advertised by the LCF as ICAs did not meet the rules. In addition, the FCA was advising that investments would be protected by the Financial Services Compensation Scheme. The High Court judged that they were not. The FCA was asleep at the wheel. The then chief executive of the FCA, who is now the governor of the Bank of England, sat on his haunches and did nothing. 18 months ago, I called upon the previous Chancellor to delay Mr. Bailey's appointment as governor, given these concerns. And I'm pleased with the report from Dame Elizabeth Gloucester actually identifying some of those problems. She described the role of the FCA supervision of LCF to be wholly deficient, significant gaps and weaknesses in the FCA's practices, with staff, and I quote, not sufficiently trained to analyse a firm's financial information to detect indicators of fraud or other serious irregularity. The LCS founder was Simon Hume Kendall, a former chairman of the Tunbridge Wells Conservatives and a party donor. It was reported that the investors' cash in LCF has been used to buy horses, a helicopter and lifetime memberships to private Mayfair clubs. Perhaps the Minister could update us on the ongoing inquiries into the activities of this gentleman and the LCS. And as has been said, this is not a one-off. There are so many others, Blackmore, Bassett Gold, Chilango. Maybe the Minister can tell us when further bills will be coming forward to compensate those investors who lost so much money. I welcome this bill, of course I do. but actually it's time now for the government to bring forward serious legislation to stop crimes like this happening in the first place and to protect our constituents from these spivs.
Number 7 has withdrawn, so we go to Sammy Wilson.
Thank you, Madam Deputy Speaker. And first of all, can I welcome this bill? And I think that those of my constituents who have been affected by the collapse of LCF will welcome the fact that as a result of the excellent report which was put forward by Dame Elizabeth, which really lifted the lid on the way in which the Financial Conduct Authority failed in its obligations. And I think that has forced the government into the position where we have this bill today, and I welcome that. But I think that, as other speakers have said, this is not the first time the Financial Conduct Authority has failed in its regulatory duty and left people, many of whom are innocents in all of this. They take the assurances which firms give that they're regulated, that there's protection there, and they invest their savings in it, only to find that their savings are snatched from them. And when one looks at the failure of the FCA in this particular case, it failed to meet its statutory obligations. It failed to take any action, even when it found that a regulated firm was engaging solely in unregulated lending. Now, surely that must have shown, raised some concerns that the firm was using its regulated status to engage in activities which were unregulated. Its staff clearly weren't trained in taking complaints and passing them on. And indeed, as Dame Elizabeth pointed out, its staff were actually assuring the public that the claims being made by LCF were correct and that their savings were safe. And even when fraud was passed on up the line to supervisors, again, it was ignored. So all of these regulatory failures, I believe, do require the government to ensure that there's compensation for individuals. But I agree with the Minister that we cannot simply cover every spiv and every chancellor who tries to take money from people. And if we're going to avoid that, then we've got to have proper regulation, as other speakers have said. And if the Financial Conduct Authority has proven that it is not up to the job, then new regulations have to be put in place. And those who take on responsibility in Financial Conduct Authority have to be held responsible as well. We can't simply say it's the institution, because there are people who are in charge. We've got to avoid this happening again, so that people in my constituency who have suffered do not continue to suffer from these kinds of actions.
Number 9 has withdrawn, so we go to Rebecca Long-Bailey.
Thank you, Madam Deputy Speaker. My constituents weren't professional financial investors. Most were senior citizens relying upon the investment for their pension. They worked hard in their younger years to save a little bit here, a little bit there, to ensure that in their twilight years, they would have enough to live on. But this security was savagely snatched away from them. They were duped by grossly misleading and deceitful marketing and let down by negligent regulators and ineffective auditors. So whilst I'm broadly supportive of the bill today, there are two very urgent issues the government must address. Firstly, the compensation is capped at 80% of what victims would have been entitled to had they been eligible for the Financial Services Compensation Scheme. And they were denied that protection simply because mini bonds were not regulated. Now, the Gloucester report has outlined that the FCA had identified the risks to consumers posed by mini bonds from as early as 2013, and the additional risks relating to the use of mini bonds as quasi-investment vehicles by at least 2017. Yet the FCA and the government failed to regulate. So the government must therefore recognise its own negligence to regulate, as well as the FCA's, and commit today to offer the full compensation victims should have been entitled to. Secondly, on the issue of auditing, London Capital and Finance had only £50,000 of share capital and high leverage in 2016, but its auditors simply waved through its accounts. In 2018, when the firm was all but insolvent, astoundingly, its auditors again had no problem with its accounts. But sadly, as we know, this is not a rare occurrence. BHS, Carillion, Thomas Cook, Patisserie Valerie, and many more all sailed through their audits with flying colours despite the horrors lurking beneath. Such scandals required robust action to ensure they can never happen again. But this bill does not do that. So the government must set out urgent proposals to address the systemic regulatory failure this case has exposed, both in the FCA but also within the auditing industry. Thank you.
Gareth Thomas.
Thank you, Madam Deputy Speaker. I rise to support the bill, but also to suggest that there are wider issues to be considered from this scandal. In particular, to suggest that there are some disturbing echoes from Dame Gloucester's report in how the demutualisation of Liverpool Victoria is being considered by the same regulators, and an urgent need to tighten up some major legal loopholes. The focus of the Financial Conduct Authority's interest to date in both LCNF and Liverpool Victoria is very different. LCNF was selling or rather mis-selling a distinct product. With Liverpool Victoria, the issue is whether it should be allowed to hand over all the capital and assets its British customers have helped it build up over almost 200 years to a privately owned American firm with no commensurate experience, and whether the choices of past consumers and consumers now are being respected. I understand regulators have had a substantial number of meetings with those pushing the demutualisation, but none with the customers and owners of Liverpool Victoria. Consumers lost thousands with London Capital and Finance. The customers of Liverpool Victoria also risk losing out significantly. Dame Gloucester's report questioned whether policy papers and staff training at the FCA were adequate. In the case of LCNF, the inability to detect indicators of fraud were the key drivers of her concern there. But given that the FCA has made no analysis of what happened during previous demutualisations of financial services businesses, whether customers benefited or whether they lost out, whether customers were presented with fair information and given access to alternative viewpoints, it's difficult to see how staff could be trained to properly protect the consumer interest during demutualisation. Indeed, all the evidence that has been compiled independently suggests that demutualisations result in worse services for consumers. It's clear Dame Gloucester thought the FCA wasn't fit for purpose. It didn't protect LCNF customers despite repeated wake-up calls. And similarly, given the complicated nature of financial services businesses, the customers of a financial mutual are not always well placed to make a judgment about whether a vote for a conversion is in their interest. They rely on the advice of others. Customers are not given even-handed information by boards wanting to demutualise, certainly they're not being in Liverpool Victoria's case, to allow them to make an informed decision. So the FCA has a critical role, and it needs to exercise a little bit more robust direction to the board of Liverpool Victoria. Similarly, legislation needs updating for friendly societies to protect consumers' assets properly and to ensure regulators can properly protect consumers during demutualisations.
Shannon.
Thank you, Madam Deputy Speaker. And very quickly, I also want to welcome the bill that's presented by the Minister and very much look forward to it being brought forward. And when I'm reading the background information about and I look back on what happened, I do ask a couple of questions if I can while supporting the bill, where I think it's important we do so. The FCA had found in this case that, for London Capital and Finance that they've been misleading, not fair and unclear in their advertising. There have been serious concerns about the way the firm was conducting its business, and for me that would be clear that the FCA at that time failed the investors. At the same time, the Dame Elizabeth's report also concluded that the FCA FCA did not discharge its function in respect of the LCF in a manner which enabled it effectively to fulfil its statutory objectives. So we are where we are tonight, and we have a bill which hopefully will address those issues for this particular number of investors. And I just want to ask the Minister, will it be, as the previous speaker referred to, whether there be other ones that have invested similarly and where indiscretions and fraud has taken place, that they will also be able to have the benefit of this legislation that we have before us tonight. I also think it's very positive, and I welcome Clause 2 of the bill, which gives the City of State the power to make a loan to the board of the PPF to enable the payment of compensation to eligible occupational pension schemes. Following the High Court in judgment is an essential component, as is the fact that the legislation entails that the loan is repaid by the FCF levy over a period currently estimated to be between 10 and 15 years. If we can protect those pension schemes and those investors through that there and give them peace of mind, because every one of us who has spoken previously before me and the Minister who will sum up, the role and the protection of the pensioners is increasingly important to me. I want to pose one last question, if I can, to the Minister. Those investors who have passed away and perhaps maybe have not been able to take advantage of the legislation that's coming before us tonight, can I just ask, will those families of the deceased and those who are no longer here, will they qualify for the compensation as well? Madam Deputy Speaker, thank you.
Thank you, Madam Deputy Speaker, and it's a great honour to speak in this debate and to work with my honourable friend, the member for Hexham, to bring forward this legislation. And many, if not all, members of this House will have constituents impacted by the issues dealt with and discussed this afternoon. I'm pleased that this bill has the support of members across the House, and I've listened very carefully to the debate, and there's been a number of observations made about the FCA, about the confidence that the House has in the conduct of the FCA, and I will seek to address those points in my response. And I do want to respond to the important points raised by several members around the compensation scheme for London Capital and Finance. So if I take the scope of the compensation scheme and what it means in relation to the government's approach to future firm failures, a point raised by the honourable gentleman, the member for Hayes and Harlington, amongst others. I would say that the LCF is not the only mini-bond firm that has failed in recent years. The Treasury, in collaboration with the FCA, has examined every mini-bond issuer known to have failed in the last 8 years. And following this detailed analysis, the government is satisfied that the circumstances surrounding LCF are truly exceptional. As members may already be aware, the issuance of mini-bonds is not regulated by the FCA. And as my honourable friend, the Minister for Pensions, set out, LCF was an FCA authorised firm, despite not receiving any income from regulated activities. And LCF is unique in this regard. Indeed, it is the only mini-bond issuer which was authorised by the FCA and sold bonds on lend to other companies. And this is important because one of the central findings in Dame Elizabeth Gloucester's excellent report is that because LCF was authorised, the FCA should have considered their business holistically, including the unregulated activity of issuing mini-bonds. The FCA cannot be said to have the same responsibilities with regards to unauthorised firms. Although the government has not seen evidence to suggest that the regulatory failings at the FCA caused the losses for bondholders, they were a major factor that the government has considered when deciding to establish this scheme. I just pause here and acknowledge the representations made by the honourable gentleman from Strangford, from Cowdenbeath and from Lee. And I will set out in due course in the coming months the details of how the scheme will operate. And I'm very happy to take correspondence on individual cases, but I think it would be inappropriate for me to try and address every single case raised from the dispatch box this evening. But I have received and read many letters from individuals who have lost money after investing in LCF and other failed mini-bond firms, including Blackmore Bond and Bassett Gold, which was raised during the debate. And I want to sincerely extend my sympathy to all those affected, as I know that many individuals have suffered financial hardship, severe financial hardship in many cases, as a result of their investment losses. However, I must be clear that the government cannot step in to pay compensation in respect of every failed financial services firm that falls outside the financial services compensation scheme. That would create a moral hazard for investors and potentially lead individuals to choose unsuitable investments, thinking that the government will provide compensation in all cases if things go wrong. The government's approach follows the historical precedent, and I would note that only 3 compensation schemes have been established in the last 35 years. For Barlow Clowes, a Ponzi scheme that failed in the late 1980s, Equitable Life and LCF, despite many investment firms failing over that period. The government is also seeking to ensure that the situation never arises in future. In April, the government launched a consultation with proposals to bring mini-bonds into FCA regulation. And the Right Honourable Gentleman asked a number of questions concerning the confidence that the government has concerning the FCA's capability going forward. And as my honourable friend mentioned, the transformation programme that the new Chief Executive, who's now been in post for just over 8 months, is undertaking at pace, is designed to empower the organisation at all levels to hear those representations that the Right Honourable Gentleman made and act on them and deal proactively with the cases that are raised. I'm very happy to give way to the Honourable Gentleman.
To the Minister, and it is encouraging to hear his confidence in the transformation programme. But given the concerns that consumers might lose out in the demutualisation of Liverpool Victoria, will he sit down with the new Chief Executive of the FCA and go through how the FCA are ensuring that their consumers' interest, if that demutualisation goes ahead, is properly protected?
I thank the Honourable Gentleman, as ever, for his representations, and he's been a determined campaigner for that sector during my tenure. And I have regular, at least every 6-week, conversations with the Chief Executive of the FCA, and we discuss a whole range of matters, and I'd be very happy to discuss that matter with him when I next speak to him in the next few weeks. As has been recognised across the House today, the measure concerning a loan to the Board of the Pension Protection Fund set out in Clause 2 of the bill is vital to ensure that those defrauded of their pensions by scam pensions liberation schemes are able to access the compensation they deserve. This bill will ensure that those whose pensions have been unjustly targeted by fraudsters receive their pensions. We must continue to provide a safety net for people across the UK who deserve to have confidence that they will have a pension pot for their retirement. And I note the number of observations that were made concerning the ongoing challenge dealing with the evolving nature of financial services firms and the sophistication of scams. And this is a matter that the Honourable Gentleman and myself are certainly working across Whitehall to bring an effective resolution to. But I do acknowledge that members across the House have supported the principles of this bill, and I welcome the support received today. Madam Deputy Speaker, this bill will offer some relief to the enormous distress and hardship suffered by LCF bondholders and victims of fraudulent pension liberation schemes. It is an important bill, and I want to move as quickly as possible from royal assent to actually enact it and to deliver that compensation. But I'm hopeful that honourable and right honourable members will support it this evening. Thank you, Madam Deputy Speaker.
The question is that the bill be now read a second time. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Programme motion to be moved formally.
Make to move.
question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. Money resolution to be moved formally.
Beg to move.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. Ways and Means resolution to be moved formally.
Beg to move.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. Thank you. I'll suspend the House for 2 minutes to make the necessary arrangements for the next business. Order, order. We now come to motion number 6 on the House of Commons Commission, external members. I call the Leader of the House to move the motion.
Thank you, Madam Deputy Speaker. I beg to move the motion standing my name on the order paper. But before turning to today's motion, I am sure that the House will want to join me in thanking Jane McCall, who served as an external member on the Commission for over 5 years and finished her time in post at the end of April. In addition, Rima Makarim's 3-year term will end on the 30th of September, and owing to other commitments, she has given notice that she will not be seeking an extension to her appointment. Having served alongside both of them on the Commission, I am most grateful for their contribution and the valuable external perspective and commitment they brought to their roles. I'm particularly grateful they always had a particular interest in value for money, which is one of the things that I think we should take most seriously in this House as guardians of taxpayers' money. So I'm grateful for what they've done, and I wish them well for their future endeavours. Today's motion gives the House the opportunity to agree 2 new external members of the Commission. In February, the Commission endorsed the recruitment process to appoint new external members. The full details of that process are set out in the Commission report on the nomination of candidates for its external members, HC 233, which has been tagged to today's debate. In March, a sifting panel, consisting of the then Shadow Leader of the House, the Right Honourable Lady, the Member for Walsall South, the Clerk of the House and the Secretary of the Commission, Marianne Sinarski, CBE, shortlisted 4 candidates for interview by the selection panel. The selection panel comprised Mr Speaker, me, the Right Honourable Lady, the Member for Walsall South, Isabel Doverty, a former Civil Service Commissioner, the Clerk of the House and the Secretary of the Commission. Interviews took place in April. Following this process, the selection panel recommended to the Commission that Louise Wilson and Srinivas Honab be nominated as its new external members, with Louise replacing Jane McCall and, in due course, Srinivas replacing Rima Makarim. Should the House agree to these appointments, it is expected that both will also serve on the Audit and Risk Assurance Committee, and that Srinivas will replace Rima Makaram as chairman of that committee. As the Commission's report set out, Louise Wilson is a business leader with an international career combining commercial expertise with extensive non-executive experience in the public, private and charitable sectors. She established her career at Accenture and gained global marketing and commercial expertise at Procter & Gamble, PepsiCo and the Coca-Cola Company. So she's very fizzy, I should think, with all that experience of those drinks companies. She founded an international marketing and sponsorship company and, following London's successful bid, served as the client service director of the 2012 London Olympic and Paralympic Games. She has previously undertaken non-executive roles across a range of business and charitable organisations spanning education, heritage, culture, visitor attractions, faith and diversity. These have included roles at historic royal palaces, the University of Nottingham, DRET Education Academy Trust, the International Women's Forum, Harvard Vatican Leadership Trust, the Marketing Group of Great Britain, the Queen's Commonwealth Trust, and currently with the Northern Ireland Office and the National Emergencies Trust. Srinivas Honab is a chartered accountant by profession and served with Vodafone, Capita, KPMG and EGG during his executive career. He currently holds a number of non-executive roles, including as the chairman at the Driver and Vehicle Standards Agency, the non-executive and chairman of audit at UK Atomic Energy Authority and at the Royal Payments Agency. He has recently been appointed to the Civil Service Pensions Board and also serves as a lay member for the Speaker's Committee on the Independent Parliamentary Standards Authority and a panel member at the Competition and Market Authority and Pensions Determination Panel. The Commission believes that both candidates bring a diverse range and depth of experience and that this will hugely benefit the work of the Commission in the coming years. And as a member of the Commission that interviewed them, I would add my own very strong personal recommendation. I think we interviewed two exceptionally strong candidates, and the House is very fortunate that they put their names forward and are willing to serve. As such, the House of Commons Commission, and I am of course in bringing this motion acting for the Commission, recommends that the House appoint both candidates as external members, each for an initial period of 3 years. I hope that the House will agree to their appointments today, and I commend this motion to the House.
The question is, as on the order paper, Shadow Leader of the House, Thangam Debonair.
Thank you, Madam Deputy Speaker, and I thank the Leader of the House for that motion. And on behalf of Her Majesty's Opposition, may I welcome warmly the two new external members of the House of Commons Commission. I've had the pleasure of meeting one already, Louise Wilson. She impressed me greatly, but I also read carefully the report that the Leader of the House has made reference to with details of the recruitment process. And from my so far limited experience of the Commission, I would say that this appears to have been done in a fair and thorough manner. And I look forward to meeting the second external commissioner in due course. I know that we are going to move on subsequent motions without debate, so I'd just like to place on record my thanks to the Honourable Member for Nottingham South for her service on the Parliamentary Works Estimates Commission, as well as to welcome, obviously, the Right Honourable Member for Newcastle East to that post. But to finish, I would like to strongly recommend, from what I've seen and the evidence I've heard and read, Louise Wilson and Srinivas Honab to the House of Commons Commission as external commissioners.
Pete Wishart.
Thank you very much, Madam Deputy Speaker, and can I thank the Leader of the House for moving this motion this evening. Can I also just first of all apologise to you, Madam Deputy Speaker, to the Speaker and to the House for not being in my regular place at business questions on the regular sessions on a Thursday morning. It's not because I don't want to be here, it's just because I also chair the Scottish Affairs Committee, which meets just now on a Thursday morning, and the Conservative members have resolutely refused to move the timing of that committee meeting, and I hope to get this resolved as soon as possible. And I know the Leader of the House always says that there isn't a Conservative majority on the Scottish Affairs Committee, which is entirely right. But how we try to work in this House, Madam Deputy Speaker, as you know, is through consensus, through engagement, working together so we can make sure that it's an outcome positive for everybody. So I once again appeal to the Leader of the House to maybe make representations to his colleagues so we can get back here, because I know he enjoys Joyce with me on a Thursday morning, and I'm sure we'll be able to do that. But I've also never had the opportunity to welcome the Honourable Lady to her post, because I've not been here on a Thursday morning, so I do welcome the Honourable Lady, and I've never got an opportunity to pay tribute to the Honourable Member for Walsall East, who we served so many years, the three of us together, and I just want to make that on record, because I've not had a chance to do that, Madam Deputy Speaker, and I'm sure you will forgive me for that. But I also want to welcome, first of all, Louise Wilson. I think this is a fantastic appointment, and I very much look forward to working with her on the Commission. I also had the pleasure of meeting Louise just a few weeks ago, and she is as effervescent as the Coca-Cola company that she worked with such distinction all those years. And I think her experience, the London Olympics, will serve her well as we negotiate the sponsor body, the ongoing agonising over restoration and renewal. And it has been said that Louise comes highly experienced with an extensive track record in business and public service. I've also not had an opportunity to meet Shiraz Horab, and I look forward to meeting him too again. I totally support what the Leader of the House has said about his background and experience, and he does seem to be ideally placed to join us in the House of Commons Commission, and I look forward to meeting him in time. And also to pay tribute to Jane McCall and to Rima McCarran. I got to know both of them, as you did, Madam Deputy Speaker, all these years in their service to the Commission, and I think it's worth noting that we all enjoyed working with them. They brought something special to the deliberations of the Commission, and I wish them well for the future. And I think we just got to, as we do this, just to pay notice and just pay, I think, a tribute to our external members of the House of Commons Commission. They offer a different perspective to perhaps the institutionalised view that we have as members of Parliament, and I think it's worth noting what they do bring to the workings of the House of Commons Commission, and we look forward to doing all of that as we go forward. And we're not going to get an opportunity to discuss, quite rightly, the appointments to the other bodies. And can I also welcome the member for Newcastle East? It's not often you could be a chief whip under 3 different governments and still be popular and liked across the House, but the Right Honourable Member for Newcastle East manages to do that with aplomb. And so I wish him well, and also to pay tribute to the Honourable Member who, I can't remember her constituency, but we all know who we mean, but she did such a great job in her other roles. So we look forward to working with that. But hopefully, Madam Deputy Speaker, get to business questions. Help me out, Leader of the House, so we can be here.
Speller. Thank you, Madam Deputy Speaker, and I'm mindful of the concerns from colleagues that they don't wish to be delayed for too long. And I have no animus or indeed any knowledge of either of the 2 individuals being appointed, and they may well fit into the glowing descriptions that we've heard, and I certainly hope so. And no doubt the Leader of the House will be pleased to sit alongside them as well. But I have huge problems with the process, because what seems to have happened to me here, as so often, or in fact almost invariably, with our selection processes, we determine the outcome and we narrow the outcome by the criteria that we select. It's like any other algorithm. If you set the criteria for it, it predicts the outcome that you are going to get. So we look at the criteria. Senior executive and leadership experience within a complex organisation. Already we're saying, basically, it's the corporate suits. Male or female, it's the corporate suits. Not people who've gone out and created a business and run out and created it themselves. Not people who've actually worked in industry and maybe run a factory and really know about running things. Or indeed, trade unionists who've also had to engage with complex issues. Or indeed, maybe those who aren't the senior management at hospitals, but maybe those who are running a ward, maybe those who are running a school. Those people don't get considered. When you look, every time we have a list of nominations, it's always those who've been in big corporates most of the time, and also then have sat on the boards of quangos and charities, and all the great and the good, and we keep reappointing them time and time and time again, and then we're surprised that this country ends up being so badly run. Because basically we're drawing from a very narrow cast, and we are constantly enabling them to perpetuate themselves, and not only them as individuals and their narrow range of experience, but also their general ethos and culture, and that narrow self-perpetuating culture, which I'm surprised, frankly, that the Leader of the House so readily accepts. I have another problem with it, and that comes in paragraph 14 of the report of the Commission to the House, or the Speaker to the House. Paragraph 14 says, in case of both candidates, the selection panel was satisfied that neither had undertaken any political activity within the last 5 years. I am absolutely fed up, Madam Deputy Speaker, with this assumption, again from this self-perpetuating elite that I've described, that somehow party political activity is somehow reprehensible, shabby, shoddy, and it's only those who will not engage in politics who are fit to actually be engaged in these running public life. I think it's very detrimental both to politics and to public life. And I will continue on all such occasions when this same rotten process continues to regularly raise it, because the public, as we've seen so many times, actually see through this arrogant metropolitan intellectual cultural elite and the way they're running this country, and yet again all the time we're playing our part in perpetuating its malign grip. As I said, I have no animus against the individuals concerned. I have huge objections to the process.
Leader of the House?
Thank you, Madam Deputy Speaker. Before I try and reply to the right honourable gentleman, the member for Worley, may I actually pay tribute and thanks to a most distinguished member of the Commission who has stood down in the form of the Deputy Leader, Deputy Speaker, I'm sorry. If I may say so, Madam Deputy Speaker, you have been a great person to work with on the Commission, always sensible, moderate and seeking consensus and not using it for a party political. Well, of course, as Deputy Speaker, you are no longer party political in these roles, and what fun it was being on the Commission with you, and to record our gratitude for the bacon sandwiches, which are particularly appreciated, and with thanks, I think, to your lobbying. May I thank the Honourable Lady, the Shadow Leader, and the Honourable Member for Perth and North Perthshire for their contributions and their support. I note the Honourable Gentleman's comments about Thursday mornings. Sometimes in this place a vote is necessary to get what you want, and it may be that that is what he needs to do. But to come to the very important points made by the Right Honourable Gentleman, the Member for Worley, I am not keen on the Metropolitan elite any more than he is. I tend to think that they have a set of views that are not particularly my views or the views of my constituents in rural Somerset. So I think his criticisms need to be considered carefully. First of all, the question of senior executive leadership. That does not exclude trade unionists or people who have worked in the public sector. That there are senior leadership roles and executive roles in bodies that are not big business. And indeed, this House has taken people who have not been involved with big business but have been involved in the public sector, and trade unionists would be welcome to apply. They obviously run complex organisations, and so I think that the suggestion that they would be excluded is unfair. But I think it's obviously right that this House expects people who have been senior in whatever they've done, and whether that is as an entrepreneur, as a headmaster or a headmistress, or somebody who's run a hospital, or as a trade union leader, or somebody who's worked for a big company like Coca-Cola, I think that is a broad category to have. On the question of politics, this is an issue that we have, of course, debated before. And I agree with the right honourable gentleman that being involved in politics is something one should wear as a badge of honour, that it is part of being involved in civic society, and that applies to all parties. It's not just if you're one of the major parties, or it's not even just if you're a good Tory like me. But whatever party you belong to, you are contributing to society. But there is inevitably a but. On the Commission, the politics is provided by members of this House, and that there is no point in trying to change the balance of the Commission from the balance in the House by appointing outsiders who are political. It is simply a question of appropriateness for the role that they are asked to fulfil within this House. And I think that is fair, that the members of this House can be party political if they want to on the Commission. It tends to work very well by consensus. But to appoint external politicians would, I think, border on the eccentric. I have great confidence in the two we have chosen today. I think they will be a real pleasure to work for. Yeah, of course, I give way.
I absolutely perfectly understand if he was saying, for example, that a leader, a political leader of a council, you might argue that might change the balance. Although if we're actually trying to get expertise, they would also have been used to running large organisations. As he rightly said, the Commission tends to work with a degree of consensus. It isn't divided. Many other countries actually manage to encapsulate this, where they appoint people to public bodies, but in the full knowledge and absolutely public that they have been politically active. I still don't understand why he thinks that should be a major debarring factor.
Madam Deputy Speaker, I hope I was making clear, I think it debars from the Commission, where there are the active politicians already appointed. It inevitably doesn't debar from other public sector appointments where it may be perfectly reasonable, and indeed where people may be appointed because of their connection to a political party if you're seeking political balance. But as I was saying, I have particular confidence in the two we are appointing today. I think they really will be first class and will make a considerable contribution to the Commission and to the work of this House.
Well, I thank the Leader of the House for his kind words, and it was a great pleasure to be on the Commission and very enjoyable working with all those who serve on it. The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. We now come to motion number 7 on the Parliamentary Works Estimates Committee. Leader of the House to move?
I beg to move.
Beg to move. The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. We now come to motion number 8 on the Speaker's Committee for the Independent Parliamentary Standards Authority.
I beg to move.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. We now come to motion number 9 on the House of Commons Members' Fund.
I beg to move.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. The contrary, no. I think the ayes have it, the ayes have it. We now come to motion number 10 on Information Commissioner Remuneration. Minister to move.
I beg to move.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think you need a bit more than just one person. Aye. Aye. Mm. If the objection is continuing, I think it's not Eve. I think it's about the division, not about an objection. I don't think there can be objection. We now come to.
I was saying no, and will I be right, therefore, that the division will therefore be deferred?
If the honourable gentleman is continuing to say no, the division will be deferred until tomorrow.
I think she's doing a lousy job, and £200,000 is far too much.
We now come to the motion on changes to Select Committee membership. Motion number 11, the Justice Committee. Member of the Committee of Selection to move.
To move on behalf of the committee.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. Motion number 12 relating to the Women and Equalities Committee. Member of the Committee of Selection to move.
About to move.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it.
I beg to move that this House do now adjourn.
The question is that this House do now adjourn. Mr Philip Hollobone.
Madam Deputy Speaker, what a joy it is to see you in the chair, and thank you for staying for the adjournment. Could I thank Mr Speaker for granting me this debate? Could I welcome the Minister to his place? And I welcome my honourable friend, the member for Corby, who is a superb representative for his constituents, but unfortunately, as he holds the high office of a government whip, is not allowed to speak in this place. Could I also thank all the staff at Kettering General Hospital, and in particular Simon Weldon, the superb group Chief Executive, and Polly Grimmett, the Director of Strategy. And I'd like to thank the Minister for the personal interest which he has shown over a long period of time in Kettering General Hospital. He visited the hospital on the 7th of October 2019. He responded to an adjournment debate on the hospital on the 23rd of October 2019 when he announced £46 million of new funding for the proposed urgent care hub, and who recently met on the 3rd of February this year with the hospital and honourable members for Wellingborough. I welcome honourable friend for Wellingborough to his place and Corby. And I'd also like to thank the Prime Minister, Madam Deputy Speaker, who spent 5 hours on a night shift at Kettering General Hospital in February 2020. Now, I welcome the Government's unprecedented investment in the NHS and its commitment to the hospital building programme, which has resulted in promised commitments to the hospital of £46 million for a new on-site urgent care hub, £350 million in Health Infrastructure Plan 2 funding for 2025 to 30, and a write-off last year of £167 million of trust debt at the hospital. However, promises are one thing and delivery is another. The problem that the hospital faces is that these two funding streams from the government, £46 million for the urgent care hub and £350 million for the phased rebuild, are not being meshed together by the Health Department and HM Treasury. And the danger is that as a result, the promised investment in the hospital faces potentially serious delays. The dilemma is this: if the hospital proceeds with the £46 million urgent care hub build as a standalone project, there will not be room on the site for the HIP2 development post-2025. On the other hand, if the hospital waits for the HIP2 funding, it will lose its £46 million urgent care hub funding commitment, and the urgent replacement for the hospital's overcrowded A&E may never happen. Now, I have 4 main asks of the Health Department and HM Treasury. 1. Permission for the hospital to draw down on the £46 million urgent care hub funding commitment so that work can start on the initial works required for the project. 2. Permission for the hospital to proceed with the preparation of its outlined business case for the HIP2 investment expected after 2025. 3. An early advance of £52 million spread over the next 3 years from the £350 million HIP2 commitment, so that the urgent care hub can be built not as a standalone project, but as an initial part of the phased hospital redevelopment. And 4, that the Secretary of State for Health honours his very welcome commitment made on the floor of the House earlier today in response to a question from my honourable friend, the member for Wellingborough, to meet with the 3 honourable members for North Northamptonshire to get these issues sorted out. As the Secretary of State said, nothing gives me greater pleasure than making stuff happen, so I would be very happy to meet to make sure we can get this project moving as soon as we can. Now, these 4 asks are not about asking for extra money over and above that which has already been promised. Instead, it outlines a sensible, flexible, dovetailed approach to already given funding commitments so as to A, maximise value for money for the taxpayer, whilst B, also ensuring that local people get to see as soon as possible the badly needed improvements to our local hospital which have already been promised. Simply put, the problem is this: building the promised urgent care hub is no longer an option on a standalone basis, because if it is built as a standalone project, there would not be enough room on the site for the subsequent HIP2 funding. So the value for money solution is to integrate the 2 funding streams. Kettering General Hospital is ready to go on this. It owns the land, so no land deals are required. No extra public consultation is needed. It has written support from local planners and the regional NHS. It is a phased approach that would deliver visible and real benefits. It is shovel-ready and has far lower risks than other hospital build projects. In developing this whole site plan, integrating the urgent care hub and HIP2 funding streams, the hospital has identified the best way of delivering value for money to get these buildings up and operating, serving local people. Now, Kettering Hospital is unique amongst the 40 designated hospital rebuilds scheduled to be completed by 2030. 1, it already has a government commitment for a new £46 million urgent care hub. and therefore its future funding is complicated as it comes from two separate funding pipelines. 2, it is ready to go with an innovative, phased, value-for-money rebuild on land it already owns with no planning or consultative hold-ups. 3, it serves one of the very fastest-growing areas in the whole country. 4, it has one of the most congested A&Es of any hospital in the land, which needs addressing as a matter of urgency. I don't believe there is any other hospital in the country that has these unique set of circumstances. I'd be delighted.
Thank you, Madam Deputy Speaker. Does my honourable friend recall that this project effectively started before the honourable member for Corby was elected in 2015 and has widespread cross-party support? And if this was a business, there would be no doubt that a prepayment would be made because it would save money in the end and get things done. Aren't we just caught in this silo of Treasury here, Health Service, and they've got somehow meshed together?
My honourable friend is quite right. This is not a difficult problem to solve. It requires a political solution, and it requires a decision by health ministers and Treasury ministers acting together. Now, Kettering General Hospital is a much-loved local hospital with 500 beds. It has been on its present site in the heart of the town of Kettering since 1897. That's 124 years. And there can't be many hospitals that have such a record. Most of the residents in the parliamentary constituencies of Kettering, Corby and Wellingborough have either been born there, as my honourable friend for Corby was, repaired there, or sadly passed away there. And there can be very few local residents who haven't accessed the hospital at some point over their lives. It also has a fantastically dedicated, talented and loyal workforce. Now, the pressure on the hospital is primarily being driven by very fast population growth locally. The ONS, the Office for National Statistics, shows that we are one of the fastest growing areas in the whole country at almost double the national average. The borough of Corby is the fastest growing borough outside of London. In the last census, out of 348 districts across the country, Kettering was number 6 for growth in the number of households and 31st for population increase, whilst Corby has the country's highest birth rate. Kettering General Hospital expects a 21% increase in over 80s in the next 5 years alone. The area is committed to at least 35,000 new houses over the next 10 years. That means a local population rise of some 84,000 to almost 400,000 people locally. The A&E department now sees up to 300 patients every single day in a department that is safely sized to see just 110. Every day, 90 patients are admitted into the inpatient wards from A&E, and over the next 10 years, the hospital expects the number of A&E attendances to increase by 30,000, equivalent to almost 80 extra patients every day. This is why the promised improvements are desperately needed. The big problem at Kettering is that the A&E department is full. It was constructed in 1994 to cope with 45,000 attendances each year. Now it has at around 100,000 attendances a year, which is well over 150% of the department's capacity. By 2045, 170,000 attendances are expected at the same site. The solution to that pressure is for an urgent care hub facility costing £46 million to be constructed on the site. It would be a 2-storey, one-stop shop with GP services, out-of-hours care, an on-site pharmacy, a minor injuries unit, facilities for social services and mental health care, access to community care services for the frail elderly, and a replacement for our A&E department. All the NHS organisations in Northamptonshire, as well as NHS improvement regionally, agree that this is the #1 clinical priority for Northamptonshire. The A&E department at the hospital was visited 5 years ago by Dr. Kevin Reynard of the National NHS Emergency Care Improvement Programme. Dr. Reynard said, "The current emergency department is the most cramped and limiting emergency department I have ever come across in the UK, USA, Australia or India. I cannot see how the team, irrespective of crowding, can deliver a safe, modern emergency medicine service within the current footprint." Now, I'm glad that the government has recognised the hospital's superb business case for this fit-for-purpose emergency care facility that will meet local population growth for the next 30 years. It's been developed with all the health and social care partners across the county so that patients can get a local urgent care service that meets all the government guidance on good practice, ensuring that they can get the care they need to keep them safely outside of hospital if necessary, and ensuring that if they come into hospital, they are seen by the right clinician at the right time, first time. Now, the Minister, in announcing the award of £46 million for the new urgent care hub in the debate on the 23rd of October 2019, said, "My officials in NHS England will be in touch with the Trust to discuss further details in order to ensure that funds are released and that work starts on the project as swiftly as possible. I am conscious of the urgency that my honourable friend, the member for Kettering, highlighted." Madam Deputy Speaker, that announcement was 20 months ago, and the hospital still has not had permission to draw down that funding. So that is why my first ask of the Government is to grant permission for this funding to be drawn down so that the project can start. Now, on HIP2 funding, I warmly welcome the Government's inclusion of the hospital on the list of 40 hospitals for this funding from 2025. That is important for Kettering because 70% of the buildings on the main hospital site are more than 30 years old, and there's a maintenance backlog of £42 million. 60% of the hospital estate is rated as either poor or bad. Now, the hospital plan for the redevelopment of the hospital site as part of the HIP2 programme offers a phased approach over a number of years, with the extra ward space provided by this funding to be built on top of the urgent care hub. This is in contrast to a number of other hospitals in the HIP2 programme which are seeking all-in-one-go funding packages. The hospital is not asking for its HIP2 allocation in an upfront £350 million all-in-one-go lump sum, but is seeking a modular annual funding requirement for what would be a phased and value-for-money rebuild up to 2030. Surely, out of a £3.7 billion national hospital rebuild programme, providing just £6 million to the hospital this year to get the project started and £29 million next year isn't beyond the wit of man. I know that the Treasury is currently completing a commercial strategy for all of the hospital rebuilds so as to A, standardise hospital redesign, B, secure key commercial efficiencies in procurement across the country, and C, to address the digital and sustainability requirements. Kettering General Hospital is fully committed to these Treasury objectives. Value for money is extremely important in delivering the hospital rebuild programme across the country. And if Kettering Hospital's innovative and sensible approach could be matched with sufficient flexibility in applying the relevant funding streams from the Health Department and the Treasury, then Kettering Hospital could be an exemplar hospital redevelopment which others could follow. Madam Deputy Speaker, I'm using this debate tonight to urge the Government, both the Health Department and HM Treasury, to do the sensible thing, dovetail together the two presently separate funding streams for Kettering General Hospital so as to not only optimise value for money for the taxpayer, but also to deliver sooner rather than later the urgent improvements at the hospital which all local residents need and wish to see.
Minister.
Thank you very much, Madam Deputy Speaker. And as ever, I congratulate my honourable friend for Kettering, the member for Kettering, for securing this debate about the redevelopment of Kettering General Hospital. I know it is an incredibly important subject for the honourable gentleman, my honourable friend's constituents, and therefore, for him, he is nothing if not a strong champion for the people of Kettering, as ministers forget to their cost in this place. And he works tirelessly, not just on this, but on many, many other local matters. And at the same time as saying that, I should also highlight the interest and passion on this subject of my honourable friend, the member for Wellingborough, who remains a friend as well as an honourable friend, despite him seeking to slightly preempt me and constrain me today by asking a question of my boss, the Secretary of State, a few hours ago in this chamber. And of course, my honourable friend, my friend, the member for Corby, who, as the member for Wellingborough quite rightly said, due to his elevated position as a senior government whip, is unable to speak in this debate. But I know from the interactions, the conversations I've had with him on many an occasion, Madam Deputy Speaker, just how passionate he is about this hospital project on behalf of his constituents. And I can reassure his constituents that while he may not be speaking in this debate this evening, I have had many, many lengthy discussions with him, and I suspect I'll hear from him many times in the future, although hopefully if I can offer some reassurance to the honourable member, the member for Kettering, he may be slightly less vociferous in pursuing me over this matter. Like the member for Kettering, I would join with him in paying tribute to the Chief Executive and the team at Kettering General Hospital for the amazing work they do. They have worked tirelessly throughout this pandemic for his constituents, for both my honourable friends' constituents, as well as day in, day out, year in, year out, for the people who live in that area. And as the honourable gentleman says, it's been an absolute pleasure actually for me to have taken a very close interest in this matter, and as he knows through his experience in this House, it's very difficult sometimes to say no to the honourable gentleman, which can get ministers into trouble on occasions, but he is extremely persuasive. Turning to the substance of the debate, Madam Deputy Speaker, I am delighted the rebuild of Kettering General Hospital, part of the Hospital Foundation Trust, is part of our plans to build 48 new hospitals by 2030, the biggest hospital building programme in a generation. And to kick-start the scheme, Kettering General Hospital Trust has already received £3.7 million of seed funding to develop its plans for the rebuilding of Kettering General Hospital. And just before I turn to the urgent care hub, my honourable friend, the member for Wellingborough, I think highlighted that plans for that had been mooted, discussed, possibly even agreed to before 2015, before my honourable friend and I joined this House. The difference I would suggest was that on that occasion there was no budget allocated to them. In terms of the urgent care hub, there is a budget allocated to that now following our announcement in 2019, following lobbying by my honourable friend. That funding will help transform the provision of urgent and critical care in this area. £46 million, he says, has been allocated for that project. My honourable friend asks, Madam Deputy Speaker, why it is that 20 months on since that debate, since that visit, and I remember them well and I'll turn to them in a moment, that money has not been able to be fully drawn down. I would say that this is in no way a criticism, it is because of the announcement of the new hospital programme, and the Trust has changed, quite rightly, what it would like from that, and therefore discussions have had to take place as to how those two funding streams may be meshed together, and I'll turn to that in just a moment. As he alludes to, the urgent care hub and the new hospital that is to be built share a set of common enabling works which have been factored into the new hospital development. As he requested, and as his Trust have requested, we have shown flexibility and agreed to mesh the two projects together if an appropriate way of doing that, including the funding, can be found. And as a result of this, the Trust is seeking to incorporate the urgent care hub delivery into the wider redevelopment of the site. This means that the UCH will now potentially be part of the first stage of building the new hospital, but he rightly highlights the opportunities, the synergies that exist, possibly for potentially better value for money, by looking at this in a slightly more holistic way than a Phase 1 and a Phase 2. And I know that's a point he's made to me and others. In terms of the drawdown of funding, what I would say to the honourable gentleman is that the £46 million is there. It's available subject to business case approvals and how those two funding streams can be meshed together in a single project. But in terms of the drawing down more broadly from the new hospital programme fund, as he'll be aware, we have a one-year spending settlement from the Treasury, and therefore if we wish to look into future years and start drawing down from future years' funding and making commitments, that is a matter for the Treasury and a future spending review. He quite rightly highlights, as I expected he would, the need for a synergistic approach between the Department of Health and Social Care and Her Majesty's Treasury. All of the new hospitals that will be delivered as part of the programme, including Kettering, are working with the central programme team with the support of regional, system and local trust leadership to design and deliver their hospital in keeping with this approach. And the central programme team and the new SRO, Natalie Forrest, who joined the team and took over leadership of that team at the beginning of this year, are working closely with the Trust on the new build at Kettering and considering all the options currently on the table. And I understand they've had productive meetings, and I look forward to them having further productive meetings. The programmatic approach will need to be carefully applied to these proposals, as for any other hospital within the new hospital programme, to see how we can best ensure value for money for the taxpayer through standardisation of design, the use of modern methods of construction, without unnecessarily constraining the ambitions of the trust plans insofar as that is possible. The central team, as I've said, will engage with trusts to maximise the application of these approaches to ensure that the scheme has manageable and realistic and indeed affordable costs. Funding discussions for these projects are ongoing, and final amounts will be determined through the established business case and Treasury processes. Just to slightly stray from the central theme, as the Honourable Gentleman will know, Kettering General Hospital Foundation Trust, as indeed he said, I believe, in his remarks, also received £1 million as part of the £450 million investment to help upgrade A&Es and to help the NHS respond to winter pressures and the risk of further outbreaks of coronavirus. This funding was used to support compliance with social distancing and infection prevention and control at Kettering. Now, in terms of interactions and conversations with the Trust, as I've alluded to, the Senior Responsible Officer, Natalie Forrest, met with the Trust on the 2nd of March of this year for a bilateral roundtable with their senior leadership team to discuss their proposed plans for the build, and I understand those discussions were productive and are ongoing. I also met with the Trust in February of this year with the SRO to discuss the plans for a new build at Kettering General Hospital, and as my honourable friend mentions, I was fortunate to visit Kettering General Hospital in September of 2019 to see for myself and be shown by my honourable friend that it is most persuasive what the case was for investment. And as he alluded to, I also had the pleasure of answering a Westminster Hall debate in October of last year on the need for the urgent care hub being funded and built in Kettering, when I had the pleasure of confirming the funding following on from the announcement or the promise made by my right honourable friend, the Prime Minister, to my honourable friend. And indeed, I know, and today is probably not the time in this debate to discuss it, but I know all three of my honourable friends have also highlighted the wider opportunities of combining health and social care for vulnerable adults in Northamptonshire. Madam Deputy Speaker, our ambitious programme to build 40 new hospitals by 2030 has confirmed funding of £3.7 billion at this point. This is an important and extremely positive start, but we do continue to work with Her Majesty's Treasury on future funding for the whole programme, including for Kettering, and the profiling of the availability of that funding. That is not the reason, however, that I am not at this dispatch box being gently lured by my honourable friend into a clear commitment today on firm profiling of financial allocations for Kettering at this stage. Rather, it's because deciding the funding level for a project of this scale at this early stage in the process, before full design, exploration or scoping is complete, would not be the most appropriate approach. But I do take his point about, for want of a better way of putting it, the need for speed. Our experience of government projects, and specifically the lessons learnt from the early work of the Chancellor's Project Speed Task Force and from the experts within the Government's Infrastructure Project Authority, tell us that confirming funding for large complex projects too early, before all parties are fully agreed on the approach for the future, can put the project and indeed the overall cost of it at risk. Now, I am not in any way questioning the ability of his hospital trust to come up with a costed and extremely effective project plan, but it's important, as he would expect, that we are conscious of the need to ensure we get value for money and the best outcomes for his constituents. Madam Deputy Speaker, in conclusion, I want to pay tribute to my honourable friend and the work he and my two honourable friends, members for Wellingborough and Corby, are doing to support the redevelopment of Kettering General Hospital. I know that my honourable friend, right honourable friend, the Secretary of State, gave the commitment to the honourable member for Wellingborough that he would meet with him, and I know that he will honour that. I would reiterate my commitment that if at any point at perhaps a more detailed or granular level, if he wishes to meet with me or the SRO again, I am very happy to do that. And perhaps as we see progress made in opening up our country again, I might be able to enjoy the pleasure of returning to Kettering to come and see him and his hospital trust in person. And I look forward to continuing to work with him to make sure this ambitious and innovative approach to building new hospitals is a success. He rightly is incredibly proud of his team at Kettering. He has, and his colleagues, have done a fantastic job of gently inducting me into quite how fantastic the team are there and what is needed to get this project going. It was one of the first visits I think I did when I became a minister holding this role, so I have a particular affection for that area. I'm in the East Midlands as a Member of Parliament myself, so I know it well. So I hope that we will continue to be able to work hand in hand with his trust, the national programme and Her Majesty's Treasury to move this project forward at pace. I know it's what he wants, but most importantly I know it's what his constituents would want and expect of us. Thank you, Madam Deputy Speaker.
The question is that this House do now adjourn. As many as are of that opinion say aye. Aye. The ayes have it. Order. Order.